Settle down fast, please. So let us start the program with a rapporteur's report for the yesterday program. It will be by Dr. Prashanti from Pathology Department, because there are two Prashantis. I am telling the department also. And it will be, afternoon session will be by Rajendra sir. So he will be joining by the time she completes. Okay, please come.
Types of groups, mainly the informal groups, formal groups, functional groups and the effective groups. Yesterday most of us have written the pre-test. I think including me, I don't know among others, I might get 0 because one of the MCQ I remember was regarding the effective groups, which was a diverse group of people with complementary abilities. This was one of the MCQ. And ma'am has also discussed about the group roles. Regarding the participants in the group, like leaders, a leader should be there, a recorder should be there, a timekeeper should be there in a group. And also ma'am has discussed about the Tuxman's 5 stages. This was also one of the MCQ in the pre-test, which includes 5 stages, that is forming, storming, norming, performing and adjuring. So these are the 5 stages. And ma'am also discussed about the advantages and disadvantages and the limitations of the group dynamics. Okay. This was the first topic. And the second topic was discussed by Dr. Fanindra sir, which was the learning process, learning domains and the principles of adult learning. In that mainly the Bloom's 3 domains of learning, that is cognitive, affective and the psychomotor. These 3 domains have been discussed, and examples were given for us and we could solve them, most of us. And sir also has dealt about the differences between the adult and the child way of learning, that is andragogy and pedagogy. Most of us has clearly known how to deal with adults, since we are dealing with Indian medical graduates, that is MBBS students. All of them are adults, and how we should cope up with their adult learning, we have learnt very well. And the third topic was regarding the goals, roles, competences, learning objectives in CBME, which was dealt by Dr. Shabnam ma'am. And in that we have seen about the origin and the goals of NMC. The main thought behind this workshop was every one of us should know about the CBME curriculum thoroughly, and that was the main aim. This was dealt in this chapter thoroughly. In this we have, ma'am has detailedly told about the competency table. I think most of you have remembered, that is the subject followed by the number and the description of the topic, which is then followed by a core, how the competency, what competency is required, that is know how to teach, that is student knows or knows how, or skill that is taught in that. And also the competency table includes whether it is core or non-core, and also along with the integration. That table is very, very important, because each and every chapter which we teach to the students should be started with the competency only. We need to mention the competency before starting the PPT. The first slide should be the competency number actually. So I think most of us are now able to understand what competency number and the description really matters. And then we have learnt about the specific learning objectives, that is ABCDs. We were given tasks and most of us have done very well. And following that we have the fourth topic, which was teaching learning methods, including the interactive teaching methods, which was dealt by Dr. Suresh sir and Dr. Venkat sir, which was excellently taught. The interactive sessions are dealt by them by interacting with each other themselves. In that we have learned mainly about the teaching methods, which includes the large group and the small group methods. In that classification mainly is based upon the domains as well as the group size and the context. And we have also learned about the what lecture is, advantages of a lecture, disadvantages of a lecture, which is the most common method which we follow. And also we have learned about the role of a medical teacher. And interactive lectures, as I told, most of us have done very well. We have interacted a lot, we have done role plays, We are being asked many questions. So that is how even in the class we should interact with the students and come up with new questions or make them involve more in the class rather than making them just sit idle. Okay? This was a forenoon session. Thank you for giving this opportunity, ma'am.
Thank you, Dr. Prashanti. I think recap for the morning session is done very well. Sir, Dr. Rajendra sir, please tell us about afternoon sessions, including lunch, sir. Including lunch. How it was?
Yeah, good morning everyone. Nice meeting you everyone again today. Starting with the lunch, actually the food is not good. Frankly speaking, as they asked me telling, chicken curry is extremely bad. But some of the curries are okay. Something carry on. Pappu and sambar. Anyway, post-lunch section started with small method group teaching. It was, yeah, the small group teaching methods, different methods how a small group can be, involved and how teaching can be better. That we can deal with by, that's dealt by Dr. Kota Sureshkar and Dr. Venkat sir. And different things how we can make better, that by seating arrangements, flip-flap teaching method, different projects, snowball groups, pyramiding, sharing the knowledge, all these kind of things has been taught yesterday post-lunch section. And then followed by a role play model. That's been the first one was done by the Dr. Sanjay sir and his team. Initially I was very tensed because when the patient told I will put a case on the physician, then I thought that the psychiatric practice is very difficult. Then later when patient was very facilitated, then I thought psychiatry is also extremely good. So that was actually, it's a good thing that how patients are benefiting by the role model, and students also should know how the diagnosis and management of schizophrenia exactly happens. And another one was played by Prashanti Square. Prashanti madam is here. Very nicely done regarding the HIV counseling in various scenarios. We commonly see that scenarios regularly, the same way like cancer, bad knowledge, when to explain about a bad thing that happens to a patient, that's also extremely, this is the same way about the HIV in different scenarios. So that was nicely dealt. These are all very emotionally and very sensitive issues. So to convey them takes a really, we need to go in a very judicial, slow manner. That was extremely well done. And then assessment introduction by Dr. Tanveer madam. There were a lot of assessment we need to do regarding these domains. And then different methods of assessment like written test, practicals, clinicals, skill examination, etc. Then after that it is followed by validity of testing format, all the four formats, how we will validate all the four domains. And then and what are the factors influencing the validity, like education impact, utility assessment by various methods. And then final was assessment testing by Dr. Madhubabu Garu, that like formative assessment for the students short run, like slip test or 1 month or 3 months like that. And then internal assessment every 6 months or 3 months, and then finally by summative assessment. That's okay. Thank you.
Thank you, sir. If anybody wants to add any more points from the yesterday's session, you can add. Yesterday, if you feel you want to add few more points. Sir, thank you, sir. Lunch has not dominated the learning sessions. Sometimes they will tell lunch is good. They will forget about learning sessions. That's why I asked you about including lunch. Sir, in Portico there are many cars. It seems there is no place for vice principal's cars. So those who have placed their cars, please go and shift the cars. Because those who have parked their cars in the portico, please, there is parking place, separate parking place for the other cars. So today, any more views for yesterday's session? Small group activity, because you are going to take small group sessions, many small group sessions in your department. It should be effective means you have to follow all the guidelines which are given yesterday. So today's sessions start with outcome. Who can elaborate, expand that outcome? Almost everybody must know this because 2019 only we have started. So you have to know this. What is? Very good. What is outcome? Okay. Attitude, ethics and communication. Which domain it belongs to? Yesterday there are three domains. Effective domain. It comes under effective domain. So now in volumes when they have given that curriculum, they have mentioned KSAC instead of cognitive, psychomotor and effective. They have given knowledge, skill, attitude and communication. Okay. So these outcome sessions, how you are taking for your students? Already it is going on, isn't it? I want your version. How is it taken? How effective it is? In what method you are using? What are the methods you are using to take outcome session? Anybody from this group? No? Not have attended any outcome session? Your group? Anybody has attended outcome session or taken outcome session? From this group? This group? Yes? How to counsel patient? One point.
How to respect the sample, patient sample.
How to respect the patient sample? Very good. Yes, any other point? The questionnaire also is a must. We have to ask one question for them in theory, practical. You might have evaluated papers, no? There also outcome question you will be correcting, evaluating. Then without knowing, how are you evaluating? Confidentiality. Confidentiality. Very good, sir. Anything else?
To break the bad news, how to
Very good.
disclose.
Who told about the bad news? Yes. How to break the bad news. Very good. So many things all of us are following during our regular sessions, and for outcome also number of hours distributed during our teaching sessions. Okay, we have to allot according to NMC mentioned schedule for outcome. Number of hours for each phase is given and we are taking that. And in exam also, assessment also, yesterday we have told outcome question, 5-mark question is compulsory in theory, and even every subject, every paper, 5 marks will be in outcome. That is NMC guidelines. Okay. What is the method we use? Yes, yesterday we have discussed many teaching learning methods. Okay. Among that, for outcome, which method we choose? Small group, Role play, excellent, sir. Any other? Yesterday list. Bedside teaching. What will you, in bedside teaching exactly, what learner will learn from the bedside teaching? Rapport, how to get the history taking, mainly it is communication skill only, how to extract by probing questions, even the age they will not tell truth otherwise, isn't it? We have to get the age also, proper age also they will not tell unless we probe, not always, sometimes. Any other situation, any other scenario you think about for outcome session? Any other? Where else we counsel the students? Student counseling we do or not? Do we counsel the students or not?
Yes, ma'am.
When do we counsel? Less marks. Only that time? If they are under stress management, when is it dealt? Stress management. Yes? During exams they may face stress, but usually in our curriculum it is given during foundation course. Okay? Suresh Kumar sir always take for every batch during foundation course only stress management, and most of this how they will be going for this environment. So that also it will be done during foundation course. So the many teaching learning methods about outcome we have told already, and recollect yesterday's role plays. What were the scenarios was done for HIV? There are actually three scenarios were done for HIV. Yes. First of all, she didn't allow that delivery at the hospital. Then she was counseled and convinced to take the treatment in the hospital and hospital delivery. Then what else? What else was done? To get it at the test done, to give the sample for testing. Then her husband.
No, ma'am. Another case, he is educated. Another scenario, ma'am. First
Another
one is
scenario.
uneducated village girl, lady with pregnancy positive, and second situation is educated guy.
Educated
Suspicious
guy,
of-
he
because
doesn't
of
want to
high
get.
risk behavior. He is volunteered for this test, but
Okay.
is not willing for a
Willing
blood
to get
test.
the blood test.
Yes.
He wants any other test than the blood test. So in these scenarios, we have to, what we have to do actually? Counseling. See, counseling we all know. But this counseling part, we have to impart this to our learners, our students, what they are supposed to do in those scenarios. We have to impart that knowledge. Okay? If that same scenario comes, what this learner, he is going to be a doctor, isn't it? How he is going to act, all this, it is through role plays. Through role plays, we can tell. This is one of the teaching method. Okay. Previously it was not there. Outcome is not there. Before this 2019, it is not compulsory. Though some of the institutions are following, it is not compulsory. So, are we not doctors? Didn't we follow any communication skill? Seniors, we have learnt. How did we learn, sir?
Came naturally while working in the wards.
Naturally, by birth only.
In the working in the wards.
Naturally acquired skill.
Yes, ma'am, while we are interacting with the patients, we learn automatically.
Automatically it has come.
Yes, ma'am. Teachers used to tell.
So what is it known as, sir? Yes, teacher. Teacher you are telling. So you have observed your teacher. That is known as role model. So for other batch I am telling, we have to be in time for asking students to come in time. Okay? So that is how we have to practice first what we are telling. Otherwise there won't be any meaning in that, and they will value also. So these objectives of this session is understand how to implement outcome in institute using various teams and apply innovative methods in teaching and assessment of outcome competencies. I have told you already, there is already guidelines are given by NMC how it has to be done, and outcome module I have shared to you all in the group. That module is there in the website of NMC. The competencies and how many hours should be taken for each, assessment method, objectives, everything is laid down there. We have to go through first and we have to follow accordingly. So GMR 19, now the 2023 guidelines we have to follow, that also I have shared, because some changes they have made, small changes, that we have to follow now. That NMC circular also I have shared to you in the group. Please go through once, because they have given the schedules, how it has to be done, outcome, who has to take, which module will be done by whom, and all is there. Indian medical graduate is one with 5 identified roles: clinician, leader, and a member of healthcare team, communicator, lifelong learner, and professional. So as a member of health team, we have to take one session in outcome. How you take that? Being a team member, how we have to teach our students how to be a team member. Why is it so important? Why they have mentioned specifically? Can we do the healthcare alone, sir? We have paramedical staff, we have other attendants, many healthcare professionals are there with us. Nursing staff is there, technicians is there, scavengers are there. Without anybody, can we run a hospital? No, everybody's role is important. How to communicate with them, how to behave with them, all this is also essential. Not only with the patient, not only with the patient attendants, how they are behaving with the other team members. This is our team. Doctor, nurse, technician, all these healthcare professionals are a team. Without anybody, the complete service cannot be done. And approach also, holistic approach. We are not only clinician, communicator, leader, lifelong learner, and professional. So most of the outcome goes into professional behavior. Okay? So some of you are assistant professors, some of you are professors, some of you are administrators maybe. So in that role, how you are doing that profession, how you are maintaining the hierarchy, all these also will come under professionalism. Okay? Teaching and learning medical ethics, behavioral science, and communication skills and managerial skills have not received due attention in the traditional medical curriculum. We have all studied in traditional medical curriculum. We have also learned by looking at our professors or by looking at our teachers. They were taking the history and we have observed how they have done. How they have palpated the abdomen without rupturing the spleen. Have we observed or not? Did we observe or not? So like that, by observing, by giving respect to the patient, by calling him and giving assurance, developing trust that we can heal. We can relieve him from the pain, the trust development. All this is by attitude and communication. That we have learned from our teachers. So this we call it as a hidden curriculum. But it was not there in assessment. That it was not there in assessment because we are not giving in the assessment. The communication skill was lacking and many incidents happened where the doctors were beaten up and hospitals were destroyed. All this, they found out that it is a lack of communication skill among the doctors. That is why they have introduced outcome as a special entity and given importance in the assessment also. Unless it is there, assessment driven curriculum, because unless it is there in the assessment, they are not learning. That is why they made it compulsory that outcome question should be there. Unless it is, even practical, we have outcome. Outcome session is there in the practicals also. Sir, without looking at that, you have to tell now the roles of Indian medical graduate. Yes? Clinician, communicator, leader, lifelong learner, professional. Very good. All of you are attentive. So the same thing is given here. Now the professional who is committed to excellence is ethical, responsive, accountable to patients and community and profession. Most of the things you have told already, where attitude, communication is very, very important, and yesterday's role play scenarios you can think about, recall. And breaking the bad news, that is also very, very important. That means somebody, if HIV positive or cancer is diagnosed, and to reveal, how to reveal the news. Because sometimes hearing that only, the scream from patient attendant or sudden collapse from the patient also may be seen. So how we have to reveal the news? That also the stepwise procedure they have given, that you can go through. In the material it is already given. So, forerunner of competency based module. This is the important thing, the curricular change which has come in the new curriculum, the most important, I can say. Otherwise, the other part of the curriculum is almost similar. The outcome is the additional and foundation course and outcome and electives, early clinical exposure. These are the some things which are new for the new curriculum. So, in outcome module, conceptual framework is given to help institution and faculty to help implement longitudinal program. Longitudinal means throughout the till exam date, every week one session or every month one session. But we have to complete the number of hours allotted for outcome. So in our teaching schedule, we have to give some time, allot some time to complete the outcome sessions. Competencies in attitude and ethics and communication to be used across all professional years, faculty from all subjects. See, this module is given and I have shared. Please go through that. You can see your phones now. You can open the outcome module. It is there. Outcome module. This is given in NMC website. I have shared in the group itself. You can see this is what why they have given, to help the faculty to take the sessions. So how it is divided is, you can see that what I am telling here is there in the module. Okay. So number of modules are 5 in first professional year, number of hours are 34. And number of modules are 8 in second professional year and 37 hours are given. And what we do in second professional year is every second Saturday 3 hours we are taking, and it is distributed subject wise according to the schedule given in 2023 guidelines. And who has to take what also they have given, means microbiology, what competencies should be taken, pathology, what competencies should be taken, and pharmacology, what should be taken. Learning modules for professional year 3 and learning modules for professional year 1. So these are the number of hours allotted. In the 2023 guidelines, it might be slightly changed because the period for part 1 is changed now. So outcome competencies are given. So domain given is knowledge here. And Kh means what? Knows how. So this is a level of knowledge. Knows is to recall something, to list out something, to define something. That is knows. Knows how means to interpret something, to describe something, to explain something. That is under knows how. So in undergraduate we will deal only till knows how. And for postgraduate curriculum even more are there. These are like 44 to 54. These are domain is S. The 4 are S and others are SH. What are they? S is shows, H is shows how. So which is higher level, S or SH? SH is higher level. So based on that retention level also increases. Okay, knows only, the retention level will be very less. But how, when they show how, retention level is higher. So competencies are 39, non-core is 15. Non-core means it will not be asked in summative. So how it is mentioned is Y or N. Y means it is core, N means it is non-core. That is the letter given in that column, core or non-core. In your volumes if you go through the competencies. And catering to communication, attitudes and bioethics. So some competencies span over the entire curriculum depending on the objectives in every phase and multiple domains, because same thing, communication skill, one will be there in first professional year, second professional year again, communication skill 2 will be there, like overlapping will be there. According to our scenarios we will plan. So related to our subject we will plan. Okay, the scenario we can design, how it can be taught. Bioethics, the 4 cardinal principles like autonomy, beneficence, non-maleficence and justice. These are bioethics which we are taking. And as I have told you, role modeling, mentoring, all this comes under professionalism. In professionalism, attitude, communication and ethics will play a major role, and role modeling, as sir told, we have learned from our seniors how they take the history, from that how we tell the news. All these we can follow the tips what they provided in the module. Explicit teaching, opportunities for experiential learning and reflection, this module helps. These are the learning module for professional year 1, and here they have given like how to respect the cadaver also, because that's a completely separate session, because cadaver is our teaching aid and we have to respect somebody's body they have donated for learning. So the respect should be given. We have to tell about the individual who has donated and virtues of those people and sacrifice. All this we have to tell them. A separate session should be taken in the professional year 1 itself. Year of study professional year 1, hours 8, 6 hours plus 2 hours self-directed learning. So we will, self-directed learning means the session will be taken by next session is on self-directed learning. It is not purely learning on their own. It is only 10% of the whole curriculum is self-directed learning. We need not give more importance to that. Actually, nice to know area only we give them as self-directed learning. So what we do, we give one topic like history of microbiology. We may tell that there are so many important laureates and all we tell, but there is so much to learn about the history of microbiology, medical microbiology. We ask them to probe into the history. We can give that to study at home and bring like assignment. So next week when the class is there, we can ask them, what are the other Nobel laureates in medical microbiology? What are the milestones in microbiology? Some questions we can ask to find out how much, whether they have explored or not. Exploratory session for 1 hour. This is how self-directed learning will be taken. And facilitated panel discussion for 2 hours, self-directed learning for 2 hours, and introductory visit to the hospital for 2 hours, discussion and closure. Means these are the things which have to be followed in this 6 hours plus 2 hours self-directed. 2 hours is not during working hour, which is there in the hour schedule. We need not mention those 2 hours. Okay, only 6 hours that should be planned in our teaching schedule. That is why they have mentioned as 6 hours and 2 hours. So all the other thing, that hospital visit and all, we have to impregnate somewhere in our timetable. This is about self-directed learning. And reflections also we have to ask, and at the end of the session we have to get from our students what they have learned. Whether objectives, what we have laid down in the beginning of the class, whether they are achieved or not. Okay? Case studies in bioethics, that case scenario, some of the case scenarios are given in the module itself, and there are so many CBME textbooks have come up and they have given so many case scenarios. You can put them in the order in every department. You can take the relevant case scenario for you when you take the sessions to discuss. It is not a lecture. Various means the teaching method we have told already. We have to means that the impact should be there. Means students should learn that. So if it is only lecture, that imparting the knowledge of professionalism is difficult. We have to be role models. And skit, we can ask the students to play a skit, good doctor, bad doctor, how the behavior is there. They might have heard some doctors how they behave. Now we asked students actually to play a skit and they have played very well. One doctor, without looking at the patient's face also, writing down the what is your problem. So write the investigations and go for the lab. He doesn't remember the patient face also, whom he has seen. So that is how some doctors are. So students have played that skit. And how the good doctor, immediately the same students have played how a doctor should be. Because it is not that they do not know. That is why they have to be treated like adults. Why adult learning is so important is, they know what they want to learn. We have to guide them. Case studies in ethics. Other learning modules are, what does it mean to be a patient, the doctor-patient relationship, foundations of communication, cadaver as our first teacher, the foundations of bioethics, healthcare as a right, what does it mean to be a family member of a sick patient, dealing with death, case studies on patient autonomy, decision making, confidentiality, legal and ethical situation, doctor and industry relationship. This you know very well, sir. Our farmers and the medical representatives, how they come and give gifts and all, it is against NMC guidelines now. We should not encourage such thing, because to promote their drug they will give so many things, attractive things like the tour for conferences and all they will give, but we should not accept such things. That we have to tell our students. And legal and ethical situations, so autonomy and decision making, any general medicine or pulmonology, intensive care, anybody is there here? A patient who is on ventilator. So patient is collapsed, he is on ventilator. You know that even on ventilation it will be continued like that, but there is no chance of improving. So the decision making here, how you have to convince the patient. So ventilator should be removed, the decision should be taken by them, we cannot decide, isn't it? So that how to convince the patient, that we have to tell our students. How it is being learnt now. Means traditional curriculum, how we have learnt, how it is learnt now is ATCOM module, as I have told you, the schedule and all we are doing now. But how we have learnt, how it was learnt earlier is as hidden curriculum. Hidden curriculum. It is there earlier also. We have all learnt, but it is not there in the curriculum. It is not assessed. So teaching ATCOM, how it has to be done, who has to teach, what should be taught, when it should be taught, how it should be taught. Everything is there in the module. If you open the module, everything is there. Objectives are there, you need not prepare objective. You need not think about the method also. Method also is given. Assessment method also is given. How many hours it has to be taken, that also is given. Everything, like spoon feeding only. Everything is given. What should be taught and learnt? Ethics, decision making, moral reasoning, empathy and communication. Empathy, I was telling yesterday, what is the difference between empathy and sympathy? Can somebody tell once again? Sir was telling yesterday. Being in their position is empathy. Sympathy means outside. Jali padtam. Ayyo papam. That is not required for them. We have to feel how much pain they are having. Then that is known as empathy. Communication. How should professional be taught? Common aspects and contribute to planning educational activities for professionalism are motivation. It may be self-driven or intrinsic. This intrinsic motivation means it will not go easily. Once it is intrinsic motivation, it will go. Means it will be there with them. How they have chosen MBBS only? Because from school age only, they will be having in mind that I have to be a doctor. If you see the interviews, the rank holders, how they speak, I want to become a nephrologist, I want to become a cardiologist, like that, because they have that. That is intrinsic motivation. With that they have come. Extrinsic motivation means, why you have all come for this workshop? Because it is required for the promotion. This is extrinsic motivation. So we hope end of workshop that will convert into intrinsic motivation. Converted already? Very good. Thank you. Observation of role models and continued stimulus to be thinking about these aspects. This should be not only for the particular session, during their professional life, they have to be like that, they have to learn. See, our students, how they behave, who will be giving the feedback about them, how the doctor is there, who will give the feedback, how the curricular changes will take place again. Who will give the feedback? From where feedback is taken? Systems approach, what is told is input, process, output. Output is a medical graduate. Again, depending on the quality, the feedback, again, input, the curricular changes will be there. That is the educational spiral, isn't it? So, who will give the feedback? From where we will get the feedback? Community. They are the people who has to tell. The doctor population who are coming out is good or not. We are waiting for this 2019 batch. What feedback we will get from the community. Because when they go for practice, how they behave, not only in the college, when they go out into the community, how they will behave in the true reality, real-time situation. That is the true feedback. And from internship onwards, we have to start that 360 degrees feedback we get. From whom we get? From patient attendant, the sweeper who is there in that ward, and technician as a team member, the respect he is getting or not. All this feedback from everybody we have to get. That is 360 degrees feedback. Feedback, reflection and reflective practice, and extrinsic motivation. Extrinsic motivation means we have to give something. So, for that bonus, they will be, means if you complete this only, if they complete that ethics class only, the completion certificate will be there. All of us know that, isn't it? So, that is extrinsic motivation. Unless it is completed, they will not get the certificate. Sensitization and immersion. Sensitization means orienting students to the concept of professionalism and importance. And immersion means expose them to the situations, hypothetical. That is how we have to create some scenarios. All types of scenarios they may not get. So we have to create, we have to design a scenario and teach them. They may face it later. Provide time and opportunities for reflection. So following exposure to the situations and experiences, it is equally important to provide a conducive environment and then create opportunities and provide dedicated time to reflect upon them. So we have to take the feedback from the students also. So how we will know otherwise, how much they have learnt actually. So we have to see how they are practicing. We have asked them to play a skit. They have done very nicely. So we have understood. So they got the idea how they should not behave. So interactive lecture, brainstorming, clinical scenario. Brainstorming is one stimulus, one question which they will think about. We are taking into the stream which we are talking about. That is brainstorming. And brainstorming can be used as that starting of the lecture also. We can use some brainstorming question so that they will be taken into our scenario, whatever class we are taking. Clinical scenarios, reflective exercises, feedback, portfolios, role models. What is portfolio? Have you heard about that? Portfolio. So whatever we are doing, if it is documented, that is portfolio. It should be documented. Whatever sessions we have done, whatever sessions we have learnt, that should be documented. So later on, like log book. So if it is done like a portfolio, that will be assessed. We can grade them based on that. Assessment of professionalism. Why it should be there? Positive acknowledgement of exemplary professional behavior and punitive action for unprofessional behavior will drive home a message well. If somebody wearing a chappal means ill behavior near cadaver. Did you experience any time? Bad behavior near the cadaver. So this is the starting session. If somebody does that, pictures also come to public, that videos are also have come, means with their hand, their means some cigarette was held, something, some abnormal acts they have done with a cadaver. So that unprofessional behavior, if you see such things, some punishment should be there for any unprofessional act, so that others will learn. And professional behavior should be given some very good. Appreciation is sufficient. If you appreciate, that is sufficient for them. The whole class, their behavior is so good. If you appreciate, that is a most of the things we observe is during internship. So how we assess is, see, multi-source feedback, as I have told you, 364 degrees feedback from healthcare outcomes and critical incident reports, all this. Frequently they are getting the needed grades. About. This is assessments, how outcome is assessed. Assessment plan. One question in each paper in all subjects. That's what we told yesterday also. Dr. Madhubabu sir, when he was telling, he has told how the questions are given in the outcome. Internal assessment also outcome question should be given. Actually, pre-final examination should be exactly like university exam. And log books should be there. In log book, if you go through, they have given the professional behavior also is given there. Like submission of record in time also is a professional behavior. Coming to class regularly is professional behavior. If they are irregular, it is unprofessional. Practicals and clinicals, teaching and learning sessions is begin early, diverse settings and contextual, relationship centered, integrated with curriculum and knowledge practice, role modeling, all this which we have discussed till now, it is to summarize the whole thing. And assessment, continuous, contextual, integrated in curriculum, predominantly formative, and multiple tools, feedback with reflection. So these are the tools for assessment. Conduct of outcome and institutional level, the steps. So identification of coordinator for outcome. What we do usually? What we do? Outcome class is given. Means this is the session taken by particular department. What is your department, madam? Pulmonology. Pulmonology is not there for students, UG students. So, general medicine. So if one outcome session is given to you, how do you plan? How do you plan in your department? So planning before the class. Before the class, how do you plan? That is what is given here. Identification of a coordinator for outcome. Outcome is not a single session. It will be coming, means every second Saturday you may get 2-3 sessions. So one coordinator for that to plan the sessions, and identification of the group of facilitators with the lead for each module, creation of a team for each module, longitudinal implications, and preparation of faculty guide. Sir, it is not so difficult because the module is there for you. It's a very good guide. All these objectives are there, assessment method, teaching methods are there. What we have to do is what the instructions given by them. To select the volunteers to do the role play, this is what we have to do. And design a case scenario. That is what we have to do. Depiction in the timetable means we have to mention that particular session should be for outcome. Training of lead and faculties of the MEU team. You can always take the help of MEU team. We are there. Here our resource faculty, and that is MEU members. And preparation of learning resource material, conduction of sessions as per guidelines and timetable, assessment in theory and practical. So in logbook also the reflections are there. So what happened? So reflections means always 3 questions. What happened in the session? So what? Then what next? What you want to do? So about this workshop, till now whatever you have, can you tell the reflection? Any of you? Any of you? Please volunteer. One person can tell. Reflections about this workshop. Till now whatever has happened. Reflect. Students also are like this. Nobody will come up if we ask like this. Yes? Group activity. So reflections means 3 questions. What happened? So what? What next? This you have to tell. Now you are the learner. So I am a teacher and you are a learner. You have to tell in this particular workshop what happened till now. Teaching, learning methods and all you have learnt. So what? So what we have learnt is learnt. So why we have learnt? To improve our teaching skills. Okay. What next? You have your learning skills, you have learnt, knowledge is there, skill is there. Now what next?
How to?
Implementation. Very good. So you have reflected very well. Thank you. So this is suggested reading that is there in your material. You can go through. So this is resource. All the resources are from regional center, from NMC approved material. So you can go through each. That is why we have given the material. It cannot be learned at a time. Go through all the material which we are giving. Thank you. If you have any doubts regarding outcome module, preparation, planning, you can ask. Because our medical wing is separate. So education department should take care. So that work we cannot do, sir. Because recommend, NMC can recommend. Sir, previously Bala Vikas used to be there. When we are in school, Bala Vikas is there. So how they have to behave when a guest comes and all that.
So good morning all of you. So we have gone through the session outcome. In that madam has told that we will go for my topic is on SDL. SDL means self-directed learning. So when SD has started, మన చిన్నప్పుడు ఎప్పుడైనా SDLs చేసామా? మన చిన్నప్పుడు ఎప్పుడైనా SDLs చేసామా? ప్రాజెక్టు ఇంకా అసైన్మెంట్స్ అంటే అది హోంవర్క్ కింద వస్తుంది. సైకిల్ లర్నింగ్ గుడ్ ఎగ్జాంపుల్. స్విమ్మింగ్ అంటే కోచ్ కావాలి సార్. క్రికెట్ అంటే మనం గల్లీ క్రికెట్ వాడు ఆడాడు చూసి నా ప్లేయర్ వాడు. సో
ఎలా వాడాలి, కంప్యూటర్ ఎలా వాడాలి.
ప్రజెంట్ అయితే పిల్లలకి మనం చెప్పవసరం లేదు, మనకన్నా హై నాలెడ్జ్ ఉంది కంప్యూటర్ ఎలా వాడాలి, ఏ యూట్యూబ్ ఎలా ఓపెన్ చేసుకోవాలి, ఏ గేమ్ ఎలా డౌన్లోడ్ చేసుకోవాలి. సో ప్రజెంట్ ఇవన్నీ సెల్ఫ్ డైరెక్టెడ్ లర్నింగ్స్, మనం ఏం చెప్పవసరం లేదు వాళ్ళకి. మనం అప్పుడు సెల్ఫ్ డైరెక్టెడ్ లర్నింగ్స్ ఏమి ఉండేవి, ఎస్ఏ కాంపిటీషను స్కూల్ లెవెల్స్లో, మనకి ఎలక్ట్యూషను, ఇలాంటివి సెల్ఫ్. మనకి ఒక టాపిక్ ఇచ్చేవాళ్ళు, రాసుకొని రమ్మనేవాళ్ళు, లేదా కాంపిటీషన్ పెట్టేవాళ్ళు, లేదా డైలీ ప్రేయర్లో ఒక హాఫ్ అన్ అవర్ అలా చదవమనేవాళ్ళు. సో దాస్ ఆర్ ద సెల్ఫ్ డైరెక్టెడ్ లెర్నింగ్స్ ఇన్ అవర్ స్కూల్ టైమ్స్. సో ఇక్కడికి వచ్చేసరికి యాట్కామ్లో మనకి సెల్ఫ్ డైరెక్టెడ్ లెర్నింగ్ టు ద ఎంబీబీఎస్ స్టూడెంట్ అన్నారు. వాళ్ళని కొత్త టర్మ్ ఇచ్చారు, ఐఎంజీ అని. ఐఎంజీ అంటే ఇండియన్ మెడికల్ గ్రాడ్యుయేట్. సో ఇండియన్ మెడికల్ గ్రాడ్యుయేట్కి మనం సెల్ఫ్ డైరెక్టెడ్ లెర్నింగ్ ఏం చెప్తాం. సో వాట్ ఈస్ డెఫినిషన్? ఇన్ 1975 Knowles has given the definition, a process in which individual take their initiatives with or without the help of others in diagnose the human and material resource for learning. సో నా గోల్కి నేనేం మెటీరియల్ చూస్ చేసుకోవాలి, ఏ బుక్స్ చదువుకోవాలి, ఎవరు నాకు ప్రాపర్ గైడ్ ఇచ్చే టీచరు, ప్రజెంట్ వ్యాస్ట్ కరికులం. అసలు మనం స్టార్టింగ్ అప్పుడు ఫస్ట్ మన సీనియర్స్ మేడం వాళ్ళు చదివినప్పుడు ఎంత 5 years. సో మంది లాస్ట్ అదే యుఎస్లో అయితే కనుక వాళ్ళ స్ట్రాటజీ వేరు, మన ఇండియన్ స్ట్రాటజీకి వాళ్ళ స్ట్రాటజీకి. అసలు మనం అయితే వీఆర్ ద యంగెస్ట్ డాక్టర్స్ ఇన్ ద వరల్డ్ చెప్పచ్చు. 25 కల్లా మనం డాక్టర్స్ అయిపోతాం, వాళ్ళ 23, 24కి డాక్టర్ చేస్తారు. అంటే ఇప్పుడు కొత్త కాన్సెప్ట్ వచ్చేసి బ్యాచెస్గా డివైడ్ చేసి స్టార్టింగ్ ఆఫ్ ఎంబీబీఎస్ నుంచే ఈ కొన్ని బ్యాచెస్ ఈ టీచర్, కొన్ని బ్యాచెస్ ఈ టీచర్ అని ఇస్తారు. సో వాళ్ళు గైడ్ చేయొచ్చు, మెంటర్షిప్ అంటారు దాన్ని. అప్పుడు మనకు ఎవరు చెప్పేవాళ్ళు లేరు. ఇప్పుడు అలా కాదు, ఫస్ట్ ఇయర్ ఎంబీబీఎస్ నుంచే మెంటర్ ప్రోగ్రామ్ అని ఉంటుంది. ఆ మెంటర్ దగ్గర స్టడీయే కాదు, ఆల్ మీ లవ్ అఫేర్ కానీ ఏదైనా కానీ షేర్ చేసుకోవచ్చు మెంటర్ దగ్గర. సో ఎస్డిఎల్ విల్ హెల్ప్ఫుల్ ఫర్ దట్. సో ఎడ్యుకేషనల్ థియరీస్ ఆఫ్ ఎస్డిఎల్. అసలు ఎస్డిఎల్ ఎడ్యుకేషనల్ పరంగా ఏమంటారు? కాగ్నిటిజం థియరీ. సమ్ థియరీస్ ఆర్ దేర్ ఎస్డిఎల్. కాగ్నిటిజం థియరీ అంటే ఏ లెర్నర్ యూజ్ హిజ్ మెమరీ, సొంతంగా ఆలోచించుకోవటం, నేర్చుకోవటం, టాపిక్ తెలుసుకోవటం, అండ్ అండర్స్టాండ్ దట్ టు డెవలప్ టూల్స్ ఫర్ సెల్ఫ్ డైరెక్టెడ్ లెర్నింగ్. ఏమేం టూల్స్ ఉన్నాయి? హ్యూమనిజం థియరీ, ఏ లెర్నర్ బికమ్ సెల్ఫ్ డైరెక్టెడ్ with the experience while becoming a doctor and a human being. సో హ్యూమనిజం అంటే ఇక్కడ ఫస్ట్ మనం మనుషులం, ఆ తర్వాతే డాక్టర్. సో ఎంపతి, ఇందాక చెప్పినట్టు ఎంపతితో పాటు మన గోల్స్కి సెల్ఫ్ డైరెక్టెడ్గా ఎలా ట్రీట్ చేయాలి పేషెంట్ వచ్చినప్పుడు, హౌ టు బ్రేక్ ఏ బ్యాడ్ న్యూస్ అనేది అది కూడా వస్తుంది మనకు చెప్పాలి. కన్స్ట్రక్టివిజం థియరీ, ఏ లెర్నర్ యూజెస్ ఎక్స్పీరియన్స్ అండ్ ఇంటర్నల్ ప్రాసెస్ టు కన్స్ట్రక్ట్ కాన్సెప్ట్. సో కంటిన్యూస్గా వీఆర్ కంటిన్యూస్ లెర్నర్స్. క్లాబ్స్ కంటిన్యూ ఆఫ్ లెర్నింగ్ అదొక మాడ్యూల్. దాంట్లో ఇమీడియట్ రియాక్షన్ పర్ఫార్మెన్స్, ఎక్స్పెరిమెంటల్ లెర్నింగ్, లాంగ్ టర్మ్ కోపింగ్, అడాప్టేషన్. సో ఒక స్కిల్ ఉంటుంది లేదా ఒక టాపిక్ ఉంటుంది. ఆ టాపిక్ ఫస్ట్ వాళ్ళు ఇమీడియట్ పర్ఫార్మెన్స్ చేయలేరు, దాన్ని వాళ్ళు నేర్చుకొని ఎక్స్పెరిమెంటల్ లెర్నింగ్ ల్యాబ్స్లో మనం స్టార్ట్ చేయగానే మన బయోకెమిస్ట్రీ అనాటమీ మనకి ఫార్ములాస్ ఎలా వస్తాయో అది చేసే కొద్దీ వీ విల్ కోప్ ఫర్ అడాప్టింగ్ ఫర్ దట్ ప్రాసెస్ ఆర్ ప్రొసీజర్. సో దీంట్లో ఏంటి, కంక్రీట్ ఎక్స్పీరియన్స్, రిఫ్లెక్ట్ అబ్జర్వర్స్. మనకి ల్యాబ్లో మనకు ఒక లాగ్ బుక్లో ఈ ప్రొసీజర్ ఇలా చెయ్యాలి అని రాసి ఉంటుంది, దాన్ని మనం చదువుతాం, దాన్ని మనం రిఫ్లెక్ట్ చేస్తాం. అబ్స్ట్రాక్ట్ మనం చేసింది ఏంటి అనేది అబ్స్ట్రాక్ట్ కాన్సెప్చువలైజేషన్ అండ్ యాక్టివ్ ఎక్స్పెరిమెంటేషన్. దాన్ని మనం నేర్చుకొని రిపీటెడ్గా చేసే కొద్దీ మనకి ఆ ఎక్స్పెరిమెంట్ వస్తుంది. సో అది అప్పుడు మనం కాంక్రీట్ ఎక్స్పీరియన్స్, అదొక మన ఎక్స్పీరియన్స్. సింపుల్ మనకి యూరిన్ బెంటిక్ సొల్యూషన్తో ఎలా చేస్తాం, స్టార్టింగ్ ఎలా చేస్తాం, సింపుల్ అలాంటిది అనమాట. సో స్టేజెస్ ఇన్ ఎస్డిఎల్, ఫస్ట్ ఓల్డ్ మోడల్ స్టేజ్ 1 డైడాటిక్ లెక్చర్స్, డిపెండెంట్ మన మీద అంటే మనం ఫస్ట్ చెప్తాం, వాళ్ళు డిపెండెంట్. తర్వాత ఇంటరాక్టివ్ లెక్చర్స్, వాళ్ళకి మనం చెప్తాము, చెప్పి మనం వాళ్ళతో సరే ఎక్కడ తప్పు చేస్తున్నాడు ఇతను, మనం దాన్ని ఎలా కరెక్ట్ చేస్తాము. స్టేజ్ 3 స్మాల్ గ్రూప్ ఇన్వాల్వ్మెంట్, వాళ్ళంతా వాళ్ళ ఓన్గా వాళ్ళకి ఒక టాస్క్ ఇచ్చేస్తాం, సో వాళ్ళు దాంట్లో వాళ్ళ ఓన్గా ఇన్వాల్వ్ అయ్యి ఎలా చేస్తారు. అండ్ లాస్ట్ వన్ సెమినార్, సేమ్ సెల్ఫ్ డైరెక్టెడ్ లెర్నింగ్, లాస్ట్ స్టేజ్. సో దీస్ ఆర్ ఆల్ ద స్టేజెస్ ఇన్ సెల్ఫ్ డైరెక్టెడ్ లెర్నింగ్. దిస్ కాల్డ్ యాజ్ గౌస్ మోడల్ ఆఫ్ ఎస్డిఎల్. సో ఆల్రెడీ ఇందాక మేడం చెప్పినట్టు కరికులంలో మనం ఏమంత కష్టపడే అవసరంలా, సిబిఎంలోనే ఏమేం టాపిక్స్ ఎస్డిఎల్ కింద ఇవ్వాలి, ఎన్ని గంటలు ఇవ్వాలి అంతా వాళ్ళే డీటెయిల్గా ఇచ్చేశారు. సో యాజ్ ఎ సెడ్ ఐఎంజీ గోల్, మనం ఇండియన్ మెడికల్ గ్రాడ్యుయేట్కి 5 గోల్స్ ఫస్ట్ నుంచి ఇందాక యాట్కామ్లో కూడా చెప్పారు. షుడ్ బి ఏ క్లినీషియన్, షుడ్ బి ఏ లీడర్ అండ్ మెంబర్ ఆఫ్ ది హెల్త్ కేర్, అండ్ టీమ్ అండ్ సిస్టమ్, కమ్యూనికేటర్, లైఫ్ లాంగ్ లర్నర్, ప్రొఫెషనల్. సో ఎస్డిఎల్ స్మాల్ డైరెక్టెడ్ లెర్నింగ్ మనం లైఫ్ లాంగ్ లర్నింగ్ చేస్తూనే ఉంటాం. ఇది ఆల్ టాపిక్స్ రిలేటెడ్ టు దేర్ ఓన్లీ. స్మాల్ సెల్ఫ్ డైరెక్టెడ్ లెర్నింగ్ వల్ల మనకు ఓన్గా ఒక క్లినీషియను, ఒక కమ్యూనికేషన్ ఎలా చేసుకోవాలి, హెల్త్ కేర్లో ఎలా మేనేజ్ చేసుకోవాలి, హౌ షుడ్ బి ఏ ప్రొఫెషనల్ ఇన్ అవర్. సో ఐఎంజీ గోల్స్ కొన్ని ఇచ్చారు సిబిఎంఈలో. demonstrate ability to perform an objective self-assessment of knowledge and skills, continue learning, define existing skills and acquire new skills. సో మన డే టు డే ప్రాక్టీస్లో మనకు తెలుసుకుందే కాక ఓల్డ్ స్కిల్స్తో పాటు మన ఎక్స్పీరియన్స్తో నా టైప్ ఆఫ్ ట్రీట్మెంట్ వేరు ఉండొచ్చు, మీ టైప్ ఆఫ్ ట్రీట్మెంట్ వేరు ఉండొచ్చు, వే ఆఫ్ అప్రోచ్ వేరు ఉండొచ్చు. డెమాన్స్ట్రేట్ ఎబిలిటీ టు అప్లై న్యూలీ గెయిన్ నాలెడ్జ్ ఆర్ స్కిల్ టు ద కేర్ ఆఫ్ ది పేషెంట్. సో అప్డేట్ అవుతూ ఉంటాం మనం, కొత్తగా ఎప్పుడు వచ్చింది. ఒకప్పుడైతే సర్జరీ అంటే నీ రీప్లేస్మెంట్ అంటే మాన్యువల్, ఇప్పుడంతా రోబోటిక్స్, అప్డేటెడ్ స్కిల్స్ అదంతా. డెమాన్స్ట్రేట్ ఎబిలిటీ టు ఇంట్రోస్పెక్ట్ అండ్ యూటిలైజ్ ఎక్స్పీరియన్స్ టు ఎన్హాన్స్ పర్సనల్ అండ్ ప్రొఫెషనల్ గ్రోత్ అండ్ లెర్నింగ్. సో మన ఫస్ట్ టైమే మనకి రాదు, సో ఇంట్రోస్పెక్ట్ మన స్కిల్ మనం చేసుకుంటాం. చాలామందికి దేర్ ఓన్ స్కిల్స్ ఉంటాయి, అవి వాళ్ళు ఇంప్లిమెంట్ చేస్తుంటారు. Demonstrate ability to search, including through electronic media and critically evaluate the medical literature and apply the information in the care of the patient. సో ఎస్డిఎల్ అంటే మనం డైలీ లర్న్ చేసుకుని అప్డేట్ ఏమేమి ఉన్నాయి జనరల్స్ కానీ ఏమైనా కానీ చూసుకుంటూ మనం అప్డేట్ ఉండాలి. బీ ఏబిలిటీ టు ఐడెంటిఫై అండ్ సెలెక్ట్ అన్ అప్రోప్రియేట్ కెరియర్ పాత్వే దట్ ఈస్ ప్రొఫెషనల్లీ రివార్డింగ్ అండ్ పర్సనల్లీ రీఫిల్లింగ్. దిస్ ఈజ్ కంప్లీట్ లైఫ్ లాంగ్ లర్నర్. సో మనం ఒక ఎస్డిఎల్ కండక్ట్ చేయాలి కాలేజీలో అంటే ఏం కావాలి? ఫ్యాకల్టీ ట్రైన్ అయి ఉండాలి, ఫార్మేషన్ ఆఫ్ కోర్ కమిటీ, సెలక్షన్ ఆఫ్ టాపిక్ అండ్ ప్లేస్మెంట్ ఆఫ్ కరికులం. ఈ సెలక్షన్ ఆఫ్ టాపిక్ కూడా కరికులం మీకు ఇచ్చిన దాంట్లోనే వాడే సెలెక్ట్ చేస్తాడు. ఓరియంటేషన్ ఆఫ్ ది స్టూడెంట్ టు ద ఎస్డిఎల్, గ్యాదరింగ్ రీసోర్స్ నెసెసరీ ఫర్ ద ట్రైనింగ్ ఎస్డిఎల్ ప్రోగ్రామ్, venue, timetable, adjustment, computer, Wi-Fi, formation of online group of the student and faculty, distributing the per session logistic material to the stand material. So ఒక ఎస్డిఎల్ స్టార్ట్ చేయాలంటే ఆల్రెడీ ఒక టాపిక్ సెలెక్ట్ అయి ఉంటుంది. సో వాళ్ళు కంటిన్యూగా మేడం అన్నట్టు ఇది రొటీన్ ప్రొసీజర్ కాదు, జస్ట్ 2 hours ఆఫ్ ద ప్రొసీజర్. సో వాళ్ళు క్లాస్ రూమ్లో ఉండే అవసరంలా. సో మనకు వాట్సాప్ గ్రూప్లో ఒక గ్రూప్లో చేసుకొని ఆ స్టూడెంట్స్తో వాడికి ఇచ్చిన ఇన్పుట్స్ మనం వాళ్ళకి ఇచ్చే ఇన్పుట్స్ షేర్ చేసుకుంటూ వాళ్ళ నాలెడ్జ్ అలా షేర్ చేసుకుంటూ ఉండొచ్చు. సో ప్రిపరేషన్ ఆఫ్ ప్రయర్ టు ఎస్డిఎల్. సో ఇందాక చెప్పినట్టు మేడం 2 hour సెషన్స్ ఉంటుంది. సో ఫస్ట్ 1 hour మనం ఏం చేయాలి? 10 minutes ఇంట్రడక్షన్ టు ద స్మాల్ గ్రూప్, 20 minutes సెట్టింగ్ లెర్నింగ్ గోల్స్. సో ఈ టాపిక్ ఇచ్చి ఈ టాపిక్లో మీరు ఏం చేయదలుచుకుంటున్నారో గోల్స్ మనం వాళ్ళకి డిఫైన్ చేయాలి. అండ్ 30 minutes ఫెసిలిటేట్ హెల్ప్స్ ఇన్ ప్లానింగ్, ఫైండింగ్, రీసెర్చ్, గ్రూప్ అండ్ డిసేబిలిటీ. నెక్స్ట్ 1 hour ఇచ్చేసిన తర్వాత వీ షుడ్ గివ్ ఎ టైమ్ బ్రేక్ ఆఫ్ 1 week to 2 weeks డిపెండింగ్ అపాన్ ద ఎస్డిఎల్. ఆ 1 week to 2 గ్రూప్స్లో స్టూడెంట్స్ ఫైండ్ రిసోర్స్, రీడ్స్ రిసోర్స్, స్టూడెంట్ కాంటాక్ట్ ఫెసిలిటేటర్ ఫర్ గైడెన్స్. Teacher as a facilitator, guide, resource, provide feedback, engaging learning monitoring. సో మన సపరేట్ గ్రూప్ కానీ లేదా పర్సనల్గా వాళ్ళు మన దగ్గరకు వచ్చి అడగచ్చు. సో అప్పుడు ఇది తెలుసుకోవాలి. సెకండ్ సెషన్ వచ్చి 30 minutes డీఫ్రీవింగ్ ఆఫ్ ది లెర్నింగ్ ఆపర్చునిటీస్. సో వాళ్ళకి ఎలా అంది ఈ ఒక టాపిక్ వాళ్ళు ఎలా నేర్చుకున్నారు, ఏ మెథడ్స్ వాడారు, ఏ మాడ్యూల్స్ వాడారు. 30 minutes evaluation of the learning and offer some tips for both ఫెసిలిటీ మెంబర్స్ అండ్ స్టూడెంట్. సో వాళ్ళతో మనం ఇంటరాక్ట్ అవుతాం. సో మీకు ఇచ్చిన టాపిక్ వాళ్ళు ఎలా నేర్చుకున్నారు, వాళ్ళు చెప్పింది కరెక్టా కాదా, ఇంకా రిఫైన్గా ఏమైనా చేయొచ్చా అనేది నెక్స్ట్ సెషన్లో మనం చూస్తాం. సో వాళ్ళు అట్లా జస్ట్ ఒక చిన్న ఎగ్జాంపుల్ ఇచ్చారు. డిస్క్రైబ్ అండ్ డిస్కస్ ద ఫిజియాలజీ ఎఫెక్ట్స్ ఆఫ్ అక్యూట్ బ్లడ్ లాస్ అండ్ వాల్యూమ్ లాస్. అది వాళ్ళ టాపిక్. సో వాళ్ళకి ఆ టాపిక్ ఇచ్చి ఏమవుతుంది అండ్ నెక్స్ట్ టాపిక్ ఏంటి, డెవలప్ డాక్యుమెంట్ అండ్ ప్రెజెంట్ ఏ ట్రీట్మెంట్ ప్లాన్ దట్ ఇంక్లూడ్స్ ఫ్లూయిడ్ రిసస్టేషన్, బ్లడ్ అండ్ బ్లడ్ కాంపోనెంట్ ట్రాన్స్ఫ్యూజన్ అండ్ స్పెసిఫిక్ థెరపీ ఫర్ అరేంజింగ్ ద బ్లడ్ లాస్. సో ఇది వాళ్ళకి ఇచ్చిన టాపిక్. సో దీంట్లో వాళ్ళు అసలు బ్లడ్ వాల్యూమ్ ఎంత ఉంటుంది బాడీలో, బేసిక్ లాస్ అయితే ఎలక్ట్రోలైట్స్ ఏమేమి వస్తాయి, ఇంట్రావాల్యూమ్ లాస్ ఎంత, ఎక్స్ట్రా వాల్యూమ్ లాస్ అయితే అట్లాగా, బ్లడ్ కాంపోనెంట్స్ ఏంటేంటి, హోల్ బ్లడ్ ఇవ్వాలా, ఫ్రెష్ బ్లడ్ ఇవ్వాలా, ప్లాస్మా ఇవ్వాలా, ప్లేట్లెట్స్ ఇవ్వాలా. సో ఇలా ఇన్ని ఉంటాయి టాపిక్స్. సో వాడు అసలు ఎలా, వాడికి ఏం అర్థమైంది, సో ఎంత లాస్, మళ్ళీ బ్లడ్ లాస్లో కూడా సివియర్ బ్లడ్ లాస్ ఉంటుంది, మోడరేట్ బ్లడ్ లాస్ ఉంటుంది, సమ్ బ్లడ్ లాస్ ఉంటుంది. సో దాని ప్రకారం వాడు ఆ ట్రీట్మెంట్ ప్లాన్ చేసుకొని రావాలి. ఒక 1 week or 2 weeks టైం ఇచ్చి సేమ్ సెషన్లో వీ విల్ డిస్కస్. సో కొంతమంది ఏమో సమ్ బ్లడ్ లాస్, మోడరేట్ బ్లడ్ లాస్, సివియర్ బ్లడ్ లాస్. సో దానివల్ల ఎలక్ట్రోలైట్ డిస్టర్బెన్సెస్ ఏమవుతాయి, బ్లడ్ పోతే ఎంత బ్లడ్ ఎక్కించాలి, సమ్ బ్లడ్ లాస్ అంటే ఎంత, 50 ml అయితే సమ్ బ్లడ్ లాస్, మోడరేట్ అయితే 100 to 150, సివియర్ బ్లడ్ లాస్ అయితే మోర్ దాన్ 150, అలా డెఫినేషన్స్ ఉంటాయి. సో దాన్ని వాళ్ళు చేసుకొని రావాలి. సో సేమ్ సెకండ్ ప్రొఫెషనల్ ఇయర్లో కూడా అదే. సో అసెస్మెంట్ మనం ఇచ్చిన ఎస్డిఎల్ హౌ షుడ్ అసెస్, అదే సింగిల్గా అసెస్మెంట్ ఆఫ్ లెర్నింగ్ అట్ కన్క్లూజన్ ఆఫ్ వన్ టాపిక్, గ్రేడింగ్ ఆఫ్ ప్రాజెక్ట్ వర్క్, ఆస్పి, ట్యూటోరియల్ లాగా లేదా ఎంసీక్యూస్ ఇచ్చి లేదా రిఫ్లెక్షన్ లేదా ఫీడ్బ్యాక్ ఈఎల్ఎంఎస్ అండ్ ఎసెన్షియల్ లెర్నింగ్ మెథడ్స్ ఏం వాడాడు అవి కూడా తెలుసుకోవచ్చు. అది సింగిల్ టాపిక్ ఇచ్చి. అదే రిపీటెడ్గా ఇవాల్యుయేషన్ ఆఫ్ ద ప్రోగ్రామ్ ఆఫ్టర్ ఫ్యూ ఎస్డిఎల్స్ అండ్ హ్యావ్ బీన్ కండక్టెడ్. గ్రేడింగ్ డన్ బై ఫెసిలిటేటర్. 4-5 ఎస్డిఎల్స్ ఇచ్చి దాని నుంచి ఏది బెస్ట్ చెప్పాడు. ఇమీడియట్ ఫీడ్బ్యాక్. లాగ్ బుక్ రిఫ్లెక్షన్, ఆ పాతవి ఇవి లాగ్ బుక్ రిఫ్లెక్షన్. మల్టీ సోర్స్ ఫీడ్బ్యాక్. పోర్ట్ఫోలియో. పోర్ట్ఫోలియో అంటే ఈచ్ టాపిక్. పోర్ట్ఫోలియో అంటే ఇప్పుడు ఒక ఎస్డిఎల్లో 4-5 ఒకే ఎస్డిఎల్ ఇస్తారు. 4-5 ఒకే ఎస్డిఎల్ ఇచ్చినప్పుడు ఒక్కొక్కరు ఒక్కొక్క వే ఉంటుంది. అవన్నీ ఒక చోటకి చేస్తే పోర్ట్ఫోలియో, అందరి ఇన్ఫర్మేషన్. సో డిజిటల్ టూల్స్ ఫర్ ఎస్డిఎల్, మోర్ ఇన్ఫర్మేషన్, యూట్యూబ్, ఈ జర్నల్, ఈ బుక్, జర్నల్స్, ఆన్లైన్ రీసెర్చ్, సెల్ఫ్ అసెస్మెంట్, ఆన్లైన్ క్విజెస్ వాడు ఓన్గా, అండ్ టెస్ట్స్, గేమ్స్, పియర్ షేరింగ్, స్టిమ్యులేషన్ ఇప్పుడంతా స్టిమ్యులేషన్ థెరపీ ఫర్ స్కిల్ డెవలప్మెంట్. అడ్వాన్స్డ్ వచ్చేసి లైక్ సాఫ్ట్ బోర్డ్స్, స్కానర్ హైలైటింగ్స్, స్మార్ట్ ఫోన్స్ అండ్ స్మార్ట్ వాచెస్. డిజిటల్ టూల్స్ ఫర్ ఎస్డిఎల్స్ ఫర్ ఫెసిలిటేటర్స్ ఆర్ రిసోర్స్ షేరింగ్ ఆన్లైన్, సేమ్ లైక్ మన వాట్సాప్ గ్రూప్ కానీ లేదా ఈమెయిల్ లేదా పోర్ట్ఫోలియో. మానిటరింగ్ ఆన్లైన్ లైబ్రరీ విజిట్స్, రీసోర్స్ సోర్స్ కోసం మన ఎన్టీఆర్ యూనివర్సిటీ వెబ్సైట్లో కానీ లైబ్రరీ ఉంటుంది. యూజింగ్ ఆన్లైన్ టూల్స్ ఫర్ డిఫ్రేమింగ్, యూజింగ్ డిజిటల్ టూల్స్ ఫర్ అసెస్మెంట్. సో యాక్టివిటీ, షో గ్లిమ్స్ ఆఫ్ ఎస్డిఎల్ కండక్టెడ్ యూజింగ్ యాక్చువల్ స్టూడెంట్ డిమాన్స్ట్రేషన్ ఎస్డిఎల్. Student sharing feedback. Students should be present from beginning of the session. Use a common topic that is appropriate for SDL. So activity inputs from the activity and clarification of their queries. So ఇది టీచర్ యాజ్ ఎ ఫెసిలిటేటర్. ఇది వరకు ఎలా ఉండేది, టీచర్ చెప్పేవాళ్ళు అందరూ వినేవాళ్ళు. ఇప్పుడు అలా కాదు, లర్నర్ సెంట్రిక్. టీచర్ మధ్య ఉంటాడు, అందరికి చెప్తాడు. సో కాన్సెప్ట్ షుడ్ బి చేంజ్ ఫ్రమ్ దట్ ఆఫ్ టీచర్ టు దట్ ఆఫ్ ఫెసిలిటేటర్ ఆఫ్ లెర్నింగ్, మోటివేటర్, desiring of the learning stimulation, join the students as a continue co-learner. సో మనకు తప్పలేదు, ఒక్కొక్కసారి మనం చదువుకున్నప్పుడు కాన్సెప్ట్ వేరు ఉండొచ్చు, ప్రజెంట్ కాన్సెప్ట్ వేరు ఉండొచ్చు. సో మ్యూచువల్ అండర్స్టాండింగ్తో ఇదివరకైతే సార్ చెప్పిందే కరెక్ట్, నో చేంజ్. ఇప్పుడు అది అలా కాదు, మ్యూచువల్ అండర్స్టాండింగ్. సో ఎస్డిఎల్ వల్ల మనకు ఆ బెనిఫిట్ ఉంటుంది. సో వెన్యూస్ ఫార్మల్గా అయితే ఒక కేసు ఇచ్చి లేదా ఒక ప్రాబ్లం అంటే ఒక కేసు సినారియో, ఇందాక మనం చెప్పుకున్నట్టు బ్లడ్ లాస్ అయితే ఏం చేస్తావు. సో డిఫరెంట్ సబ్జెక్ట్ డిఫరెంట్ వాళ్ళ కేస్ సినారియోస్ కానీ, ప్రాబ్లమ్ బేస్డ్ సాల్వింగ్ కానీ, ఈ లెర్నింగ్, యాట్కమ్ మాడ్యూల్. ఇన్ఫార్మల్ అయితే డైలీ మనం చెప్పేది బెడ్ సైడ్ చెప్తాం, పీజీ టీచింగ్ అండ్ మెనీ అదర్ మాడ్యూల్స్. ఇది జస్ట్ ఒక టాపిక్. హౌ షుడ్ బి ఎ డాక్టర్, ఏం చేయాలి, డాక్టర్ ఏం తెలుసుకోవాలి. ఎన్యూమరేట్ అండ్ డిస్క్రైబ్ ద ప్రొఫెషనల్ క్వాలిటీస్ అండ్ రోల్ ఆఫ్ ఎ ఫిజిషియన్. ఇది కేహెచ్ అంటే షో హౌ, నో హౌ. ఒక ఐఎంజీ అంటే ఒక ఇండియన్ మెడికల్ డాక్టర్ అసలు డిస్క్రైబ్ ద ప్రొఫెషనల్ క్వాలిటీస్ అండ్ రోల్ ఆఫ్ ఎ ఫిజిషియన్. ఒక డాక్టర్ క్వాలిటీ ఏ ఉండాలి, ప్రొఫెషనల్గా హౌ షుడ్ వి గో త్రూ. డిస్క్రైబ్ అండ్ డిస్కస్, కమ్యూనికేట్ to lifelong learning and an important part of physical growth. Describe and discuss the role of physician in healthcare system. Identify and discuss physician role and responsibility society and the community she serves. So oka IMG graduate should know what is a doctor, oka doctor role enti, manam society tho ela undali, how empathy should be, mana valla society ke important anedi తెలుసుకోవాలి. సో ఇందాక మేడం చెప్పినట్టు 6 hours 1. సో ఇప్పుడు మనకి తెలిసినంత మటుకు ద బిగ్గెస్ట్ ఎస్డిఎల్ ఎవరు, మన వేదాస్లో నుంచి ఏకలవ్యుడు. ఎవరున్నారు, ఆయనకి ఎవరు లేరు. ఈజ్ ఎ సెల్ఫ్ డైరెక్టెడ్ లర్నర్. ఒక విగ్రహం పెట్టుకొని ఆయనే తెలుసుకున్నాడు. Any more doubts?
Generally, we divide them into small groups, sir. Before we, one day prior, we will give the topic, ma'am, and we will divide into small groups. And we ask the groups to prepare, let's say if it is hemopoiesis or hematopoiesis topic is there, we'll give them like the lineages. We'll split the lineages, like what is the RBC lineage, what is the W. No, ma'am. We'll ask them to read it on their own, like from the physiology or through Google or any YouTube videos. We'll ask them to learn and come. Like that topic has been taught to them previously, but in first year they might have forgotten after the exams and come to the second year. Like in that scenarios, we'll divide them into groups, and the next day when they come up, we ask the groups among one person to come up and speak about that. And usually we'll stop in between and we'll ask others groups, so that other groups or other individuals, audience who are there, we'll ask them to come up with the answers. Like we'll split. Yes, ma'am. In that way, we'll. Yes.
Any other methods away from that what sir has
సైకాట్రీలో పీజీస్ ఏం క్లాసెస్ వాళ్ళకి ఏ టాపిక్ ఇచ్చి
come up with new ideas so that we also will learn.
So basically we'll give them a topic on the previous day, and we'll ask them to prepare the topic, and the main part of the topic will be allotted to one postgraduate, and the other postgraduates will passively participate in it. When we ask the questions, andarki vacha leda anedi oka clarity techukodaniki we ask everybody the questions, and the main person, whoever is being allotted the topic, will be asked the maximum number of questions, and the other people will passively participate in that alone.
For example, we will ask the students to go to the wards daily for a period of 15 days or 20 days, and ask them to go for example, to a diabetic patient, to every diabetic patient in the ward, and ask the patient regarding his diabetic history, the drugs he is using, and see the reports of the patient, how is the sugar levels normal or not, and the experience of the patient, that is whether he is facing any side effects or whether he is
like
having any clinical
like bedside teaching.
No sir, there will be no mentor bedside. The student himself will go and
మీకు ఒక కేసు ఇచ్చి వాళ్ళని చూసుకొని మీకు
make a report after 15 days, so that the student may know how the different types of drugs are working on the patient.
Only diabetics.
They will give a report on how the different various diabetic drugs are working. Yes, ma'am. Yes, ma'am.
We can give fetal skull and pelvis to the students, and we can divide amongst them. First to tell anatomy, then different mechanism of labors, and we can divide groups, and so that they'll read and come theoretically, and then they can show practically how it works on the actual we will give the topics, then we can ask them to demonstrate. With the different groups, they will sit and they will demonstrate. Models you will give from the department.
ఒక స్మాల్ టాపిక్ ఇస్తాం మ్యామ్. For example, we'll give the bloodstream infections, ma'am, and each student, and in that which organism, either bacteria, virology, virus and fungi. Based on that, we'll get the information from the students, ma'am. Which bacteria is causes the blood infections, which virus is causes the infections, like that we'll get the information from students, ma'am. Yes, ma'am. Each student will give the subtopics. Will give the each student, ma'am. And then they want to say, and or they will write it also. We can see the self-direct examination. MCQs also we are giving, ma'am. Yes, ma'am. Whatever they are like, they will write it, or they are write it the MCQs, that are.
Small group discussion. We can give them a day or 2 days to prepare and discuss the case, come up with different diagnosis or different approaches or treatment modules, anything that can be done either via small WhatsApp group or a small group physically.
What are the 2 types of self-directed learning? You can search your Google. If you all know, it's good. If you all don't know, you can use your mobile phones. Within 2 minutes, you need to come up with the answer. Which group will come up fast, we'll see. What are the 2 types of self-directed learning? First question. Second, what is the literal meaning of assessment? Which group will come up fast, we'll keep. 2 minutes time. You can just write down on your boards which are behind you so that there is no bias. 2 types of self-directed learning. Second question, what is the literal actual meaning of assessment?
I've also handed out one paper. You can prepare a module, SDL module on your own for one topic and see what all problems, everything, each section is there. What can be the barriers, what is the advantages, how you will prepare. You can prepare your own lesson plan using that module.
Who is fast and whose group communication is very good?
That group is very good. Self-regulated learning, okay. Marker is not good.
Ways of self-directed learning. I am repeating my question. 2 broad ways of self-directed learning. Marker is not good. Ready. చెప్పనియండి. This is self-directed. We won't speak anything. We just question. నేను అంత ఆన్సర్స్ ఇచ్చేసి నువ్వే టీచర్. Okay, example. One more task. What is self-paced learning? 1 minute time. Self-paced learning. ఆ టూ రెండిటికి మీనింగ్ ఏంటి? ఫెసిలిటేటెడ్ లెర్నింగ్ అంటే ఏంటి? సెల్ఫ్ పేస్డ్ లెర్నింగ్ అంటే ఏంటి? ఎగ్జాంపుల్. ఐడెంటిఫై. హౌ? No, mother is helping. That is facilitated. Without mother catching the hand, will she run immediately? No. That is facilitated. Your example can be into facilitated. What is self-paced learning? Yes, sir. It's all completely online learning. You learn from, nobody is teaching now. For if you are going to NEET exams and all, they are not happy with our teaching. They go and see the online videos, online conferences, online projects, online fellowship courses. I am not doing anything. They are motivated by themselves. If they are interested, they come back and ask us, please guide us. Okay, then you may guide. But everything goes online only. Even assessment, there are some exams also. Online exams and all, online degrees, online libraries, everything is your self-paced learning. Till now what sir has told, problem-based, case-based, all examples what you all are given, that is all facilitated learning. I am not teaching anything, but what now I have done also, it's all facilitated learning. I just threw a question, later whole of the 30 members are active. Now, not only you learnt, you are very fast in searching, and I also saw most of the group people, each one helping each other. So I was trying to see that group activity and group coordination also. That was also very important when we teach our students. So ultimately self-directed learning is this much. Or still you can just play a video, ask them to comment on that video. What you want to learn, what you learnt. Later you can add up. So these are some examples. Okay?
Now it is a tea break. How many minutes? Time enta? How much time is given for tea? 15 minutes. Please come back in time. Next session. 10 minutes. So the session is on practical skill teaching. Suresh Kumar sir will be taking. So I will have the mic to sir. Sir, oka nimisham. So that posters are prepared by our undergraduate students, which are pasted there behind. Afterwards you can see that.
Good morning. Welcome to the post-tea session. So the topic today is effective clinical and practical skill teaching. You might be seeing that all these lectures, a little bit of overlap will be there and understanding the things will be better. Once you attend the lecture in the morning, you feel after your outcome this you will follow better. And tomorrow lectures even you will follow much better. And by the end of tomorrow I think you will be able to take our job and do whatever we are doing. So the next slide. So here, especially for a physician and a surgeon, they need effective clinical and practical skill teaching. The slide remote is not. Thank you. So mainly the objectives of this talk is you should learn, teach skills effectively, teach skills at the workspace, use a skill lab effectively, understand student doctor learning concept. So what is skill? What is skill? You are killing. If you say no, you are killing the skill. You have plenty. I will say all those things later. Learn behavior. Okay, but for what purpose? To perform something. So you are trained in that. You perform something for a better purpose, which is there, what we call a skill. Depending upon one person's job, the skills are there, motor skills and other things. Okay, now you have plenty of skills. You have to accept. That's what I am saying. As a successful practitioner, if you don't have skills, patients will not come. So how do you use these things at the workplace where you work, and skill lab effectively? This skill lab, lot of people, some colleges have a very excellent skill labs. Few colleges have average and moderate skill labs. They will be replacing with the latest technology, and that will be effective for these people. Then understand student doctor learning concept. So these practicals in preclinical, paraclinical, community medicine, can you tell us what are the practical skills that can be learned by a preclinical student? Preclinical student or first year MBBS. Mike.
Regarding few tests in biochemistry, cadaver dissection.
Very good. What more? Dissection. Measurement of blood pressure. Do you teach him in the first year itself? Preclinical. That is the present trend and concept, is it not? In physiology, you need it. So now, because you are a physician, how do you exactly measure the blood pressure? A skill. A sphygmomanometer is there. And, okay, I am the patient. How would you, where do you place the cuff and what? Yes? Very good. So you auscultate.
Starting of sound is according to first sound, that is a systolic, and disappearance of the
Excellent. So he is practicing correctly. Lot of people now The physician is not checking up the blood pressure. Some nurse records the blood pressure, keeps on the paper. Or it has become entirely digital. And I have seen a cardiologist saying that still he believes in Bcme manometer rather than digital thing. That's a very good thing. So what about paraclinical? Clinical, we have discussed SPM and other subjects. Second year patient has come. What are the skills you are expected, that medical graduate is expected to get? Making a slide. Very good. Or you mean to say peripheral smear? Very good. Because it might be clumsy, though you might be expert, the slide cannot be prepared well. There is no use in spite of your expertise. Is it not? Then coming to clinical side, what are the things? Injection, yes. So we will go to general medicine first, or we will go to orthopedics first. So what do you teach for under medical graduate, IMG, Indian medical graduate, UG student? What are you yes. What are you expecting him as an intern to do, or once he goes outside? Okay. To put a plaster. Very good. What more? Okay. Excellent. Anything more? Wound dressing. Probably that goes to the borderline between a surgeon and orthopedician. Okay. Is it not? Both ways. Both ways. So, wound dressing, what will you expect? So a person has a wound, how would you approach? Wound. An abscess on the forearm. So what is the first step? So how would you proceed? In I&D, what is the first step? Very good. Use the mic. So what is the first step in the procedure after all the things which you have mentioned?
We will prepare the local areas with the cleaning, then draping as a minor OT procedure. If any anesthesia, local anesthesia or block anesthesia we can give, and we will proceed with the procedure under all the aseptic precautions.
So I knew only 3 of these 5 things which you have mentioned. So I am learning 2 more things from you because you do it probably regularly. So lot of people, the moment I&D means, immediately they say go for incision. You have to, as you said, you have to take the consent, you have to explain the procedure, do it in minor OT if necessary, and then do the cleaning. That is most important. Aseptic precaution is more important than the procedure. Is it not? So what more expected from the Indian medical graduate? Yes.
So always domains are not single. There will be overlapping of domains. See, skill domain is not completely skill. Here effective domain is also there. So we are addressing the patient, we are telling what we are going to do. That is a part of effective domain.
So that's a very important point. They are not entirely segregated. All 3 again can be combined partially. Affective, psychomotor domains, cognitive, all these 3 can be combined in one particular procedure. So OBG, madam is here. So in OBG, what will you teach for the Indian medical graduate who is
to monitor a fetal well-being during labor and to conduct a normal delivery during undergraduate days. They have to observe and they have to conduct few deliveries, sir. And fetal monitoring is also to be taught effectively so that they will react in time.
So conducting of a normal delivery and fetal monitoring is very important. What about gynec? Madam has said about obstetrics. Gynec, what do you expect the Indian medical graduate to go through? What did you learn as very essential? Pap smear, speculum examination, how to examine the cervix, collect the pap smear, all these things. Is it not? What more? Excellent. Now the department, or it is a national policy of encouraging the IUCD things. So it is very important that the medical graduate learns about IUCD. Is it not? Anything? Anything more related to OBG? So now coming to my own branch. So what do you teach for the undergraduate? The moment he goes from Department of Psychiatry, he is posted for 2 weeks with you. So what do you teach him basically, so that once he goes outside, he can deal the problem independently in 90% of the cases. 10% of the cases he might have to refer to somebody.
So mental status examination, we teach UG, and then we teach them differentiation between psychosis and neurosis, and identification of disorders like anxiety disorders, clinical manifestations of paranoid schizophrenia, anxiety disorders, depression, how to manage a violent patient.
Very good. Especially that is very important. How to manage a violent patient. And these days, with history of substance abuse being plenty among people, especially student population, a person with substance abuse, how would you manage the patient? And as Madam said, the first priority is it organic or is it functional? Is it secondary to brain problem or it is a functional problem? That is one. And then, as you said, in the functional, difference between neurosis and psychosis, because entire treatment differs completely. And especially if no other specialist have this particular problem, but psychiatrist has to face a problem where we deal with psychotic cases who don't have insight. They don't have knowledge of their own problem. Like yesterday we had a case, minor skit, where the patient doesn't have knowledge of his problem. He denies. He is brought. So that is most important, and treatment will differ. Do you teach lumbar puncture? Yes. Do you teach lumbar puncture to the graduate?
Yes, sir.
Indian medical graduate?
Yes, sir. Yes, sir. How to put the 25 gauge into the space, and how to put the cannula, IV cannula, and how to conduct the CPR, and how to intubate the patient.
From anesthetist point of view.
Anesthetist point of view, sir.
Very good. So lumbar puncture, then how to...
And how to assess the GCS score also.
Coma score.
Yes, sir.
1 to 10.
And how to give the pre-anesthetic drugs to the patient before the surgery.
Very good. So this must be taught, because in lot of institutes, LP, lot of people I know who has come out from MBBS and internship, they don't know how to do LP. They have never been trained. Because of lack of patience or lack of other things, they have not been. That's why simulators come and mannequins come, yes, where this type of problem will not be there. Is it not? So pathology, what do you teach for the madam?
During their internship, they will be posted for 1 week in central lab. There we will be teaching them how to do the fine needle aspiration procedure, observation study, clinical examination, seeing the lesion itself, how can we differentiate between benign and malignant. If we aspirate pus or blood according to the aspiration material, how we have to say, those we will be saying. And if a bone marrow examination is there, those also we will assess them.
Very good. Anybody from ENT? Ophthalmology? Pulmonology, yes, most important. Pulmonology PGs are here. Consultants. So what do you teach the person? The IMG, he is going out.
Respiratory system examination in detail, basics of chest x-ray, sir, and how to assist the PGs in preparing a patient for bronchoscopy and pleural fluid aspiration.
Very good. Pleural fluid aspiration is most important in some cases, is it not? And especially after Corona, I think lot of things we have to teach the MBBS graduate, because he has to take care of lot of pulmonary problems. Okay. So any other different specialist, consultant, apart from these branches? Okay, we'll ask general medicine about anything about cardiac. Cardiac. What will you teach IMG regarding cardiac problem?
Yeah, first they need to know about the basics of ECG first of all. So how to differentiate the normal from abnormal rhythms and how to manage an acute MI. Especially the initial part they need to focus on and to call upon immediately and give the loading dose. That's the most important thing. And second thing, they need to identify is it a case of a heart failure or is it secondary to pulmonary. They should be able to differentiate pulmonary from cardiac things. And cardiac resuscitation, and if they are very good, they may have to make out the murmurs also. That's pretty difficult.
Thank you, sir. Yes, they need, now your double role comes. As a neurologist, you have to play now the second role. So what do you teach the neurology to the general practitioner?
Actually, yes, medical graduates, as per neurology aspects, they need more of clinical training. So it's not about imaging and all those things. Clinically, they need to differentiate, is it related to the spine problem, or is it related to the brain problem, or is it related to the nerves, that is the periphery. This is a simple and must. Unless we know the basics of which area is involved, we cannot pull down the whole thing. So they should be able to differentiate, and then next step they have to go for the imaging part. These are the basics, and then they should differentiate how to check the power, how to see the sensory different modalities, how to see the reflexes. This is all in the bedside clinic. So these are all the important parts.
Exactly correct, sir. Our experience is also same, because we have borderline interdisciplinary organic versus non-organic neurology. So when I inquire with the Indian medical graduates, I find that lot of people are not trained in even routine smaller things like power testing, tone testing. So we are sometimes probably we are at fault earlier, but now with this medical education, that is the most important thing. Why we are having a formal type, a fixed type of things, so we can correct our own mistakes as a consultant and give importance to basic skills which are required by the Indian medical graduate, which you all have mentioned depending upon the type of things. So this is lab-based teaching, slides already, as Dr. Sanjay mentioned, preparation, prescription writing, and simulation, reflections, projects, seminar presentation, clinical subjects, and community medicine. In fact, the most important aspect, Fanindra sir, pardon me, SPM, I have forgotten. So madam, what will you teach the Indian medical graduate? Because SPM is very, very important from the country point of view. Sorry, group loan, the consult. What would you teach a skill, not theory, to the person? What most important thing, especially from the primary health center, community thing, prevention of the disease. These are very important things these days.
Health education to the patients and the community, and how to do a research.
How to do a?
Research. How to form a research question, and what are the healthcare delivery system available in India. and what are the available national health programs, so that the patient out-of-pocket expenditure will be decreased by educating the patient about the available healthcare services, and also regarding family planning methods available, and also educating the patient about cafeteria approach. If any, explaining the terms about epidemic, endemic, pandemic, so that if any outbreak occurs, as a medical officer, when they are working in PHC, they should know to do an epidemic investigation and whom to report, and what is DMH, who is DMHO and who is DME, so whom to a medical officer should report, and where medical colleges are under control of which one, like that outline.
Thank you for your elaborate presentation. I think credit goes to Professor Fanivindra. Entire credit goes to you, sir, for training your student. And for research point of view, for those people who don't know, Fanindra sir is an excellent research for strategist. We all take his help for research along with madam also. Both of them deserve ovation for research point of view in SPM. Standing ovation. Thank you, sir. So these are all the things: seminar presentation, BPL, clinical subjects and community, bedside teaching, case-based reflections, projects, seminar presentation, PBL and experiential learning. Here we will ask, when you are writing a prescription for a patient, this prescription is also a skill. Okay, writing a prescription after seeing the patient, examining him and making your own differential diagnosis, getting an investigation, then finally you come to a conclusion and write a prescription. So what are the precautions that you take while writing a prescription? Pharmacology. Yes. Anybody from pharmacology? So we'll go for the physician now. General medicine, sir is there. Mere Japan prescription, how do you write? It is very important now. So NMC is giving some guidelines and writing prescription also.
First, in the prescription paper, the diagnosis should be mentioned, sir. Many prescriptions are without complaints or diagnosis. They are simply writing the drugs.
Before that, on the prescription, what should be there?
Name and the age.
Before that? Huh?
Most important is legibility of the doctor. So the writing is should be very clear. Sometimes and nowadays we are doing
bold
more
letters
online.
Should be written with bold letters, so that everyone.
Yes, nowadays we are doing everything online, sir. So yes. So I think it's getting more digitalized nowadays.
So writing legibility, okay. What I am trying to say is, on the prescription of your paper, do you write on the blank paper?
No, sir.
Then
the name and the registration number of the physician should be mentioned.
Your name, qualification
and the
registration number, most important.
Should be mentioned.
Those things should be there. I mean, you have assumed it is there, is it not? But that is, we are just for repetition purpose, it should be there. And then, as you said, patient name, age, sex and other things, diagnosis of the illness, and as sir said, legible and bold letters should be there. Then
it should be, generic name should be written instead of trade
most
names.
important, now NMC insists that it should be generic only. Okay, and we have no choice to send the patient for a separate, I mean another company or something we should not name. We have to write only the generic drug, which patient and family members also understand, and that should be most important thing. We write generic. Then what?
The route of the drug administration should also be written.
Very good.
Whether
it is oral,
frequency. It's better if even if the time is also mentioned, it's much better.
Excellent.
Timing of the drug.
Then
how long it should be taken, for how many days.
Very good. Anything more? Prescription when we are writing. Side effects you have to explain. Now, recently, just a few days back, Supreme Court judgment has come stating that the doctor is not responsible for not explaining the side effects to the patient. We are not responsible. It is responsibility of the medical company which has produced the drug and pharmacist who has dispensed the drug. We know they are given a catch paper where what are the indications, what is the drug and other things. So that is produced by the company people. While the pharmacist who dispenses the drug has to explain all the side effects. The doctor is not liable. This is the latest judgment that has come. So we have to see, if suppose we don't have a particular person who can explain, but you have to do all these things, is it not? We have to explain. And side effects we have to mention. What more? Anything? Time they have said 3 times daily or 4 times daily, and preferably write the time also, morning 8, evening, afternoon 12, evening 4, night if it is QDS. So like that. Anything more? Regarding the consent. Informed consent is legally valid. Consent, see, patient comes to you, generally attends in the OPD, we need not take a consent, written consent or informed consent. You have to take it. It is liable on us. We have to take the written consent, and these days it is now with all of us having mobile phones and taking a video is easy. Audio, video, informed consent is the best thing to take. Even for a doctor, I had to undergo a small minor procedure, and I was given the audio video presentation. They have explained, sometimes very rarely it might happen, because they might say they got it signed on empty paper and later they have written. Once in the court these things will come, he will try to escape. I don't know, they have given it in the empty paper, I have signed. So, but here if you give, for especially surgery, you have to take audio visual consent. Till your procedure is over, you take it only a few days before, and post-operative you explain. Which one? We have to keep, if it is an MLC case, for long time. And routinely, even research, if we are doing some research work, and some files we have kept, these have to be kept minimum 7 years with us. If it is not an MLC case, these things have to be kept with us 7 years. But
they should come and take it. You should always, after 6 or 7 years, according to NMC guidelines, you have to publish in the paper a small statement you have to give. Small or big, no difference. You have to maintain the MRD department, that's all.
See, it might be difficult, but we have to follow. There is no other way. Earlier days, when we were considered as demigods, it's fine. We could do anything, and our own intent was good for the patient. And they also said, I believe in you 100%, whatever you do is fine with me. But these days it's not so. They are explained, they are Google scholars who are coming. In fact, we have to keep on the board, Google scholars consultation is double fees, because they come out with their own topic things and other things. So a patient who comes to us complains of a classical case about Google scholar and thing. A doctor has received a call in the emergency at night. So the patient Rahman calls him and says, sir, my wife is having pain in the right iliac fossa. Please arrange the OT, call the sister. We have to do appendicectomy. How can you say we will see? No sir, I have just checked up in Google and I know also things. So get it ready, why you waste time? Then the doctor asked, who are you? Mr. Rahman. So you belong to that place, is it not? Yes sir. I operated for your wife only few months back for appendicectomy, and you say your wife has again appendix. There is no medical history where there are 2 appendix in a patient and the patient requiring operation twice. And what was the answer? Which made the doctor fall down on the bed? Any guess? Yes. That's why I said, so patient then says, sir, you operated for my first wife, she is my second wife. Now with the experience I do these things. So sometimes these things just to keep you a little humorous, and this type of anecdotes happen to everybody in every profession, is it not? These are the things that make us a little recharged from routine daily practice. Anyway, the skills we have discussed, and then bedside teaching already we have mentioned earlier, the importance of bedside teaching. And what are the things in bedside teaching, the first thing you will take care of, sir? In bedside teaching, what will you do? Patient is lying on the bed, you are there, your students are there. So, before starting, what will you do?
Reports are checked and consent was taken for procedure. For examination purpose, as usual, inspection and palpation, percussion, auscultation, we will go systematic examination for all the cases, sir.
Anything more?
Patient consent also is needed, sir, because it is their indemnity we are seeing that. So patient consent is a must in all the, and you have to tell the students they need to come and learn like this. We need to explain a little bit more.
Just now, you are correct. Anything more? You heard outcome class just before this class. So in bedside, anything that applies to outcome.
We have to make the patient comfortable and explain the procedure to the patient before doing it. So we will be doing this to you. We will examine, and afterwards we will let you go.
So, students around.
What more will you explain? To the patient. Related to acting. Related to acting. How to, like communication we will explain. How to communicate with the patient in their own language. Examine and student, these are all student doctors. They have to learn from them. And make them comfort in their own language. Like students need to explain them in their own language. So in their own way, then it would be better.
So these are very important. Well, bedside clinic, apart from learning outcome, medical ethics also, your own language. You have to introduce yourself. I am your consultant, because they don't know. The nurses must have gone, male nurse must have gone. So I am your consultant. I have come here. I have seen your case. We are discussing your case in detail along with the student doctors. Please give me permission to do so, and then you have to do the examination of the patient. And another ethical practice which we have to do is, generally we tend to put our knee on the cot, bed, while teaching, or keep it on our hand on the cot, which doesn't convey a proper message to the patient. See, patient is lying on the bed, cot, and you keep your knee just for rest, and then you say. And also, lot of people refer the patient with the number, ward number. This patient is 20 bed, number 20. Never do it. He has a name. He is as human as you. So all these things we have to take care in bedside clinics, and more practical skills which you imbibe, like medicine we have discussed earlier. In all specialities, how they impart the skills. Is it not that they can be taught? And a good patient in the exam For the first doctor it's fine. But by the 10th doctor, examination student, for the first time he will be very cooperative. But for the 10th time, 10th patient, 10th doctor goes for exam, he will be very uncooperative. You are pressing, I am having pain, tenderness, all these things like this. And luckily, when I had to face the exam, that patient was so intelligent, I don't know what he saw in me. He told the diagnosis also. Because people have seen him. So he told the diagnosis and everything. So sometimes we are lucky in getting such cooperative patients. But sometimes even the medical doctor can mistake. I still remember my colleague, Dr. Usha Kiran, who was supposed to be the beauty of my college during those days. And this patient told, I am suffering from pleural effusion. But the only thing is he didn't say which side. Which side? And the moment examiner said, she said which side means, she said on the left side, when the pleural effusion was on the right side. So as lady doctors should apologize, should pardon me, as beauty and brains don't coexist, she said the same words. So sometimes these things happen in our exams and other things. Okay? So this type of skills which we have to go through. Then projects, seminar presentation, experiential learning, PBL stands for problem based learning. So you give a problem which the patient has, even the patient having pain abdomen is a problem. And they have to discuss diagnosis, differential diagnosis and management plan. So these are all things which come under practical and clinical teaching. So skill is the ability to perform a task leading to a specific predefined outcome. So we were asking what to do. Not only it should be leading to a predetermined outcome. So already we have discussed intellectual or cognitive, which includes clinical reasoning and decision making skills. Procedural or psychomotor skills that require manual dexterity and include laboratory and clinical skills. Then communication skills. Then finally team skills including leadership skills. So when I was doing my internship, at that time I wanted to do general surgery, beginning days, because everybody has a lot of bow about surgery. Other physician comes later. But so when I was posted in general surgery, my professor asked me a promise to make. He said, your dexterity of hands is so excellent. Please promise never to take general surgery as a specialization. So it needs skill, psychomotor skill. They say surgeon hand. Even not only during this thing, later, though theoretically he might be average or above average, he might be excellent in psychomotor skills. That is most important thing which they gain. So anyway, as far as medical side was concerned, regarding murmurs and other things, I was finding very difficult. Next choice was pediatrics. So in this small heart, I don't know where to put the step and what type of murmur it is. So I thought, so my father who is a physician said, again he asked a promise not to take general medicine. That's how I came to psychiatry. And you know, psychiatry needs communication skills. Is it not? So though other skills I lack, I think communication skills are quite okay. So that's how I became a psychiatrist. Then competency. See, this is a very good definition. The habitual and judicious use of communication, knowledge, technical skills, clinical reasoning, attitude, values and reflection in daily practice for the benefit of the individual and the community being served. So you use all the skills, communication, techniques, all this, your own reasoning, attitude, all these things, you will use it, and that is called competency. How competent you are, that is the question. Then of course DOAP stands for demonstration, observation, assistance and performance. A practical session that allows the student to observe a demonstration, assist the performer, perform in a simulated environment, and then under supervision, and later you do it independently, which we all follow. Initially demonstration, just you show him how to do it. Even in the first step, you just show it. You don't explain the steps. Second step, you show it and explain the steps. So we are doing this, we are cleaning, we are going to put a knife here, incise and draining. That's what we are going to do. And then third step, you ask the medical graduate to tell the steps you will be doing, but he should tell the steps of the procedure. And next step, ask him to do it and you will be assisting. And finally, he will do it independently. That is how we are trained, is it not? And it is most important, because in other non-medical branches it is different. But we deal with life and death situations, and any other untoward incident happens, it becomes very problematic. Even if it doesn't go for medical legal also, your own consciousness doesn't permit you if you do wrong. So that is what you have to learn, and in the demonstration, observation, assistance and performance. Already we have discussed this. So this is one which Madam was also mentioning about the logbook for the final year students or interns. We have to certify that he is competent to go out and do the work. Responsibility, the IMG, after his internship he is able to do. So here you can see, depending upon his ability to do, we will certify. As you see here, awareness of skill is sufficient. That is very low. Then you building capacity, consider collaborations with institutions where feasible, and he knows how to use lab and other things. So if awareness of skills are low and his competence is low, then he can be certified of not independent performance, not essential. Consider opportunities to observe or assist. So he cannot be qualified for doing independent activities. He can observe and assist if his capacity is minimal at that level. Later he might have to improve his competency. So this is how we approach the competency based skill development. Review of the competency, determine level of competence or proficiency, plan a learning session with stepwise progression to achieve the competence, determine method of assessment of skills, and if required, certification of acquisition. How his skills, this is very important according to NMC at this moment. Once the IMC graduate leaves, he has to be certified. Previously, I give my frank thing which I have done earlier for internships or final years in the logo book. The logo book is not given by the people for 6 months. So how he has performed in that institute, we do not know. Then he brings the book after his posting is over, 3 months later, 1 month later, or at the end he brings it. And what we have to do, I don't remember even that person, he has worked with us. And I have to write his competency, I have to write his skill, I have to write his communication skill, I have to write all his capacity to deal with the patient, I have to write how he moves with the group and his interaction. So I put it average or above average. That's what, though I might be punished for this act, that's what we were doing. But now with medical education, people coming and telling all these things, I have changed now, and now I spend some time and tell at least the intern who is posted, even if he doesn't bring his logbook, I make a note about his performance on a white paper and keep with me. So that later when he gets the logbook, we can write it. Logbook is very important. And as madam was mentioning about dossier, that whatever activities he has, the books, whatever he has done theoretically, all those things we have to keep and record. So already you have been taught about knows how, shows how and perform. Knows how is cognitive, shows how again psychomotor, and perform again require independent demonstration of skills by the learner in patients. So whenever you are planning a session, what are your objectives? Exactly how to do, how to plan. What do you want that in turn, once you complete your talk, what are you expecting from him? What is the end result? How does he change after your training in the last 2 weeks? So here, define objectives, derive lesson plan, plan assessment and create resources. That is again important. Then preparatory sessions, skill acquisition sessions, faculty guide, student guide and assessment guide. These preparatory sessions, knowledge sessions, already you have been taught about self-directed learning, review of videos, observation, deconstruction, then resources, skill lab aids, the time faculty learner, practice time feedback, and finally the assessment, whether it is formative or summative assessment. So I was mentioning the resources are very important. You want to teach but you don't have a mannequin. What will you do? You should have a good skill lab to train your students and interns in the skills. So what are the basic desirable and recommended for MBBS Indian medical graduate, which you all have mentioned already in the first question and answer session. So now just go through. Specialty general medicine, venipuncture, intramuscular injection, intradermal injection, subcutaneous, IV, setting up IV infusion, blood transfusion, urinary catheterization, basic life support. This is very essential these days. And oxygen therapy, aerosol therapy, Ryle's tube insertion, lumbar puncture, pleural and ascitic aspiration, cardiac resuscitation, peripheral blood smear interpretation, and bedside urine analysis. These are the minimum things that are expected from general medicine by the Indian medical graduate. Anything you would like to add? Few of 50% you have already mentioned. To complete the picture, I have projected this slide. Any more? Any suggestions? Sir? ECG, yeah. That is also very important.
It is a must. They certified, without this, we are not sending them for exam. All this they have to be, it is to be fulfilled. This certified skill means it has to be certified by the faculty and the signature should be there. Faculty signature and student signature should be there in the logbook. And record also. That record is very, very important, whether the certified skills are fulfilled or not. Then only we can send them for the final exam. Yes? Attempts, number of attempts, sir, when we have written the competency, degree we are deciding. Isn't it, sir? Degree, we are deciding. When 3 attempts, 2 attempts, so when they do for the first time, it may not be satisfactory. So, second attempt, third attempt, we should never tell that student failed. Till they pass, we have to train them. That is the concept, sir. No student should fail according to Cbme. No student should fail. That is what they, the complete concept is that. Our training should be like that.
I think the, yes, sure.
What is that in the bracket, sir? Study for demo. Sir, abbreviation. I is there, no? Independently, I means independently they should perform. D means demo. O is O, D, I is there. O is for observation, D is for demo, I is for independently perform.
Where is this written? ఈ లిస్ట్ అంతా ఎక్కడుంది సిబిఎంఈలో? మీకు ఈ లిస్ట్ ఎక్కడి నుంచి దొరుకుతుంది అంటున్నా? సార్ ఆల్రెడీ చెప్పారు థర్డ్ స్లైడ్లో. లాగ్ బుక్లో ఉండదు, థర్డ్ స్లైడ్లో చెప్పారు సార్. ఎవరు ప్రెజెన్స్ ఆఫ్ మైండ్ ఎట్లుందో తెలిసిపోతుంది. ఎన్ఎంసి వెబ్సైట్లో ఎన్నో ఉంటాయి, ఏది తీసుకుంటాం సార్? కుప్పలు కుప్పలు ఉంటాయి, దాంట్లో మనకి వెతికినా దొరకవు ఎన్నోటు. స్కిల్ మాడ్యూల్ 5, ఓకే, అది సార్ చూపించారు ఇందాక. ఇవన్నీ ఇంకా వేరే దగ్గర ఒక దగ్గర ఉంది, సర్టిఫైబుల్ నాన్ సర్టిఫైబుల్ అని సార్ మేడం చెప్పారు. అది ఎక్కడుంది? నాన్ సర్టిఫైబుల్, అది ఇంపార్టెంట్. దట్ సేమ్ థింగ్ విల్ గో ఇన్ టు ద లాగ్ బుక్. అది ఎక్కడ మెన్షన్ చేశారు? ఇన్ యూజీ కరికులం వాల్యూమ్ 1, 2, 3 అని ఉంది కదా, దాంట్లో ఉంటుంది. కోర్ నాన్ కోర్ అనేది కూడా నిన్న శబ్నం మేడం చూపించారు కదా, దాంట్లోనే సర్టిఫైబుల్ నాన్ సర్టిఫైబుల్ కూడా దాంట్లోనే ఉంటాయి. కానీ వాట్ ఆల్ skills you need to teach and to what extent will be given in this skill module only according to department wise. ఇంకా మేబీ ఇంక 1 year లో నెక్స్ట్ ఎగ్జామ్ వస్తుంది, అది part 2 కి. సో that will be something different. I think clinicians will face a different phase there because things are still not clear. ఇప్పుడు present ENT ఆఫ్తో కమ్యూనిటీ మెడిసిన్, I mean ENT ఆఫ్తో ఇప్పుడు థర్డ్ ఇయర్లో రాయరు, ఓన్లీ కమ్యూనిటీ మెడిసిన్ అండ్ ఫారెన్సిక్ దే ఆర్ రైటింగ్. ENT ఆఫ్తో ఆల్సో ఈస్ బీన్ పోస్ట్పోన్ టు ఫైనల్ ఇయర్. ఇప్పుడు థర్డ్ ఇయర్లో ఎగ్జామ్ ఓన్లీ ఫారెన్సిక్ మెడిసిన్ అండ్ కమ్యూనిటీ మెడిసిన్ 1 year అయ్యాక. అది అయ్యాక 18 months అయ్యాక ENT ఆఫ్తో మెడిసిన్, సర్జరీ, గైనెక్ ఆల్ విల్ బి దేర్ with only MCQ examination. That is next one. Next అయిన తర్వాత no practical examination, 1 year internship, then next 2, then your clinical skills examination. So this basis marks only will go for their PG. One good thing is they can repeat their next one exam. So I don't know ఫ్యూచర్ లో క్లినిషియన్స్ వాట్ టైప్ ఆఫ్ గైడ్ లైన్స్ వస్తాయో తెలీదు. ఇది కూడా ఈ రోజు ఉండింది, రేపు ఉండట్లేదు. సో వీఆర్ చేంజింగ్ ఎవ్రీ డే.
If you see that NMC website, every day
skill assessment, only skill assessment.
After inter, no essay questions, no essay questions. That will have, sir. Only clinical subjects.
All other 80% will be theory. That is first year, second year, third year. Whereas for final year, medicine, surgery, gynec, ENT ఆఫ్తో తీసేశారు, అది ఫైనల్ ఇయర్ కేసేశారు. వాళ్ళందరికి ఓన్లీ MCQs, థియరీ క్వశ్చన్ పేపర్ అనేదే లేదు. MCQs. They can give that also questions. వాళ్ళ క్లాస్ ఉంది అంటే ఎక్కువ ఉండదు, మోస్ట్లీ పర్సంటేజ్ విల్ బి లెస్. ఎస్పెషల్ థియరీ అండ్ MCQ లేదనేది లేదు సార్, కంప్లీట్లీ లేదనేది లేదు. ఫస్ట్ ఇయర్ నుంచి ఏ సబ్జెక్ట్ అన్నా అడగచ్చంట, కానీ పర్సంటేజ్ తక్కువ ఉంటుంది. ఫైనల్ ఇయర్ సబ్జెక్ట్స్కి ఎక్కువ వెయిటేజ్ ఇస్తాడు. దిస్ ఈస్ ద గెస్, ఇంకా ఎంత వెయిటేజ్ అనేది ఇవ్వలేదు, కానీ బేసిక్ సైన్సెస్ నుంచి కూడా ఇస్తామనే చెప్తున్నారు. గైడ్ లైన్స్ లో అయితే బేసిక్ సైన్సెస్ నుంచి కూడా ఇస్తాము, ఎంత వెయిటేజ్ అనేది చెప్పలేదు, కానీ ఈ సబ్జెక్ట్స్కి ఎక్కువ ఇస్తారు. దాంట్లో సైకాట్రీ, పల్మనాలజీ అవన్నీ కూడా ఇంక్లూడ్ చేశారు. ఆర్థోపెడిక్ నెక్స్ట్ 1 తీసుకోరని ఇప్పటి వరకు అయితే చెప్తున్నారు. నెక్స్ట్ వన్ కావాలంటే వాళ్ళు ఇంప్రూవ్మెంట్ ఎగ్జామ్ లాగా కూడా రాయొచ్చు అంట. బిఫోర్ ఇంటర్న్షిప్ గైడ్ లైన్స్ అయితే లేవు, ఇప్పుడైతే గ్రాస్ గా ఇచ్చారు. ఆల్ వస్తాయి. కమ్యూనిటీ మెడిసిన్ రాదని కాదు, బేసిక్ సైన్సెస్ రావని కాదు, వచ్చేస్తాయి. కానీ వెయిటేజ్ కొంచెం అటు ఇటు ఉండొచ్చు. అలా ఉంటుంది. బట్ ఆన్లైన్ అన్నట్టే చెప్తున్నారు సార్. ఆన్లైనే. మనకి ఇప్పుడు ఎంట్రన్స్ ఎగ్జామ్స్ ఉంటాయి కదా సార్, నీట్ ఎగ్జామ్ లాగే అనుకుంటున్నారు. మనం నీట్ ఎగ్జామ్స్ కండక్ట్ చేస్తాం కదా, ఆ టైపే అనుకుంటున్నారు. మేబీ విత్ ఇన్ 1 or 2 months వచ్చేస్తాయి. నీట్ ప్రాసెసే సార్. కానీ డిఫరెన్స్ ఏమంటే ఇప్పుడు ఇంటర్న్షిప్లో వాళ్ళు స్కిల్స్ నేర్చుకోవాలి అన్నట్టు పెట్టారు. మరి అది ఎంత 1 year సార్, క్లాస్లో ఇస్తారు. అదే సార్, క్లినికల్ ఎగ్జామినేషన్, కంప్లీట్లీ క్లినికల్ ఎగ్జామినేషన్, మోస్ట్లీ ఆస్పీ అలాంటివి ఇస్తున్నారు. మరీ తీసుకున్నప్పుడు ఎప్పట్లా.
Why it is made like that is, house surgeons, interns, they are not learning the procedural skills during internship. They are preparing for NEET. That is why they made this. So step 1 they will be writing MCQ examination, so they don't need any preparation. They will be concentrating on the procedural skill because that is the assessment they have to face at the end. Betterment also they have given the guidelines, sir, like average of the previous exam and that exam will be taken, not this.
ఇంకో గైడ్లైన్స్ కూడా ఇచ్చారు సార్. నెక్స్ట్ ఎగ్జామ్ 2 పాస్ అయ్యే వరకు నెక్స్ట్ ఎగ్జామ్ 1 రిపీట్ ఎగ్జామ్ ఇవ్వకూడదు అంటారు. పాస్ అయితే
clinical. So that will be under university. That is again by university, sir.
మరి ఆ కేస్ బేస్డ్ ఉంటుంది అనుకోకండి. దే ఆర్ ప్లానింగ్ యాక్చువల్లీ ఫర్ ఆస్కీ స్టేషన్స్ ఓన్లీ. మెయిన్ ఆస్కీ అని అంటున్నారు.
That is by university only. So like practical examination.
కాంప్లికేటెడ్ చేయొచ్చు వాళ్ళు. ఎందుకంటే
Actually
వాళ్ళంతా పేసెస్ చేస్తారు. అంటే పేసెస్ లో అయితే ఎవ్రీ సిస్టమ్ ఎగ్జామినేషన్ పెడతారు.
now ASPE already we have started, sir. Clinical side also ASCII is introduced. In every college ASCII is there. Mannequins will be there. ASCII station should be there for exam. That only they are practicing now. So they will it will come to gazette, sir, before NEET exam. The gazette has not yet come. The guidelines and all we are waiting 2-3 months. Within 2-3 months we may have one meeting, virtual meeting with NMC people for all the colleges. Like link will be provided, we will sit and we will listen. Means a few colleges only will be there. We can ask any doubts or clarifications they will give. That will be repeated. Means 3-4 sessions will be going on like that. With 1 week it will be spread into, it will be college wise they will be dividing. Link will be provided and few colleges will be there. Like that, online session only. The meetings will be like that. So after that virtual meeting, after clarifying the doubts, then only the gazette will be.
Thank you, madam. Still the things are in a liquid stage. Complete things have not been solidified. I think the moment the medical education first batch will come to medicine, surgery, gynec, and after that we will come to know the pros and cons. In fact, if you have observed, this medical education training is more on US based. Well, we were more related to UK based training earlier when we did our MBBS. This is more of USA based. Yeah. Probably that would help them in USMLE and other things while doing this thing that way. So anyway, after general medicine, general surgery, basic suturing, eye is independent. So basic suturing, basic wound care, basic bandaging, incision and drainage of superficial abscess, early management of trauma and trauma life support. This is again demonstration. They don't have the independent role. Then orthopedics, you have already sir said, application of basic splints and slings, basic fracture and dislocation management is again observation only. Compression bandage can be done independently. Gynecology, madam has already said, per speculum, per vaginal examination independently. Visual inspection of the cervix with acetic acid, again observation. Pap smear sample collection independently. Intrauterine contraceptive device insertion, which madam has mentioned, again can be done independently. Obstetrics, episiotomy, normal labor and delivery, and all this independently. The person should be qualified. Then pediatrics, neonatal resuscitation, setting up of pediatric IV infusion and calculating drip rate, setting up pediatric intraosseous line. These are the things by observation only. Forensic medicine, which is very important, medico-legal point of view, which we didn't discuss much. So here, documentation and certification of trauma can be done independently. He can make the notes of wherever the injuries are there, superficial, deep, in the body, wherever they are, he can do independently. Diagnosis and certification of death, it's not independent thing. He has to take other help. Legal documentation related to emergency cases, again not independent. Certification of medical legal cases, age estimation, sexual assault, again not independent. Establishing communication in the medical legal cases with police, public health. So in forensic medicine there is only one skill which which the IMG can be doing independently, is documentation and certification of trauma. All other things, especially involving medico-legal cases, the intern or the Indian medical graduate can't do it independently, can't certify independently, like sexual abuse, age level, determination, these things he can't do it. Then ENT, anterior nasal packing during the bleeding, and otoscopy he can do by himself. While ophthalmology, visual acuity testing independently he can do, eye irrigation he can do, and installation of eye medication, ocular bandaging, all this he or she can do it independently. Only digital tonometry, that has to be demonstrated, not to be done independently. I don't know why this, I think some ophthalmologist should tell us, because a digital tonometry is not something very highly skillful. You have to just place it on the upper part of the eyelid and you get it the measurement, but how to put it and place it probably different. I don't have an idea. So these are the minimal skills, as madam was telling, minimum basic skills that are required by Indian medical graduate. If you learn more, that is fine, it's a bonus to the patient. So clinical teaching strategies, clinical encounter conducted by the physician and teacher, clinical case presentation, case-based discussion, clinical problem solving exercises, structured case presentation models, snaps, and 1 minute preceptor model. These are the various models which we will go through, and especially the case-based discussions and clinical problem solving exercises are very important in our curriculum, where we have to learn how to go for, how to think, and what are the differential diagnosis, pros and cons of each, and then management plan. All these things will come. So what do you mean by preceptor? 1 minute preceptor. What is this preceptor? Any idea? Something equivalent to teacher. But apart from that, it is only teaching. Apart from routine teaching theoretical, he will be also mentor. That is why they call it preceptor. Okay, 1 minute preceptor. So short case presentation or spot you have to do. Then here you get a commitment first, ask what do you think is going on with the patient, provide assessment of students' knowledge, skill, teacher's interpretation of the data, probe for supporting evidence, what led you to this conclusion, reveal student thought process and identify knowledge gaps, teach general rules, say when you see this, always consider this problem, or offer perils which can be remembered. Reinforce what was done right. You did an excellent job of doing things correctly. That is positive reinforcement, which is very essential. And then correct mistakes. Even correcting mistakes, you should not be rude enough. You are wrong. You should not, it's not that way. As you have seen here, next time try to consider this. Comment on omissions and misunderstandings to correct errors in judgment or action. Suppose 1 minute preceptor, you ask a case where patient has presented with breathlessness. Okay. In 1 minute, what will you be able to, what if the student takes? Breathlessness could be cardiac, could be respiratory, could be renal. These are the three important causes. So how do you differentiate? Then, when the breathlessness is being presented, what are the things which should be considered? So, here you can add something more. Breathlessness, what would you say in few minutes to the person, to your student? You are making a diagnosis of cardiac breathlessness. Why? 2-3 things. What is the omission which the student has done, and what you would suggest him to do?
History, sir. One is history.
Yeah, history. So acute onset of breathlessness. Since a day.
Related with chest pain. Is it associated with any palpitations, sweating? So to rule out any myocardial infarction, or is it a typical chest pain, or breathlessness, is it due to failure, heart failure, or is it a renal thing? We need to, basal crepitations are there, then we need to rule out a cardiac thing, and ECG should be taken.
Clinically, what you have said, excellent differentiation. Then renal breathlessness, renal failure.
Flash pulmonary edema will be there. Okay. Then the swelling of both the lower limbs.
So edema of the both feet.
And puffiness of face.
Cardiac edema. Cardiac failure also, there can be edema. Renal failure also, there can be edema. Anything different? Heart hypothyroid. These are all the things which comes to our mind when we are examining an edema of patient. Is it not? Especially French differential diagnosis, the textbook where so many differential diagnoses for each symptom are offered. So how would you, sir? Renal.
History-wise, is there any chronic renal failure, or is there any a drug exposure leading to that? And then acidosis part, the type of breathing pattern will be different. And if you take an ABG, it will differentiate as an acidosis that is secondary to renal failure. If it is a cardiac part, then it's definitely onset, maybe is an acute or is a known case, or is it crepitations and then saturation, all those things will be able to differentiate.
So thank you, sir. So you would add and enlighten the IMG about this. He might think of few things correctly, few things which he is unable to think. You are able to throw light on that, and he will learn. Okay, that's what. Then patient is complaining pain abdomen. History is pain abdomen, acute pain. So what would you do? Acute pain abdomen.
The pain abdomen since 24 hours. Whether it is associated with vomitings, or where that exact pain in abdomen. There are 9 quadrants in lower abdomen or upper abdomen, and any vomitings or any diarrhea. Like that we will ask. Associated with any fever, any history of food, previous food take, any food poison history, then we will decide that.
Thank you, sir. Initially the IMG graduate might think of only 2-3 possibilities, but after you have thrown light on this, he will think of other issues also, and he will learn how to differentiate. Is it not? Now the patient, there has been some problem in the family, and patient has complained of headache following some precipitant factor. Patient is complaining headache. So the Indian medical graduate has taken the history, headache on and off since 2 weeks, and headache is severe. He thinks of the precipitant factor. He has been a failure in love, and so since then he is complaining of headache. That is what is very clear. So our professor will tell us.
It is mainly associated with stressor. It's a psychogenic headache. and there are no organic features like it associated with nausea, vomiting, all those things. We can exclude the organic etiology of migraine, and we have to be specific in which situations it might occurring very frequently. As the demonstrator said, it occurs usually with a stressor, and usually it worsens by evening. Usually the stressors, as the day progresses, the headache will be more towards the evening. It's an indication of a psychogenic stressor. Usually we have to think of a stressor in headaches. That must be a specific one with a problem only they use it to get, and we have to treat that stressor mainly.
So in 1 minute, sir has given a lot of parallels about how to deal with a headache, especially related to with tension headache. Any person comes with vague complaint without a classical organic basis, then we have to suspect psychological problem. And generally what I do is, if he complains of headache in this psychological person, I said, do you have also pain abdomen? He says yes. Do you have pain limbs? He says yes. So then multiple pains in the body generally suggest psychological thing. So within all these things we have to reinforce depending upon our specialty. So in OBG, patient has come, a young 16-year-old female patient has presented with galactorrhea since 20 days. So how would you proceed? She is very much worried. Naturally 16-year-old female presenting with galactorrhea.
First we have to see, we have to ask the history, sir, any use of, if she is under stress or using any antacids, gastritis related. So antacids prolonged use may stimulate prolactin secretion and it may cause galactorrhea. And we have to rule out organic causes also for increased levels of prolactin. So if we take detailed history when apart from galactorrhea, whether she is having any headache or vomitings, then we can predict the underlying cause in the history itself, and then we'll proceed with investigations.
Thank you, madam. You have forgotten us. Antipsychotics. They are the major culprits. All other things, antacids and other things you have said, you are true. And especially acute onset in young age, we have to inquire. And people also receiving psychiatric drugs, they don't reveal to the consultant. They just try to hide it. So then a lot of people, they go for MRI scan to rule out prolactinoma and other things, as you said, organic problem. Then finally lands with us. So that one we have to see. Then we have the anesthetist post-lumbar backache. How do you deal? What would you ask? Post-LP backache present.
Any neck pain, neck rigidity, and position variation, and the arm set.
The position itself be responsible for the backache, where you keep the person in
లేదు సార్, సుపైన్లో ఒకలాగా, సిట్టింగ్లో ఒకలాగా ఉంటుంది సార్. అంటే సుపైన్లో తగ్గింది సార్, సిట్టింగ్లో పెరిగింది, అగ్రివేట్ అయ్యింది సార్. అండ్
what I am asking is, apart from the pain variation in supine and while you are doing LP, you keep the person in full flexibility.
యు ఆర్ ఆస్కింగ్ అబౌట్ పీడీపీహెచ్ సార్? పీడీపీహెచ్ గురించి అడుగుతున్నారు కదా.
పోస్ట్ లంబార్, పోస్ట్ ఎల్పి పెయిన్, బ్యాక్ ఏక్.
ఎస్ సార్, సుపైన్లో బ్యాక్ ఏక్ నో సార్, అద్దెకేం ఉండదు సార్. బ్యాక్ ఏక్ ఏమి ఉండదు సార్, హెడ్ ఏక్ మెయిన్ సార్. అంటే అందరూ అలా అనుకుంటారు కానీ బ్యాక్ ఏక్ ఏమి ఉండదు సార్.
Could aseptic meningitis can cause backache where you have done the puncture? It can cause, is it? Headache, okay, but at the spot, infection, inflammation, local infection and local inflammation. I think you belong to the generation without any injury, infection, inflammation. You are doing LPs, but we were doing so many LPs earlier at our medical career. They used to have this complaint. It's good to hear that this type of headaches are not at all present following LPs by taking a lot of precautions. So these are all 1 minute things which we see, as we have already discussed this. Then SNAPs. What is SNAPs? SNAP model, S-N-A-P-P. No reference from the book, no reference from the Google. Already these things have been sent to you by online, is it not? So only thing was, the moment the book contained 165 pages, 300 pages, nobody downloaded them, nobody saw them. So summarize the history, first thing. Whatever history sir was mentioning, since how many days, is it associated with other problems? Then narrow, present 2 or 3 differential diagnoses. You come to 2 or 3 differential diagnoses. Then analyze, discuss evidence supporting against each item on the differential diagnosis. Then probe, based on the prior 3 steps, ask perceptor questions to help shape consideration of the differential diagnosis and management. Then plan for the management. Present a proposal for managing the patient. Then select, choose a question to pursue self-directed learning. You have to learn yourself. Here, you are no more spoon feeding. As madam has said, no more pedagogy. The MBBS students are adults by the time they come to us. So no question of spoon feeding. You have to stimulate them, they have to learn. Then self-directed learning is very essential. So this is how SNAPs model. We all do these things, but we didn't label it as a SNAPs. To understand things in better, summarize, narrow, analyze, probe, plan and select. This is how we do. And how is the sitting, learning and teaching model in the clinical environment? As you can see, sitting in as observer. So student is there, teacher and the patient interacts. So the perceptor or teacher asks questions to this patient. He will answer. All these things the student will observe. He doesn't get directly involved. That is stage 1, sitting in as observer. Then 3-way consultation. So the perceptor asks the questions, teacher asks the questions, the patient answers, then student also asks the questions, student also interacts with the teacher. 3-way. And finally hot seat now. So the student directly talks with the patient. The perceptor and teacher doesn't get involved. Here again the student is left independently. That is the hot seat model. So here demonstration, 30 minutes, groups from 30 participants. Anyway, this we have discussed among ourselves in the first question. For faculty, teaching intellectual skills, physician, teacher, preferably by the student observing a clinical encounter. Clinical case presentations, case-based discussions, chart simulated recall, clinical problem solving exercises. In all these things, whenever we teach a skill, especially cognitive skill, especially related to our medical field, history is very important. History solves mysteries. That is the word they use. You can immediately come to some conclusion. So patient complains weakness. Okay. And suppose he says the weakness is more in the evening. By morning he is okay. But by evening, weakness is more. What do you think? What do you suspect? As the day goes on, as he works on. Asthenia, is it not? One of the things which we have to consider, daytime variation. And of course, from our side, endogenous depression or what we call a psychotic depression, early morning depression is more and by evening depression is less. It is reverse in endogenous depression. The morning depression is severe because serotonin levels are low at that time, and by the evening depression is better. That is endogenous, without any cause, without any reason, the depression presenting. When we say about reactive depression, there is a stressor, precipitant factor, and that results in depression. So by the time he wakes up, he is okay, because he doesn't remember anything. Once he goes to the job or other things, he has to face the problems. That leads to depression at that time. That is exogenous depression. So variation of the time in depression. As Madam said, we have to generally think in terms of myasthenia gravis. If there is a variation, we have to just rule out. It might be only a suspicion, but on examination it might not be there. So case-based discussions, we have discussed about breathlessness, how it differs, what type of breathlessness, all other things. These are all which skills? What type of skills? Cognitive, is it not? You think of knowledge-based. So cognitive-based skills. Structured case presentation model like SNAPS, that is summarizing, narrowing the differential, which we have discussed, probing the preceptor, planning the management, and then self-directed learning, and 1 minute perceptor, reflection, and metacognition. These are all the types of intellectual skills. So once you have discussed with your consultant who has advised this, who says he has given reasons from your 3 differential diagnoses, you have come to 1 diagnosis, and you have planned the management. He said these drugs to be given. Then you have to learn, self-directed learning. Go, refer the book, refer the, whatever it is, now online referral, Google, whatever it is, you refer and you will learn better. And once you learn, you will not forget. In self-directed learning, once a query is made, once you think of, then it gives you a lot of more remembrance rather than a teacher saying something. Is it not? And if you commit a mistake and that mistake is corrected, you will remember even more. I have done that mistake at that time, so I should not commit this again. These things, very small things we have to learn from the people, the skill and cognitive skill. See, patient has developed a reaction with a drug. Always make sure that on the prescription or on the case sheet on the top, you write that patient developed an anaphylactic reaction following this drug. Because tomorrow you might not be the consultant there in that particular hospital, or that patient might come after a long time which you don't remember about anaphylactic reaction. So always make sure that he has developed this type of reaction, which is again a cognitive based skill. So many skills are required. Then psychomotor skill. Here these are the things mainly. The trainer demonstrates the skill in real time without giving instructions or explanatory words. So you conduct a delivery, the graduate just sees. You don't tell him or her what are. You just conduct it and he sees it. That is demonstration. The second step, the trainer repeats the procedure, this time describing all the necessary sub-steps. That is deconstruction. This time, for each step what you do, you have to say, I am doing this, I am pushing the baby from the abdomen. Okay, these things you have to mention for each step. Then the trainer performs the skill for 3rd time, but this time the IMG person should mention the steps. He will not do it, but he has to mention the steps. And finally, the trainee performs the skill on his or her own thing. So similar, this is what we call as Payton's 4-step approach. Okay. This, I think, orthopedics, you can just tell me what we will do according using this model.
I will describe for the undergraduate. We will describe how to suture a wound. Probably for the first time we will demonstrate suturing a wound. Second time we will tell how to hold the needle holder, how to hold the wound with the forceps, how to do the suturing, how to do mattress suturing or simple suturing, all those steps. Third time again while performing and the same steps are repeated. Fourth time we will give the trainee the suturing and they will perform. You will be observing. Yeah.
So all these things you have been doing, is it not? While you are training your medical graduate, all these things you have been doing. But it has a specific model and specific name so that you can follow that. We don't forget more structural things. So that is Patton's 4-step approach, which is essential. Teaching psychomotor skill, demonstration of this method to all the participants during the workshop and feedback from the participants. You have attended recently a workshop, cadaveric workshop, is it not? So what exactly happened? What feedback did you give?
Actually, I was part of the mentor. Previously, I was the trainee. Then I became the trainer. What we do is we keep different stations for the workshop, and we segregate the participants into 4 or 5 groups. For each group, we will give a cadaver, and one mentor will demonstrate the technique first. Then he will give the instruments to the participants to perform the technique under his guidance.
So thank you very much, sir. You have been both mentor and mentee. Okay, of course that was a long back, mentee. Now you are a mentor only. So now regarding pathology, using the SNAPS model.
We will try to explain to the interns, showing on the bedside patient itself. We will demonstrate it so that for better understanding, visualization will be there. And the procedure also, we will give free hands sometimes so that they will also learn. And also we will explain them how to lead the full slide. Everything will be explained in detail by showing to them.
So all of you have been following these steps. Only we are labeling it and saying more structured. This is the procedure which you have to follow while teaching, so that everybody follows in a systematic way. That's all. That is the most important here is that. Then teaching psychomotor skill. When psychomotor skill training requires exposure to body fluids or biological hazardous material, students must be trained on the infection control and biosafety requirements beforehand, because you are going to deal with hazardous substances, blood, CSF, saliva, urine. This might be carrying a lot of things, and before doing those examination, you should know how to avoid those things, what things you have to do. Procedures involving dangerous steps like mouth pipetting should be avoided or replaced with suitable other technologies like bulb suction or vacuum aspiration. So earlier pipette means we were using only mouth suction. Now we have to use some other technology. Such technology is being used, madam or sir? Still mouth thing only on pipette? You are using the...
Pipettes will be there, sir. That we will be using.
Which one?
Pipettes, sir.
But suppose ESR is to be tested. Okay, okay. So there is no more unhygienous way of collecting. Okay.
Those all are outdated.
Outdated. Sorry, you are indirectly saying I am outdated. Because I am asking about those things. I accept. Being 68, definitely I am outdated. So these are the things which we have to follow. Then of course ATCOM model, morning madam has mentioned, and regarding this hazardous things which we have to be avoid not only during the procedure, how you have to put, where do you put the spirit cotton outside, the collected blood, all these things are very essential which Sai Leela madam will say for 2 minutes. Your microbiology, the dustbin collection.
Yes.
Infection control, as that says. What are the color bins? Where to put what?
Infection control, when it comes to infection control, biomedical waste management is one thing which has been neglected all the while. No matter continuous trainings from first year, second year, internship, still it is not being maintained. So what has been included is, now we have started training them as OSPE. We keep different color bins and we keep all the waste separately. And we have a checklist, and they have to, we ask the students to throw the certain thing into the correct dustbin. So based on the checklist, we give them a score. Anybody can actually very easily follow the checklist. That is the best thing. 4 color bins. Yellow. ఇలానే ఉంటుంది సార్, స్టూడెంట్స్ దగ్గర కూడా ఇలానే కథ ఉంది, అందుకే ఆస్పి పెట్టాం. Yellow, red, black, blue, sharps container, white container. Most commonly missed is that. So we are training in that way for infection control. And we are also started off with PP, donning and doffing. That also they demonstrate and show us. So we keep all the PP components and they will do the donning as well as doffing based on whatever question we keep there. So for that also we have a certain checklist. So the steps are followed in order. There's many marks. Keeping a checklist for OSPE and OSCE will help you a lot. And there are a lot of checklists which are already available freely online. So you can check them, get it printed, keep it in your department and use them. For clinical skills, bedside teaching, there are many checklists available. So you can use this. And those checklists will have communication skills, certain checklists, knowledge base, certain checklists. It can be used for multi-purpose.
So you will be taking a class on OSPE and other things for at a later date for the people. Who will be taking?
No, we teach them in the class. The theory is taught. Practicals, when they come, we follow OSPE. Because there is an OSPE exercise in exams, university exams. So we train them accordingly. And the same thing will be kept in the university exams, practicals.
Thank you, madam. So these days it is very important, even for NABH recognition and other things, these things have to be taken care by any hospital. And also for the sake of patient and for us, it is good that we follow these principles. Then ATCOM model, Dr. Sai Leela madam has excellently elaborated about it. Then communication skill lab. So communication ability to convey ideas or feelings effectively. Both technical and non-technical skills. With patients, technical skill, and when communicating with colleagues and nurses, non-technical skill. You give an order to your nursing staff to execute something. And when you are doing it, a technical skill can be also communicated, especially with patient. You make a diagnosis, then immediately he is perturbed. He wants to know about the prognosis, what would happen, what things are all these things. So these things you have to take to not only the patient but also his or her family. So the patient has been posted for delivery, a normal delivery was expected, 12 hours lapsed. So now you are planning for a cesarean, but you have to explain to the patient relative. So what would you say, madam? I think even before you would explain, if necessary you would go for cesarean.
Yes sir, nobody can predict whether the delivery will go into a normal or cesarean. So we counsel the patient accordingly at the time of admission only. What we do is we keep on informing the patient and attendants repeatedly regarding the state of labor. So whenever an emergency occurs, then there won't be any difficulty for us to convince there won't be any rukus from patient side. So we follow that technique so that we explain all the possibilities, possible complications in the beforehand itself. And we say that there won't be much time if a real emergency occurs, we have to rush. So So we try to counsel even before itself.
Thank you, madam. So even before surgery, you will be saying that we are planning for normal delivery, but we can't assure. Sometimes, if necessary, we have to go for a cesarean. Why I was particularly asking this question is recently in the press and DMH also has mentioned that cesarean deliveries are very much being done outside, and in private nursing homes it's being more, and they are to be blamed and they are to be taught not to do those things. Of course, there are various factors, patient factors, who wants muhurtam cesarean, who wants this particular day. So there will be so many other causes like I was mentioning, and especially during Ramalila statue installation, I know a few people asking for cesarean at that time, installation of Ramalala. So these type of things, we are not, so many other factors that are responsible, but the press tries to highlight the negative aspects of us, only say that the doctor is doing for monetary purpose or other things. They don't know all these things. And a lot of software people and parents also now have one son or one daughter, and మా అమ్మాయిని చాలా సున్నితంగా పెంచామండి, నొప్పులు తెలియవండి, నొప్పులు ఉండకూడదండి, నొప్పులు లేకుండా చేయండి. So what? Anesthesia? Cesarean. They are demanding. We are not suggesting. And so many things are there. That type of education they need. They need a medical education. And here the communication is very important. In fact, when I still remember my colleague who is a gynecologist with 30 years background, there was a prolapse of the shoulder. So later he did a normal thing, the child was healthy and the mother was healthy. Then the relatives asked, sir, prolapse of the shoulder has occurred, it seems, your assistant has mentioned, does it lead to complication? So this fellow said, మీ వాడు చాలా యాక్టివ్ అమ్మా, చేయి ముందర పెట్టేశాడు, మేము పట్టుకొని లాగవలసి వచ్చింది. So they understood the way we are presenting the communication. See how intelligently he is put. మీ వాడు చాలా తెలివైనవాడు, చాలా యాక్టివ్, అందుకని చేయి ముందర పెట్టేశాడు అనేటప్పటికీ they were very happy. So this is how where communication comes, how we communicate with the patient. Of course, sometimes VIP syndrome will be there. And explaining all the side effects also is sometimes as a problem. The person might not accept it. Is it not? So, for example, since 3-4 years, I am planning for a knee surgery. Since 3-4, everybody who meets me will say, you have not yet get it done. But every doctor, the orthopedician will say, it might recur, it might lead to infection, you might have some other problem, you might have pulmonary, because VIP syndrome, doing operation on a colleague, then they will be more cautious and they will explain all side effects. ఈ బాధ ఎందుకు కుంటుతూనే నడుద్దాం జరిగినంత కాలం అని చెప్పి పోస్ట్పోన్ చేస్తాం. సో ఎక్స్ప్లెయినింగ్ ది సైడ్ ఎఫెక్ట్స్ ఆల్సో సమ్టైమ్స్ లీడ్ టు ప్రాబ్లమ్, ద వే థింగ్స్ ఆర్ పుట్. వుడ్ యూ అగ్రీ, సార్? So this is Kmch declaration, essential elements in communication list. First, build a relationship. I am so and so, I am your doctor, please come out with all the things. So open the discussion and gather the information. Understand the patient's perspective, share information, reach agreement on problems and plans, and provide closure. This is how we communicate with the patient. So these are the things which are given, and scoring is done. Already we have discussed about the way, what is the patient's perspective, share information. From grade 0 to 3 they are labeled, and you give a comment on each patient according to the essential elements in the communication checklist. What are the gaps? Provide scores for each aspect of communication, strengths and areas of improvement. Further, how can we improve? How to deal with the family, peer facilitator, and self-assessment. Contains Likert scale shifted to global ratings, multi-rater methodology with gap analysis, assess communication skills, self-insight, self-reflection. That was only 1 week back a conference was done on the self-reflection. So then simulated or standardized patient. So what is simulated patient? Any idea? Simulated or standardized patient.
I didn't get question, sir.
Simulated patient.
Okay.
Standardized patient.
Difference, sir.
What is the meaning? Okay, simulated patient, what is the meaning? Yeah, for example.
An expert himself will act as the patient.
So we were discussing yesterday about sympathy and empathy. So this is empathy. He will mimic all the symptoms which patient exhibits, is it not? And our Sivakumar has raised a very pertinent question. Is it for inspection purpose or is it for other purpose, exam purpose? Probably they differ. Anyway, they are trained in that. Is it not? A standardized patient is trained to give the history and other things so that they learn from that. So here deliberate practice, reflective learning, and finally feedback. Experiential learning, immersive in nature and interactivity. What do you mean by immersive? All parents must have seen their kids immersed with videos, with mobile phones. They don't come out, you shout, you say loudly, still they are so much immersed with that such activity. So that is a good thing if we do it in relation to simulated based learning. Then deliberate practice, that is by Erickson, repetitive practice, then assess the skill, specific and informative feedback. After the thing you give the feedback, which again leads to better performance of the skill. And of course simulation labs, I have told you already. What is exactly mannequin means? Anybody? Non-medical meaning of mannequin. When you go across the cloth shops, you will see so many in the display. Physical, they are mannequins, the male and female with display of saris or pant and shirt. They are mannequins, originally meant word. Mannequin is displaying that. But we are using here as a patient where he will be able to see. Basic mannequin, for example, basic life support and other things, all of us have undergone things. There you don't need much skill or other thing in the mannequin. But latest full environmental simulation and mannequin with high fidelity type. So the moment, suppose you are testing appendicitis, the moment you put down the right iliac fossa, patient will, the mannequin will cry. Or you are doing a dissection, you can see all the vessels and other things there. Even in anatomy now mannequins have come into these are high resolution, high density mannequins. And now with the artificial intelligence and VR, virtual reality, is one of the thing which has come up where you can learn skills easily. So the task trainer mainly used for training basic skills, examination of rectum, breast and other things. This is what low, moderate and high fidelity which I was mentioning, the mannequins. Then simulating learning pyramid, simulation, plan, you do simulation, then you debrief it and finally you transfer the knowledge, transference. The skill lab requirements, it is there in your NMC website. If somebody wants to get a skill lab, what are the things that are required are available in the NMC website. And team building skills, group leader, group qualities, how to respect other members. Even on day one, madam was telling about the group leader by themselves coming or other people choosing, is it not? So there are few people have leadership qualities. Sometimes it is difficult to cultivate also. They might come by genetic, by environmental and also by cultivation. So that's what we have to see and develop leading skills. We have to lead a team of doctors tomorrow or a team of paraprofessionals. So you have to develop these things. And work-based teaching, where exactly you are working, there real workplace environment, feedback from peers, co-workers, bedside teaching already we have discussed, OPD based, emergency cases, all these things, and student doctor method which we are discussing. Interactive discussion with all participants about the student doctor method, challenges faced by the faculty and students, and what are the further suggestions you would offer? Apart from all this which have been displayed in the slides, any suggestions you would like to offer? You can offer in tomorrow morning feedback. Okay? And what are the barriers of clinical skill teaching? You can't teach for maximum number of students, time constraint, and different levels of learning. One person might be genius, other person might be below average and an average student. So that again plays a role. And patient safety concerns, constraints in providing developmental feedback, inadequate institutional financial support, these are practical problems. Lack of access to appropriate educational space. So lesson plan for practical clinical teaching, that can be done at next sessions. And these are the assessments already discussed: know how, and shows how and does. And these are the suggested readings. And thank you for patent hearing. Thank you very much.
So lunch break is there now. Before going for lunch, I want to tell something about the CISP program. It's a Curriculum Implementation Support Program. CISP means Curriculum Implementation Support Program. That new curriculum, the new things, what are they and how to implement, that will be trained, and it is going to make it mandatory for all the faculty, and so all of you will be the participants again for that program. So that also, like this only, we have to make the registrations, and payment will be 3,500 or something is there. So that I will be communicating later. After 1 month or so it will be there. That will be communicated to you all. 2 days program. 2 days. That is only 2 days program. That is Curriculum Implementation Support Program. We will inform you. But confirmation is required. Last minute cancellation is not done. If you are not coming, you have to inform earlier. Then we have paid but we are not coming. It is not so, because the list has gone to NMC means we have to give explanation if one participant is not coming. Means, and if like it happened yesterday, 6 people were not there in the beginning of the session. That means we could not start in time because of that. So that type of problem should not come. That is why I want to make it clear. Those who do not want to come, make it clear, so that your name will not be there in the list. So only when 30 members are there, we are going to organize. Otherwise we don't. And it is going to be mandatory again by NMC. So again and again we cannot call and ask you ask your name, details and all. So this is the opportunity for you to complete that. So I will inform you when we are preparing the list for that, and all of you can send the registrations and payment. After your consent only the list will be sent.
Any proposal?
But once it is given, that no cancellation and all, unless it is life and death problem, we should not cancel and we cannot withdraw.
Any proposed dates, ma'am?
Yes,
ma'am.
Means madam should be completing that regional center workshop, our Silpa madam. After that only we will be sending. That is in August 2nd and 3rd she will be completing the training. After that means maybe in August only. Means NMC approval should come. Then only we can conduct. After sending the list, that will go to, from regional center, they will be sending it to NMC. That is why it is been made meticulous. Any gap, any column, it is rejected by NMC. It is coming back again. That is why so many scrutinies are being done by regional center, then they are sending it to NMC. Lot of work is there, which is done by Dr. Shabnam for your batch. So many times we have revised that list, and we called everybody, and the last minute what happened yesterday, all of you have witnessed. So I don't want such things. Next time, be careful in this. This is what I want to inform you all. After lunch, please come back in time.
Meantime, raise your board and write one question first. That is the next task actually, the next section task. Just meanwhile we'll finish off that one. Not finish, we'll just get ready for that. Board మీద రాయాలి సార్ ఒక క్వశ్చన్. ఫస్ట్ ఒక క్వశ్చన్ రాద్దాం, టైం ఉంటే రెండో క్వశ్చన్కి వెళ్దాం. ఎవరి బోర్డ్స్ ఆడ తీసేసుకోండి. మార్కర్ 1 second. వన్ ఎస్ఏ క్వశ్చన్ ఫస్ట్. ఆ బోర్డు అంతకన్నా పట్టదు నాకు తెలిసి. నాలుగే ఉన్నాయి. అప్పు తీసుకోండి ఒక బోర్డు నుంచి ఒకరికి. పండి సార్ మార్కర్ లేదంట. 4 అంతే కదా. అబ్జర్వర్ వచ్చి ఏదో అయిపోతుంది అనుకోండి. మార్కర్ లేదు ఇస్తాను నేను. topic is aligning the teaching learning methods for objectives and competency. Okay, I am focusing one slide here. Each group just fill that blank. So make it fast. Each one group, you have to fill that blank. Can you guess one? The first one. What teaching learning method you use for that? The first one. I am not asking in the group. Each group one I'll ask randomly. Okay, second, I want you, this group to tell the first answer for that. Choose one TLM method for that sentence. You talk to the student. Which teaching method, teaching and learning method you use for that? You talk to student. Very good. And the second one, you talk with students. I am not asking everyone, I am asking the group specific. Second one, you talk with student. One student or group of students. You talk with student. To be precise, what kind of that interaction? What kind of that? What type of teaching? What is the method? Lecture means one way. I am talking to the student. That's what. I am not talking with the student, right? To the single person I am talking. Small group, okay. Any other better way? Seminar also one student. Tutorial? Can you accept tutorials? So the student, one student will come to us and can ask the doubts or anything. Tutorial is better for that. So third one, you have them to talk. Discussion. Now you can tell everyone because only two choice. I have many groups. Who is the first one to tell answers? You show them to how? The last, you show them to practical. Anything else? Performance. Okay. So you know what are the teaching and learning methods now. So for my topic, what is the objective of my section is you have to choose appropriate teaching learning methods for the competencies which I have given or objectives. Okay. So before this, when you are planning to teach the students, what are the consideration you take for the teaching and learning? What are the things in your mind? Suppose you are going to take the lecture to the class, or you are planning to lecture or demonstration or anything. You are planning for one class. So what are the consideration you think in your mind before preparing for anything? Maybe it could be demonstration or practical class or theory class, lecture. So what are the consideration you see? First one, tell one. Okay, the topic preference. Okay. Each group one tell. You tell me. Material. Okay. You think of the material and go to the class, or already the ma'am said that the topic, right? Okay. Anything else? Okay. The level of knowledge. Okay. So really imagine yourself you are going to take the class. So how you prepare and what are the things in your things? Images, okay. Easily understand. What do you really think? If I am going to take to the class, what do you have to think before preparing to the class? Stepwise. Okay. Do you think the class size is mandatory for us? If I am taking for this many, means we are 30 of the students, I can make a small group. If it is 200 students, what lecture I have to make? So what is the teaching method I have to do? Lecture means a size, right? If I am imbibing the knowledge, what I can choose? Lecture I can take or small group if it is a small number. If suppose doing the practicals, is that the same thing I have to choose? So what you will choose? Demonstration, bedside clinics, simulations. So it is based on your domain, size of the class, knowledge and the level of and which level where you are teaching. So all this you will keep in your mind and you go. Maybe you are not telling, but when you are preparing the class it will have in your brain actually all these things. So I think this slide makes worth. You know all this topic now. So the domain, group size, resources available. Suppose if 100 members I can't make the small group sections here. Because it is 30 I can make 6 groups and I can conduct the small groups. And the time frame. I can't take 1 hour or 2 hours in the small group, or maybe 1 hour lecture means 1 hour I can cover the topic, some topics. So the time frame is important, level of learning, as you said the covering of the subject. Okay, all this matters before you going to select what teaching method you are going to take. Okay. So before this, to convey simple fact, which is the better method. Simple facts means just To the knowledge, we are going to give the straight fact answers. There is no need of discussion or any argument. The simple facts I am going to give. So which is the better? Lectures can be better or anything else, not exact one. Can tell me some other things? Seminars is good. So if it is misconceptions, so I have some doubts in my brain, I have to clarify. Which one you choose? Discussions. Anything else? Tutorials. So the misconceptions or anything to perform, which one you choose? Bedside clinics or simulations, SP, videos, okay? So there is no single method that it will choose of. There is a multiple, but you have to select one. So the misconception, tutorials, group discussions, counseling and symposium based on the knowledge domain and the size and what is you want to convey to the students, okay? It's all facts and difficult concepts, especially tutorials and team teaching, group discussion is very important. It will make interesting. And for the psychomotor, always the three domains, your brain, your heart, your hand. I always use these three, hand, head and brain, and this heart. So based on the psychomotor, you take the hand, simulations and demonstration and bedside clinical. You can choose anything depending upon the topic. So finally, there is no single method. You have to pick as many as how much, in what way we can better convey that, and you have to take all the consideration and you have to do that. So finally, this topic is going to end with a group task. Each one task I am going to give. Initially, what we have to understand is before selecting any TLM method, first you have to identify the phase. The phase 1 student or phase 2. Phase 1 means MBBS first, phase 2 means second year or third year or fourth year, like that. Which phase I am going to test or take in the class or anything, okay? Which then you have to consider the domains. Then main thing is objectives. Prepare your objectives, then it is very easy for you to select your teaching learning methods. Suppose this is for the first group. What I wrote is the physiology, that is means first year student. This is my competence. You make it as an objectives, 2 or 3. Maybe when you are writing the objectives, how it should be, when you are writing the knowledge question, you are making for the knowledge, enumerate, enlist, describe, like that it should be. Or if it is like a clinical skills and all, you have to do the demonstration. Like that, the question should be framed here. Then you go with the TLMs. So take each one task. So this is for the first one. Note down in your paper. I'll give the second one. And my task is they have to present this, and the other group has to tell the what are the faults, how they can improve. How they can modify also is fine. Other groups also should tell the positive points or negative points, how they can improve in that. So take the first group, photo తీసేసుకోండి, so that I focus to the next. Time waste. So this is the first, which is the first group? 6. This is the first, okay. First అయిపోయిందా? ఫోటో తీసేసుకున్నారా? Okay, we'll go into the next. This is for the second group. Okay, take the photo of that. Instead of writing fast, you can make note of that competency and write in your paper. Are you done with that? So I am moving to the next one, third group. You can take the pic of this. Just note down otherwise. Okay, are you done with that? So next, 1, 2, 3, fourth group. It's not mine. I don't know which is the fourth group. Fourth. So fifth I'll give. This is the fifth. I don't know the groups. I put the 1, 2, 3, 4, 5. I'll show you. And this is the fifth, right? మీ గ్రూప్స్ మీకే కన్ఫ్యూజన్ ఉంటుంది, నాకు ఎట్లా కన్ఫ్యూజన్ ఉంటుంది. అప్పుడు ఐ హ్యావ్ టు ఆస్క్ దెమ్ టు రైజ్ యువర్ హ్యాండ్, విచ్ ఇస్ ద ఫస్ట్, విచ్ ఇస్ సెకండ్, విచ్ ఇస్ థర్డ్. సో దిస్ ఈస్ ద ఫిఫ్త్. హూ ఇస్ ద ఫిఫ్త్? ఫిఫ్త్. సో ప్లీజ్ టేక్ దట్ వన్. అండ్ ఫస్ట్ యూ హ్యావ్ టు టేక్. ఐ డోంట్ నో, చూద్దాం. ఇది అయిపోయిందా? ద లాస్ట్ వన్. నేను అడ్డం లేస్తాను, ఒక్క నిమిషం. This is the 6th group. This is for the 5th group. Okay. This is for 4th group. 4th group. Okay. This is the group 1. Who is the group 1? Okay. Please take that one. Thank God you recognized your groups now. Can you take the photos of that? Okay. Shall I move to the next slide? Okay. So this is for the second. This is for the third. Third group. Who is the third group? Third. This is for the fourth. Who is the fourth? Sir, fourth group తీసేసుకున్నారా ఫోటో? Fifth. This is for fifth. తీసేసుకున్నారు. This is for sixth. I am giving 5 minutes. Try to do the objectives. Choose the TLM. And you have to come and write your objectives and TLM there. The other group will give the points, or maybe correct, or he will say yes. We'll check. I will tell you what are the objectives. For the starting of the class, every time you will say, end of my lecture class, the student should be able to know or define or something. You will put, that is the first lecture, that is objective. For this competency, make 2 or 3 objectives. One to write, know the definition or etiology or demonstration. Like that, 3 objectives you put, the TLM will be easy. When you write that objectives, the enlist, the describe, define, not the define, describe, enlist, like that it should be the question. Choose your group leader also. They have to come and write on the board. ఆబ్జెక్టివ్స్ ఏదైనా కావచ్చు, సింపుల్ ఆబ్జెక్టివ్స్ సెలెక్ట్ చేసుకోండి. అంటే మీ క్లాస్కి నేను ఈ 3 చెప్దాం అనుకున్నారు అనుకోండి, ఆ 3 క్వశ్చన్ ఫ్రేమ్ సరిగ్గా చేయండి. డిఫైనో, డిస్క్రైబో, ఎన్లిస్టో, అది చేస్తే ఇది ఈజీ. ఆబ్జెక్టివ్స్ 3 అట్లా చేసుకోండి. డెమాన్స్ట్రేషన్, ఎన్లిస్ట్, అలా డిపెండింగ్ అపాన్ యువర్ క్వశ్చన్. ఆబ్జెక్టివ్స్ సింపుల్గా చేసుకుంటే అంటే టీఎల్ఎమ్స్ ఈజీ వస్తాయి. ఆబ్జెక్టివ్స్ అంటే ఒక క్వశ్చన్ ఫ్రేమ్ చేయటం, మీరు చెప్పాలనుకున్న మెథడ్ లేదా స్టూడెంట్ వాట్ దే హ్యావ్ టు నో ఎండ్ ఆఫ్ యువర్ క్లాస్. అంటే మీరు ఇథియాలజీ చెప్పాలనుకుంటున్నారా, డెమాన్స్ట్రేషన్ చేయించాలనుకుంటున్నారా, ఎన్లిస్ట్ చేయాలని, అది చేయగలిగితే ఆబ్జెక్టివ్స్, మిగతా అన్నీ ఈజీ. అదే మెయిన్. ఎనీ హెల్ప్? ఇది మెయిన్ కాంపిటెన్సీ అంటారు. ఆబ్జెక్టివ్స్ అంటే దీన్ని విడగొడతాం, ఒక్కొక్క క్లాస్ ఒక్కొక్క రకంగా చెప్పుకోవచ్చు. లేకపోతే ఒక ఆబ్జెక్టివ్ అంటే నువ్వు టు డిఫైన్ ఆర్ ఇథియాలజీ ఆర్ డిస్క్రైబ్ ద ప్యాథోజెనిసిస్, ఆర్ ఇప్పుడు ఒకరికి హెచ్ఐవి అనుకోండి, డెమాన్స్ట్రేట్ ఆర్ ఎన్లిస్ట్ ద కాజెస్, ఎనీథింగ్. మీరు దానిలోనే 20 రాయొచ్చు ఆబ్జెక్టివ్స్, 2 రాయొచ్చు. కాకపోతే సింపుల్గా ఉండాలి. ఆబ్జెక్టివ్ అనేది ఒక క్లాస్లో ఒకటే చెప్పగలం, ఎంత చెప్పగలం అనేదాన్ని ఆబ్జెక్టివ్ కిందకు వస్తుంది. అయిపోయిందా? అట్లేం అవసరం. అంటే ఆబ్జెక్టివ్స్
interpolate the individual family results to community. చేయాల్సిందే. మనం ఇప్పుడు కమ్యూనిటీకి ఎలా రిఫ్లెక్ట్ చేస్తాం? 4 రాయాలంట, 3 అన్నారా? అయితే అప్పుడు ఇక్కడ ఆబ్జెక్టివ్ ఏం రాస్తావు? అది ఇంగ్లీష్ ఎలా వాడాలి అన్నట్టు. మన ఇండివిజువల్ ఫ్యామిలీ తీసుకున్న దాన్ని కమ్యూనిటీకి చేయాలి. కమ్యూనిటీ ఇండివిజువల్ ఫ్యామిలీది కమ్యూనిటీకి చేయలేము. లేదా టు ఎస్టిమేట్ ది, అది మేడం చెప్పింది బాగానే ఉంది. టు ఎస్టిమేట్ ద న్యూట్రిషనల్, లేదా ఆ వర్డ్ ఇన్ కమ్యూనిటీ. అయిపోయింది. డెమాన్స్ట్రేట్ ది న్యూట్రిషనల్ స్టేటస్ ఆఫ్ ఫ్యామిలీ అయిపోయింది. దాన్ని కమ్యూనిటీకి ఎలా రిఫ్లెక్ట్ చేయాలి? మన 3rd పాయింట్ అది. డెఫిషియన్సీస్ అవ్వాలని ఏముంది మ్యామ్? ఒబెసిటీ కూడా అయ్యి ఉండొచ్చు కదా మనకి. న్యూట్రిషనల్ ఇండిసెస్ చెప్పచ్చాము, డెఫిషియన్సీస్ కాకుండా. మెజర్ ద న్యూట్రిషనల్ ఇండిసెస్. అది కూడా 2nd పాయింట్. మన న్యూట్రిషనల్ అసెస్మెంట్ అన్న ఇండిసెస్ అని ముందు థియరీ తీసుకుంటాం, తర్వాత బెడ్సైడ్ క్లినిక్ చేస్తాము. కరెక్టే మ్యామ్. హౌస్ హోల్డ్కి ఇటే లెర్నింగ్ ఆబ్జెక్టివ్ ఏం రాస్తాం అది అడిగితే. ఇది అసెస్మెంట్లో మనం రాయాలిగా. లెక్చర్ చేసుకున్నప్పుడు ఇప్పుడు నువ్వు లెక్చర్ చేసావు, అసెస్మెంట్ ఏం రాస్తావు అని అన్నట్టు. షోస్ వస్తుందా దానికి? నోట్స్ హవ్వు కానీ నోట్స్ అనేది షోస్ హౌ. ఇదైతే నోసే కదా డిస్క్రైబ్ అయితే ఫస్ట్. ఇది నోస్ అవ్వా, షోస్ అవ్వ కదా. వాళ్ళని చేయమంటారు లేదా? వద్దు, డెమాన్స్ట్రేషనే పెడతాం. వాళ్ళు ఇచ్చారు కదా మనకి. ఇది ఏం చెప్పారు ఆవిడ? హౌస్ హోల్డ్ సర్వే. టీచింగ్ లెర్నింగ్ మెథడ్లో హౌస్ హోల్డ్ సర్వే ఉండదు, మనకు వర్డ్ ఉంటుంది స్పెసిఫిక్గా. కమ్యూనిటీ అయిపోయింది కదా. అసెస్మెంట్ ఉంటాయి కదా, అందులో అసెస్మెంట్ అనే వర్డ్ ఉందా?
Two more minutes. అయిపోయినాయా ఫస్ట్ గ్రూప్? థ్యాంక్స్. లాస్ట్లో ఒక కీ చెప్తా మీకు, అంత కన్ఫ్యూజింగ్ ఉంది కదా, అంత కీ చెప్తా మీకు తర్వాత. ఓ 2 రాసుకోండి, ఎందుకండి ఎక్కువ చాలు. నన్ను మాస్టరైజ్ చేద్దాం అనుకుంటున్నారు ఏంటి? Ready? Okay, you're all ready? I'll call one group. They are going to write on the board. I'll ask other groups to tell what are the means not the deficiencies, how can they can improve the objectives and teaching learning methods. డెమాన్స్ట్రేషన్ పెట్టండి కౌన్సిలింగ్లో. ఎప్పుడైనా మనం రోల్ ప్లే కానీ మనం డెమాన్స్ట్రేట్ చేస్తే వాళ్ళ కౌన్సిలింగ్ అర్థం అవుతుంది ఎప్పుడైనా. ఇంటికి వెళ్ళినా అది కూడా డెమాన్స్ట్రేషన్ కిందకే వస్తుంది. ఇంకా సింపుల్గా చెప్తాను. వాట్ ఆర్ ద మెథడ్స్ యూ యూస్ ఫర్ ద టీచింగ్ దెమ్? టీచింగ్ లెర్నింగ్ మెథడ్స్ అంటే వాళ్ళు ఏ మెథడ్స్ యూస్ చేసి వాళ్ళ ఆబ్జెక్టివ్స్ నేర్పించారు. అసెస్మెంట్ వేరే వస్తుంది. ఇప్పుడు మనం ఓన్లీ ఎట్లా టీచ్ చేస్తాం అనేదే. ఓకే, యూ ఆర్ రెడీ? ప్లీజ్ ఫ్రమ్ ద ఫస్ట్ గ్రూప్ the 2 students has to come, the 2 learners, not the student, 2 learners please. One has to write, one will dictate board lo. Group 1, meedi 6 okay, we'll go from back, is that okay? Group 6 and రాయండి అక్కడ ఫస్ట్. మీరు ఇటు వచ్చేసారా? So this is the object, sorry, this is the competency, they are going to write the objective. బాగా చెప్పిన వాళ్ళకి చాక్లెట్, వాళ్ళ బెంచ్ నుంచి వాళ్ళ బెంచ్కి ఇస్తారు. పెద్దదంట, ఓడిపోయిన వాళ్ళు ఇవ్వాలి. ఓడిపోతే మీరు ఇవ్వాలి వాళ్ళకి చాక్లెట్, గెలిస్తే వాళ్ళు మీకు ఇస్తారు. అదే కిట్ క్యాట్ వస్తుంది. ఓకే, the write the objectives first. నువ్వు చదివేసే పాపం తనకు కష్టంగా ఉందేమో. యూ రీడ్ ఇట్ అండ్ అదే హీ విల్ రైట్. ఆర్ యూ ఏబుల్ టు సీ దిస్ వన్, ద కాంపిటెన్సీస్ అండ్ ఆబ్జెక్టివ్స్? ఎవరు వాళ్ళు బిజీగా ఉన్నారు రాసుకోవటంలో? ఓకే, ఏదో వాళ్ళకి ఇచ్చేస్తాను. ఒకళ్ళు ఫస్ట్ అది చదవండి, ఆబ్జెక్టివ్స్ చదవండి. ఏం కాదు, చదివే ఏం కాదు. ఇది గ్రూప్ 1 అని చెప్పండి. గ్రూప్ 6 కాంపిటెన్సీ.
So we are from group 6. Our question is describe and demonstrate the correct method of performing a nutritional assessment of the individuals families and community by using the appropriate method. So we have made our learning objectives. So our first learning objective is describe nutritional requirements according to the age specific group, and we have selected lecture as our teaching learning method for that. And for the second learning objective is demonstration of nutritional status of the individuals in a family, and we choose bedside clinic as the teaching learning method. And finally, after all these 2 points, we have to counsel the family regarding our first 2 objectives. So we will counsel the family regarding daily nutritional requirements.
Okay. So that is your third one, right?
Yes, ma'am.
1 second. The next group, please pick the first one, the objective and TLM. Is it correct or not? Can you read that, sir? Please. Requirement. Can you read it?
So describe nutritional requirements according to age specific groups.
Is it okay? Or you are going to choose any other thing? Other groups? Are you going to choose any other thing? So the lecture is the fine for you. The nutritional requirement and
according to age specific group.
So what are the nutrients are required for the age? That has to be knowledge. It has to be group. So many people they can choose the lectures. Okay, that you can do. Okay, మన స్టూడెంట్స్ అంత బాగుంటారా సార్? మనం చెప్పిందే చదవరు, వాళ్ళకి ఇంకోటి ఇస్తే అసలు చదవరు. Okay, next one.
So our second objective is
the next group. Who is the third? Who is the third? Please see that one. Is it right or not, or any other better choice you select? Can you read that one?
Second objective is demonstration of nutritional status of the individuals in a family.
So the demonstration of the nutrition status, how they will be doing, sir? Any pediatrics from this group? So how you demonstrate the nutrition status? How they do?
Which? Measurements. So in bedside clinic.
Yeah. So that can be done with the bedside, or it could be demonstration can be done. Do you all agree with that? Anything else?
Patients are not cooperating, sir.
Okay.
50 members are there. I won't cooperate.
So we are doing it in a family, ma'am.
Anything else? Think. If patients are not cooperating, what else?
You just want to see the nutritional status of a family. Adults and children. Not do it, sir.
Anybody guess? Instead of doing a bedside clinic, if patient is not cooperating.
We can take.
Yeah.
You can try on madam can try on you. That's the best one.
Peer group. Peer.
Ourselves can cooperate with each other.
Okay, the third is?
So we describe the nutritional requirements and demonstrate it. So finally we do a counseling to the respective family regarding the nutritional requirements.
Okay. Is this apt? DOPS is apt for this, or any other things you suggest for that? Who is the fourth group? Who is the fourth? Meere fourth, sir. Okay. Third అయిపోయింది. Second? Is it correct or anything you suggest? DOPS or anything? Counseling regarding the requirements.
What domain is
Counsel what domain? Head, knowledge, skill, లేకపోతే effective. Okay. So effective. అది ప్రాక్టికల్ అసెస్మెంట్ డాప్స్ అనేది యూజువల్గా. రోల్ ప్లే చేయొచ్చు కదా, నిన్న చేశారు. ద రోల్ ప్లే కెన్ బి యూజ్ రైట్, ద డెమాన్స్ట్రేషన్. So how many of you use the video clipping in your class for demonstration or anything? So that is very easy and very effective actually. Okay, good. Give a big applause to the group. So the next group, fifth group please. All fifth, okay, fifth. Iddar and 2 members, one will dictate, other one will write. 2 objectives రాయండి చాలా సరిపోతుంది. I'm concising to the 2 objectives. You are happy? I'm also happy. I can finish off. Yeah. First, you write the learning objectives. One more thing I want to emphasize on this. So always look SU. This is 28.9 competency. SU means surgery. That means the which phase also you know. In the third phase you just can't tell the etiology or anything to diagnose or anything. Instead of that you have to investigations and management, you have to go on to the surgery. The phase, when you increase the phase, the objectives should be more precise. In the first and second phase, etiology, definition, describe is fine. Oh. The last group ఒకసారి అది చదవరా ఒక క్వశ్చన్. ఫస్ట్ ఆబ్జెక్టివ్ చదివి ఈజ్ ఇట్ అప్రోప్రియేట్ ఆర్ నాట్? Okay. Are you able to see? So choose one from your group. Please read that question. Objective of that. Is it appropriate or are you suggesting some other thing? Do you have mic in that? Okay, please read loud. Read the question, read the objective of that. Please choose your leader from your group. Yeah. Are you able to see? Are you able to see? Please read that one.
Classify and describe disorders of stomach. TLM lecture or seminar.
Is that okay? Or can you tell me some other TLM methods to improvise this? Classify and describe the disorders of the stomach. Is it appropriate objective for this? What is the main thing they ask? Demonstrate the correct technique of examination. But they should have some knowledge. So the lecturer wants to know, the first they have to understand what are the disorders which can be causing the stomach pain or anything. Then they have to give the demonstration. They want to give some class or classify or describe some disorders. The lecture is fine, or anything else you suggest. Give some innovative methods. నేను అరగంట చెప్తేనే మీరు వినలేరు, గంట 2 గంటలకి వాళ్ళకి వెళ్ళిపోద్ది బ్రెయిన్లో నుంచి. థింక్ ఎనీ అదర్ థింగ్. So some of the students are making charts and they can identify the each epigastrium and all the identify the disorders or the diagnosis they put. So they can easily identify the disorders. Give some nowadays they give the Google forms or something else charts. give the assignment and get them ready, because it is already surgery case. So by the time they come to the 4th year, they know all the things. See, give some pinpoint or brainstorming for them, then you start demonstrating. I think that will be a better. Or you make your innovative ideas, whatever the way. Finally, student ki cheppali, alku ravali. The two, bedside clinic kaakunda inkem add cheyochu, examination part, demonstrate the steps, videos, very good. Simulations can be
demonstration. Mannequins.
Mannequins. So you have to make use of mannequins. Okay, good. Give them a big applause. So the next group. Chocolate. Fourth. చూద్దాం అంతా అయిపోయాక we will select one best group who did well. We'll give the prize for them. Please. అక్కడ బుకే రెడీగా ఉంది, ఆ బుకే ఇచ్చేస్తాం. చాక్లెటే కావాలి. మధ్యలో స్టూడెంట్స్ గోల్ చేస్తే అరవచ్చు లలిత్. అది స్టూడెంట్స్ ఓకే, గోల్ చేస్తే అరవాలి. ఆడ క్వశ్చన్స్ అడగాలి, వాళ్ళు గుర్తుంచుకో. ఏం పర్లేదు, వాళ్ళు స్టూడెంట్స్ ఎప్పుడు నీకు అరవాలి క్లాస్లో. అట్లా మెల్లగుంటే ఎట్లా? ఇంకా రాయలేదు సార్. సో బ్యాడ్ స్టూడెంట్. అరవచ్చు ఏం కాదు, కానీ వాళ్ళు కంట్రోల్ చేయాలి. క్లాస్లో మీ అందరూ అరవకుండానే ఉంటారా? ఎంబీబీఎస్లో అందరు గొడవ చేస్తూ ఉంటారు. ఓకే ఓకే. So what is the phase? SU, surgery unit. What is the competency here? Communicate and counsel the patient and families on the outcome and rehabilitation, demonstrating empathy and care. So main domain here, what is hidden here? What is the domain here? Effective domain. But make sure the knowledge domain always should be there. చాలా బాగా రాశాడు సార్. ఇది మాత్రం ఇది చాలా కష్టం యాక్చువల్గా. మీ దాంట్లో సర్జరీ ఉన్నారు కదా సార్. మీ లీడర్కి బాగా ట్రైనింగ్ ఇచ్చారు. యాక్చువల్లీ టు రైట్ దట్ objective is very difficult. If you know that, everything, our workshop is done, our work is done actually. లలిత్ పాపం ఒకళ్ళు పక్కన నుంచున్నారు, వాళ్ళు చెబుతా ఉంటారు, నువ్వు రాయొచ్చు కదా. నాకన్నా బోర్డు బాగా రాస్తున్నారు. యాక్చువల్గా నాకే రాయటం రాస్తారు బోర్డు మీద. అందరు పీపీటీలు వేస్తారు. మైక్ పని చేయలేదు అనుకో, కరెంట్ పోయింది అనుకో, కరెంట్ పోయింది, పీపీటీ పని చేయట్లేదు, మైక్ పని చేయట్లేదు, ఏం చేయాలి? క్వశ్చన్స్ అడగ మనం చెప్పాలి కదా సార్. ఒక పావు గంట అయ్యా క్వశ్చన్లు అయిపోతాయి సార్, వాళ్ళు మన అడుగుతారు, అప్పుడు ఏం చేయాలి? అంటే మన క్లాసెస్ ఎప్పుడు తీసుకోలేదు కదా. మీ గ్రూప్ నుంచి ఒకళ్ళు, ఇంతవరకు మీ గ్రూప్ అసలు. సెలెక్ట్ యువర్ లీడర్ ఫస్ట్. ఏం పర్లే, ఇంకా 2 గంటలు ఉంది, గ్రూప్లో అందరూ మాట్లాడాలి. అయిపోయిందా? ఒక్కసారి కెన్ యూ ప్లీజ్ గెట్ అప్ వన్ ఫ్రమ్ ద అదర్? ఓకే, కెన్ యూ ఏబుల్ టు సీ దిస్ వన్, ద ఫస్ట్ వన్? You able to see the objective of this? Okay, first read the objective. Describe the outcome of the burns. So they write the tutorial and lecture. Is it okay? Or anything else you want to add for that? Why the tutorial, ma'am is asking? Tutorial is one-to-one interaction, right? The lecture is mass, and they are evaluation of the degree of complication. Is it tutorial is good or lecture is good? Lecture is good. Any other suggestions? Seminar, okay. Anything you want to add, madam? It's fine, I think. Tutorials is like a doubt, and practicals, in case of practicals, you say the even bedside clinic, how to evaluate. If it is more, and always go with the manicure, because sometimes it's very difficult to get the one patient surrounded by 100 members first. Okay, or video clipping. Video clipping can be done, right?
Tutorial is usually for the one-to-one interaction. This type of knowledge we want to give for more students, isn't it? So we have to prepare large group so that we can convey the message to many people.
Then the demonstration of cleaning and dressing of burns. So what they wrote, the demonstration or assisting, okay, bedside or anything, manicure, all this, everything we have to choose among which is the better. At that time sometimes we may think something, if you go to the bed we feel like telling some other thing, or we may convert to some other thing, okay. So the best one you have to choose and pick that. So the third one, the consent and inform the family members how to counsel and all. Always for this, the role play or demonstration is very good actually, because if you see the yesterday scenario, they did the skit and it is very well it is appreciated, right? It will be remembered forever actually for them too. Okay, good. Give them a big applause. I'll ask you a votes, which batch is better afterwards. If you get the 2 votes, they won, they will give the chocolates.
And it is an effective domain, isn't it? Inform and counsel. How demonstration is used there? Role play or video is okay. Demonstration for effective domain is not appropriate, I feel. Demonstration is usually for skill, any performance. This no effective domain or outcome sessions or anything, role plays, videos, this type of things will be better.
Next one. So which group is this? I am so tired, please come fast. ఇలా కట్ షార్ట్ చేద్దాం, 2 ఆబ్జెక్టివ్స్ చాలా అని చెప్పారు. మీరు చెప్పాలి ఇప్పుడు మరి ఆబ్జెక్టివ్స్ మీరు ఫ్రేమ్ చేయాలి, అదే మెయిన్ టాస్క్ ఏంటో. ఇంకో సెక్షన్ ఉంది కదా, ఈ లోపల మీ బ్యాచ్ వాళ్ళు ఇంకొక బ్యాచ్కి ఓటేయండి విచ్ ఇస్ ద బెస్ట్ వన్ అని. ఎవరికి వాళ్ళు ఓటేసుకోకూడదు, పక్కన వాళ్ళకి వేయాలి. నో ఫ్రాడ్ ఇన్ బిట్వీన్. అవి అడుగుతారు మాకు ఓటేయండి, సెండ్ SMS. Okay. ఇంకా లాస్ట్ అంతేనా, ఇంకొక వన్. మాకు తెలియదు ఓట్లు ఎవరు వస్తే అక్కడ వాళ్ళే విన్. ఓకే, సో కెన్ సమ్మన్ టెల్ దిస్. ఇంకెవరు మిగిలిపోయారు, ఏ గ్రూప్ వాళ్ళు మిగిలిపోయారు? మళ్ళీ ఫస్ట్ వద్దాం ఇటు నుంచి. మీ గ్రూప్ వాళ్ళు ప్లీజ్, మీ గ్రూప్ వాళ్ళకి ఎక్కువ ఛాన్స్ వస్తుంది. ఆబ్జెక్టివ్స్. ఓకే, కెన్ యూ సీ ద ఆబ్జెక్టివ్స్? కెన్ యూ టెల్? Actually TLM is good, little bit modification is required for the objectives to make it clear. Before you used to say causes of HF, just to make it always to describe or demonstrate like that words or enlist. So enlist, can you, someone can modify the objective, the first one, little bit modification. Enumerate or enlist, right? Enumerate means you have to elaborate instead of enlist. If it is pathogenesis,
describe
pathogenesis what?
Describe etiopathogenesis.
Okay, like that we have to little modify. Always you should start with a good verb. That is the main concept of this. And with a verb. Okay. So then the TLM is apt for that. That is only the lecture way we can going to teach. And the management of HF. Even though we have to modify that, even the management also we have to describe the management or
demonstrate.
Okay. So in the management there are many steps are there. The objectives should be very clear so that we can ask the. Okay. So anything, the management, bedside clinics, they told they choose the bedside clinic to write. Instead of that, the management always maybe the demonstration document or simulation or video demonstration, they can choose, they are choosing that. Maybe any other method you can suggest for the management. Okay. Ma'am, mic తీసుకోండి వినపట్ల.
Not only documentation, you will tell something, no? See, you have to follow all this to prevent further complications. You will, those things you will tell, no? That falls in affective domain. So all the three domains will be covered here, isn't it? While discharging, we will not write our drugs and send them off. We will tell them, this is the diet you have to follow. You will tell, no? No, that is what I told. Okay? That comes under affective domain. Health awareness, like sensitization, that you can write there.
This is the last one, is also a document. Actually, the making sense, if you take the case sheets and all to show them the nice case sheets, next time they will write nicely. Nowadays it's very important for the legal issues also. Okay. So applause to the group, please. So how many groups left? Still one? Two? Oh, two naya. Okay, we'll make it fast. Wait. Who is this, the second group? అక్కడి నుంచి ఆబ్జెక్టివ్స్ చదివేసేసాయి. ఐఎమ్ గివింగ్ యూ ఫ్రీడమ్. మైక్ కావాలి. You should be loud. Okay, what is your first objective?
What are the infectious diseases?
రావట్లేదు అనుకుంటా.
What are the infectious diseases?
Okay. Choose the interpret the result of the laboratory test result used in the diagnosis of infectious diseases. Okay. First, what you want to know? Okay. We can enlist the features of the infectious diseases, right? It could be bacteria or whatever. So, what is the clinical features? Then,
how to
interpret the test result to pertaining to that infectious disease to diagnosis. For the first objectives, what you will choose? Always the first basic knowledge always is a lecture, or if you can say the small groups, maybe so many bacteria and virus, you can say the small group sections. You can small group discussions you can make. Okay, and the test interpretations, discussion. Otherwise, you can cue some of the case scenarios and you can ask them to solve. Is that good? I think they can remember better. Maybe any other of your choice. Always I am telling you, this is your choice, your class. Make innovative. That's it. How you make it? It's your choice. Okay? There is no hard and fast rule that this is correct. Okay? నేనే చెప్పేసాను. మార్క్స్ నాకే ఇవ్వాలి. ఇంకొక గ్రూప్ ఉంది మేడం. ఆ గ్రూప్ది అయిపోయింది మేడం. అయిపోయిందండి మేడం, ఇప్పుడే అయిపోయింది. నెక్స్ట్ గ్రూప్ మైక్. ఓకే. ద ఫస్ట్ ఆబ్జెక్టివ్ ఏంటి? మొత్తం కాంపిటెన్సీలా చెప్తున్నా. ఫస్ట్ ఆబ్జెక్టివ్ ఏంటి? డిఫైన్ నార్మల్ బ్లడ్ ప్రెషర్ అని చెప్పచ్చా? ఫస్ట్ నార్మల్ తెలియాలిగా. నార్మల్ వాళ్ళు అబ్నార్మల్ కూడా చెప్పొచ్చు మేడం. ఎవరు నార్మల్గా రాస్తున్నారు ఈ రోజులో? బీపీ స్టేజ్, బేస్ లైన్, బేస్. ఓకే. ఓకే. Okay, the first objective, how you are going to achieve, by which method you are going to teach? Lecture. Okay. Next. So what is the next objective? Can be in various postures you can take, sitting, standing, and the right side. Okay. Doing the demonstration. So the demonstration means on which you are going to demonstrate. Is it manicure or practically other person or other student? How you are going to demonstrate that one? Manicure. Is it maybe the next student is there? 250 members are there. Can you choose other student? Physiology, what they do? Right? We can use the other person as a demonstrator, right? Okay, next one. This is also can be bedside or simulation or document. Okay, anybody wants to add anything?
Why you want to define blood pressure? You want to lecture for defining blood pressure? And please read the competency. This competency is more of psychomotor skill they are asking. You can just at the bedside only you can discuss what actually is the normal blood pressure. Now what are the other methods of discussion? For that I don't think you require a lecture. So don't think that everything first part, knowledge part we need to go for lecture. This is main of psychomotor skill. So at the bedside or normally one person if you are free you can just discuss what is the blood pressure, how do you measure the blood pressure, what are the different methods of blood pressure. So you can feel everything but a spot. Because skill is more important. Record. So that is skill.
So with students we are going to take the physiology, right? This competency belongs to the physiology. So more of it is a practical case actually. In practicals you are going to demonstrate these competencies. DOIL you can do it.
All things you can no need lecture, there only you can discuss. For that no need to don't think that all knowledge components require lecture or something. I just want to discuss on that. They have given like that in our volume also. One competency only for DOIP session, one competency only for lecture.
Actually the university made us make us for easy for us actually. If you go volume 1 and volume 2, volume 1 or volume 2 lectures, I mean NNC guidelines, this one, they have given competencies and objectives. For the objectives, what is the TLM methods and assessment. Everything they have given in the book. It's easy for us. This workshop is mainly meant for to understand the book. That's all. They're making a little useful so that everyone can apply this one. At least they can read the book and understand what it is going on. Okay? Okay, thank you. And tell me which group has scored amongst. So let me say the first group first group first group okay, మీరు ఒక గ్రూప్ ని మార్క్ ఇవ్వండి. మీ గ్రూప్ కాకుండా ఒక గ్రూప్ కోటేయండి బాగా చెప్పిన వాళ్ళు. టెల్ టు ద గ్రూప్ అమ్మ, ఒక పేరు చెప్పలేరు వెళ్ళలేదు అయితే ఆబ్జెక్టివ్స్. వాళ్ళు చెప్పాలి. ఏ గ్రూపు? 4ఆ? మీ సార్ ఉన్నారా దానిలో ఏమన్నా? ఒక్కటే చూజ్ చేయండి. 4ఆ? వాళ్ళ ఓకే. మీరు ఇక్కడే 2 ఓట్లు వచ్చేసేసినాయి. మీరు అసలు మరీ యునానిమస్ సార్, నేను ఒప్పుకోని ఇది అసలు. మీరు కూడా 4ఏనా? అయితే వీళ్ళ దగ్గర మంచి చాక్లెట్ ఉంది సార్, నేనే మీకు గిఫ్ట్గా ఇస్తున్నా. పెద్దదా? పోలా ఇవ్వండి, అందరూ షేర్ చేసుకుంటారు. చూడండి పోలా ఇస్తున్నాను సార్, సో దట్ అందరికి ఈక్వల్ డిస్ట్రిబ్యూషన్ సార్. గివ్ దెమ్ ఎ బిగ్ అప్లాస్ సార్. Yeah, one. Okay, we are going for the next section. You need some break? Okay. నేనే అదే అనుభవం సార్, నేను కూడా. నాకు కంటిన్యూషన్ మంచినీళ్ళు అవుతారని, నాకు మంచినీళ్ళు అవుతుంది. We'll start with the next. Okay, I'll give you a small task. Take one paper. ఒక రఫ్ పేపర్ తీసుకోండి, ఒక పెన్ను తీసుకోండి. కాదు అందరు సార్. ఒక గ్రూప్ చేద్దాం, చచ్చిపోతాను 2 గంటే. ఓకే, యూ రెడీ? ఓకే, టాస్క్ జాగ్రత్తగా వినండి. కళ్ళు మూసుకోవాలి, 2 సర్కిల్స్ గీయాలి, 2 సర్కిల్స్కి ఒక యారో గీయండి. కళ్ళు మూసుకొని, కళ్ళు తెరవద్దు, కనెక్ట్ చేస్తే ఒక యారో ఎట్లయినా వేసుకోండి. నాకు 2 సర్కిల్ కనెక్ట్ కావాలి. కళ్ళు మూసుకొని, కళ్ళు మూసుకోండి సార్. టాస్క్ మూసుకోండి సార్, ఇంకా అవ్వలేదు సార్ టాస్క్, ఇంకా కంటిన్యూషన్ ఉంది. కళ్ళు మూసుకోండి, అసలు తూచి. ఓకే, అనవసరంగా చెప్పాను, కళ్ళు మూసుకోమన్నాక చెప్పాల్సింది టాస్క్. అయ్యో, కళ్ళు మూసుకొని ట్రై చేయండి సార్, బాగుంటుంది. ఒకసారి కళ్ళు మూసుకొని ట్రై చేయండి, ఎంత యాక్యురేట్గా ఉందో ట్రై చేయండి సార్. బ్రెయిన్ ఓకే. యా, ఎవరి కాళ్ళు చూసుకోండి. పర్ఫెక్టా? అందరు పర్ఫెక్టే సార్. ఓకే, ఒక యారో ఒక దానికి వెళ్తుంది, ఒక లైన్ యారోకి వెళ్తుంది. సో దిస్ ఈజ్ కాల్డ్ అలైన్మెంట్. సో వాట్ వీఆర్ అలైనింగ్ ద ఫస్ట్ సర్కిల్ అండ్ ద నెక్స్ట్ సర్కిల్. కెన్ యూ గెస్? ఇప్పటిదాకా నిజంగా మన ఆబ్జెక్టివ్స్ ఏంటి? ఫస్ట్ 1 అసెస్మెంట్ ప్లానింగ్ చేస్తున్నాం. ఆ ఫస్ట్ సర్కిల్ ఏంటి, నెక్స్ట్ సర్కిల్ ఏంటి, ఇప్పుడు ఆ యారో ఏంటి? సో నా టాపిక్ ఫస్ట్ ఏంటిది? అసెస్మెంట్. ఓకే, అది ఒక సర్కిల్. సో ద ఫస్ట్ సర్కిల్ ఏంటి? మధ్యలోది ప్లానింగ్, ఒక యారో మధ్యలో 10 సెంటీమీటర్స్ ఉంది కదా. ఆ ఫస్ట్ ఏమంటాయి, వాటిని ఏమంటారు? ఇప్పుడు దాకా చేశారు కదా మీరు. సో యువర్ ఆబ్జెక్టివ్స్ అండ్ యువర్ అసెస్మెంట్ ప్లానింగ్. ఎప్పుడైనా అసెస్మెంట్ చేయాలనుకుంటే ప్లానింగ్, యూ నీడ్ అన్ ఆబ్జెక్టివ్. ఈ మధ్యలో గ్యాప్ ఏదో ఉందిగా, అదేంటో చూద్దాం. సో దట్ యు ఫినిష్ యువర్ టాస్క్. యు ఆర్ వెరీ నైస్. 2 సర్కిల్స్ వేసారు, చక్కగా యారోస్ వేసారు, అయిపోయింది. సో దిస్ ఈజ్ యువర్ అసెస్మెంట్ అండ్ దీస్ ఆర్ యువర్ ఆబ్జెక్టివ్స్. వెన్ యూ ఫిల్ దిస్ వన్, objectives align with assignment, your curriculum alignment is fulfilled actually. With the use of something else, I will tell you what it is. Okay, can you tell some of the assignments we use to knows how and shows how and does? The Miller pyramids. When you want to test knows, what are the tests you conduct?
Name them. What are the methods?
MCQs. Good. Anything else? Essays. ఓకే, ఇంకా వైవా. గుడ్. బుక్ చూడట్లేదు కదా. ఓకే, ఐ థింక్ యూ కంప్లీటెడ్ దట్ టాస్క్. యూ మేడ్ మీ ఈజీ. సారీ నేను చెప్పేసా. నోస్ హౌ. దీనికి మరి దానికి తేడా ఏంటి? నోస్ హౌకి రెండే ఒకటే టైప్ ఆఫ్ ఆన్సర్స్ ఇస్తున్నారు. సో డిఫరెన్స్ కేస్ సినారియో. ఓకే, క్వశ్చన్, స్ట్రక్చర్డ్ క్వశ్చన్. ఓకే, వైవా. ఓకే, వైవా ఇట్ కుడ్ బి ఫ్యాక్చువల్ రీకాల్ అవ్వచ్చు కదా, జస్ట్ వైవా 1 ఆన్సర్ కదా. ఇంకా బెటర్ నో హౌస్ అంటే వీఆర్ గోయింగ్ టు హయ్యర్ ఆర్డర్ ఆఫ్ బ్లూమ్స్ టాక్సానమీ. వీఆర్ థింకింగ్ లైక్ అనాలిసిస్ అండ్ క్రియేటివిటీ ఆర్ గోయింగ్ టు గెట్ ఫ్రమ్ దెమ్. సో ద క్వశ్చన్స్ షుడ్ బి ఎక్స్టెండెడ్ క్వశ్చన్స్ ఆర్ ప్రాబ్లమ్ సాల్వింగ్ క్వశ్చన్స్ లైక్ దట్. ఓకే, నెక్స్ట్ shows how.
ASCII.
Can you abbreviate what is ASCII and what is ASCII? We are very good students. Actually, sometimes what I'll think. Okay, we'll forget by using the short forms. We'll forget the extended forms. ASCII, DOPS. What is the final thing? Highest pyramid performance. So that which kind of assessment it is? Role plays, demonstrations, ఇంకా do simulation methods. videos, SPs, all this will come under does. So if we attain that level, our competency is fulfilled. Anytime the competent means you have to be higher level of your Miller's pyramid. Okay?
So what is ASCII actually what we are doing in our clinical scenario? So because now as a clinicians, as a professors, we are, or assistant professors, we have to conduct OSCEs. So how you will conduct an OSCE? It depends on what factors. What factors? Knows how means what factors, how to conduct, because we are day to day we have to conduct OSCEs, and even in assessment of final year students also we need to conduct OSCEs. Postgraduates we conduct OSCEs. So what is the basis of it? How we conduct? Sorry? Okay. So how can you assess? There are so many students, some 10 students will be there. How to assess? Because we have to be uniform. Uniformity also should be there. So how to?
Checklist.
Yeah, one is we should have a series of some OSCE stations, and we need some questionnaire, and they are fixed, they are structured questions on some maybe a case scenario or an whatever instruments. Sometimes for gynec speculum is kept, and what are the uses, some 2 uses like that, 4 uses like that. So they are structured so that the uniformity will be maintained as far as the OSCE is concerned. Because manaki endukante OSCE anedi manu conduct cheyali. So we in our department we have a set of questions, a set of these things. So is oka 50 or 60 తయారు చేసి పెట్టుకుంటాం. అవన్నీ వాళ్ళు స్టూడెంట్స్కి ఎక్స్పోజ్ చేస్తూ ఉంటాం. సో questions may change, 1 or 2 it may change, but the students should be trained in OSCE also, how it will be conducted. So our set of questions lo they will be, maybe they will be kept in the examinations. మళ్ళీ ఎక్స్టర్నల్ వచ్చి మళ్ళీ ఆ క్వశ్చన్స్ చేంజ్ చేయొచ్చు, we can't say, but that uniformity will be maintained within those students. ఆ స్టూడెంట్స్కి ఆ యూనిఫార్మిటీ అని ఉంటుంది. సో స్టేషన్స్ ఉంటాయి, ఫిక్స్డ్ టైమింగ్ ఉంటుంది, and then they have to answer, or sometimes a case scenario ఇచ్చేయచ్చు. And then what are these SPs, masked SPs? What do you mean by masked SPs? Simulated patients. So when you, in foreign countries, that is MRCOG, FRCOG akkada, and ikkada kuda chestunaru gaani patient undaru, one of the person will be trained like a patient. So alagada kuchani untaru, you have to go, and then the doctor has to talk, to take the history. So what they'll be given a scenario, how do you take a history, or how do you counsel regarding this, and istar. So the student will go and talk with that patient, and the examiner will be observing for maybe 5 minutes or like that, and he will put the marks according to that. So that is does and counseling alani. So sometimes they say that OSCEs lo adi kuda pettachu antaru, case scenarios pettamannaru. Case scenarios, or sometimes ECG pettechu, or CTG, whatever it is, atla petti. So what is the abnormality in this, what is the diagnosis, like that.
డొమైన్స్ ఏదైనా పెట్టచ్చు. ఇప్పుడు మనకున్న 6 rooms గా చేసి ఒక్కొక్క స్టూడెంట్ ఒక్కొక్క రూమ్కి వెళ్తాం. దాంట్లో మేబీ నాలెడ్జ్కి సంబంధించి ఒక స్కిల్ అడగచ్చు, ఇంకో ఇంకా దాంట్లో కౌన్సిలింగ్ ఒకటి. ఆ చెక్ లిస్ట్ అనేది వాళ్ళకే ఉంటుంది. ఒకవేళ పేషెంట్ ఉంటే వీళ్ళు దే హ్యావ్ టు డూ, దే విల్ గివ్ ద మార్క్స్ యాక్షన్. సో ఇట్స్ జస్ట్ లైక్ USMLE.
మీకు OSCEలో ఏమైనా డౌట్స్ ఏమైనా ఉన్నాయా? బికాస్ ఎవ్రీ టైమ్ వీ నీడ్ టు కండక్ట్ OSCEs అట్లా ఉంటాయి. సో ఐ థింక్ మేము అలా చేస్తున్నాం, పుట్టింగ్ ఏ గ్రూప్ కొన్ని తయారు చేసుకొని పెట్టుకొని సెట్ ఆఫ్ క్వశ్చన్స్ చేసుకొని వాళ్ళకి ట్రైనింగ్. బట్ దే ఎక్స్టర్నల్ మే కమ్ అండ్ చేంజ్ ద క్వశ్చన్స్. మనం ఎక్స్టర్నల్ చూపిస్తాం ఇవి పెడతామనేది, దే మే చేంజ్ ద క్వశ్చన్స్. ఈ 4 కాదు, ఈ 4 సెట్ కాదు అనేది మార్చచ్చు. బట్ ఆ స్టూడెంట్స్కి అక్కడ మాత్రం ఆ యూనిఫార్మిటీ అనేది మెయింటైన్ అవుతుంది, వాళ్ళకి సేమ్ క్వశ్చన్స్ ఉంటాయి. థ్యాంక్ యూ.
సో హౌ డు యూ ప్లాన్ అసెస్మెంట్? మీ డిపార్ట్మెంట్లో మీరు ప్లాన్ చేయాలంటే ఒక అసెస్మెంట్ని what are the things you are going to undertake in your brain, means what are the considerations you take. మీకు ఎగ్జామ్ కండక్ట్ చేయమని ఇచ్చారు. సో what all you think first? Topics, okay.
So the first and foremost thing is the student will come. Sir, ekkadi nunchi ekkada varaku sir? ఏ చాప్టర్ నుంచి ఏ చాప్టర్ వరకు సార్ ఎగ్జామ్ ఉంది ఇంటర్నల్ అసెస్మెంట్ అంటే. సో వీ నీడ్ టు టెల్, అదొకటి ఫస్ట్. ఇంకా నెక్స్ట్, ఓకే, వన్ ఈజ్ థియరీ ఎగ్జామ్, మేబీ మల్టిపుల్ చాయిస్ క్వశ్చన్స్ కూడా ఉంటాయి కదా, ఇప్పుడు మారింది కాబట్టి మల్టిపుల్ చాయిస్ క్వశ్చన్స్ కూడా వస్తాయి. ఇంకా నెక్స్ట్ క్లినిక్స్ ఉంటాయి, ఆ క్లినిక్స్ కూడా మనం కండక్ట్ చేస్తాం. సో వీ నీడ్ టు కండక్ట్ సమ్ 3 exams, 3 theory exams and 2 clinical examinations, like that. Whatever మనకి సెట్ ఆఫ్ ఇది యూనివర్సిటీ నుంచి కూడా వస్తుంది కదా, లైక్ దట్. సో హౌ డూ యూ ప్లాన్? సో వన్ ఈస్ whom, what, how much.
Okay, I'm going to write can you fill? So when you're writing the assignment or making an assignment, these are the starting words of the question.
So what she has written is whom, what, which, only which, again which. సో అది కనిపించదు నాకు తెలుసు, వెనక నుంచి మేము ఇందా నుంచి ఉన్నాం కదా, ఏదో రాస్తున్నట్లు ఉంటుంది కానీ ఏం కనిపించదు.
Students, right? The first
who are the students?
Who are the students? Either phase 1, phase 2 or phase 3 or phase 4. And what is, ఇందులో రెండు ఉన్నాయి, what is the objective, first the learning objective, then domains, మీరు నాలెడ్జ్ టెస్ట్ చేస్తున్నారా, స్కిల్, యాటిట్యూడ్, వాట్ యు ఆర్ గోయింగ్ టు టెస్ట్, దెన్ విచ్ లెవెల్, నాలెడ్జ్లో బేసా, హయ్యర్ లెవెల్, స్కిల్ కూడా అంతే, విత్ సూపర్విజనా, వితౌట్ సూపర్విజనా. దెన్ ద లాస్ట్ ఇస్ విచ్ టూల్. నవ్ ఐ ఆమ్ ఆస్కింగ్, ద టూల్ ఈజ్ నథింగ్ బట్ your essay questions or short answers or MCQs will come. So always keep these 4 in your brain, preparing a one document. ఇప్పుడు వచ్చేసింది. సో ఇందాక ఒక మధ్యలో ఒక లైన్ ఉంది కదా, you are drawing 2 circles with the one line. So that is one document. What is that? You are considering these 4 and you are preparing the one question paper, rough question paper like. And the thing, what can you name that document? దాన్ని ఇంకొంచెం మనం ఫైనల్గా వస్తే క్వశ్చన్ పేపర్, అది ఎగ్జామ్ పేపర్. ఆ ముందు బ్లూ ప్రింట్, యా, దట్ ఈస్ అ బ్లూ ప్రింట్. సో ఆ బ్లూ ప్రింట్లో ఇవన్నీ 4 కన్సిడర్ చేస్తాం. దీనికి యాక్చువల్లీ హౌ యూ ఆర్ గోయింగ్ టు మేక్ ఎ బ్లూ ప్రింట్ ఈస్ ద వన్ థింగ్ టాస్క్ హియర్. ఫస్ట్ ఆఫ్ ఆల్, ఇఫ్ యూ డోంట్ మేక్ ఎ బ్లూ ప్రింట్, దీస్ ఆర్ ద ఆన్సర్స్ ఆర్ దీస్ ఆర్ ద రెస్పాన్సెస్ ఫ్రమ్ ద స్టూడెంట్. హౌ మెనీ ఆఫ్ యూ ఫీల్ దిస్ వే when you are doing your finals or any exam? I think all of us, we think the question is vague, this is not important chapter, what they ask this, what they want to ask us to write this, right? I think we all face this. So examiner thinks I am the best one to set, he wants this one, but the student thinks this is a tape, they want the year, but students' mind, they think it is a leg. So who is right, who is wrong? The examiner, again the correction, whoever correcting the paper, they think different, right? So to avoid this, we need blueprint.
సో మనం బ్లూ ప్రింట్స్ అని ఎక్కడెక్కడ వింటాం అసలు మన డే టు డే లైఫ్లో? బిల్డింగ్ అప్పుడు, ఇల్లు కట్టుకోవాలన్నా, క్లినిక్ కట్టుకోవాలన్నా బ్లూ ప్రింట్. వాట్ యు మీన్ బై బ్లూ ప్రింట్ దేర్? ప్లానింగ్, అండ్ దెన్ ఎంత కట్టాలి, ఎక్కడి నుంచి ఎక్కడ కట్టాలి అన్నీ పక్కాగా ఉంటుంది. సో దెర్ ఈజ్ నో డీవియేషన్. మళ్ళీ రిజిస్టర్ చేయించుకోవాలి, రిజిస్టర్ చేసుకొని అదే కట్టుకోవాలి, అట్లానే కట్టుకోవాలి. ఇంకెక్కడెక్కడ ఉన్నాయి బ్లూ ప్రింట్స్? ఏమండి? ఓకే, దట్స్ ఆల్. వాట్ ఎవర్ ఇట్ ఈస్ క్లినిక్. ఇంకా వేరే ఎక్కడెక్కడ విన్నాము? ఒకటి హౌస్ కన్స్ట్రక్షన్స్ అప్పుడు, ఇంకెక్కడ వింటాం బ్లూ ప్రింట్స్?
First time I heard my blueprint in blood bank inspection. Well, first రాగానే అడిగే question blueprint. The area. For them, the construction purpose, they need the specific area. The same dimensions. Here what we consider is the weightage. weightage of the marks and topics what you are going to take, and all it will come into your matter. Right?
It is not only in the building but also in the business also. Blueprint laga తీసుకుంటారు అంటే ఎంత ఎంత ఉంటుంది, ఎంత వరకు ఖర్చు పెట్టాలి ఏంటి అనేది కూడా ఉంటుంది. అండ్ ఈవెన్ ఇన్ అవర్ హోమ్ ఆల్సో సమ్ టైమ్ ద మదర్ విల్ హ్యావ్ ఎ బ్లూ ప్రింట్ ఇన్ హర్ వాళ్ళ సన్కి ఏం టీచ్ చేయాలి, ఎక్కడి నుంచి ఎక్కడి వరకు టీచ్ చేయాలి. సో షీ విల్ కీప్ వన్ ఒక ప్లాన్ చేసుకొని ఉంటుంది. సో ఫ్రమ్ ది బిగినింగ్ స్మాల్ మన హోమ్ దగ్గర నుంచి పెద్ద బిజినెస్ వరకు వీ షుడ్ హ్యావ్ ఎ బ్లూ ప్రింట్, ఎ డాక్యుమెంట్ ఆర్ ఎ ఫిక్స్డ్ థింగ్. ఈ మనం ఎంత ఒక్కొక్కరికి ఇట్లా చేస్తున్నాం, మరి స్టూడెంట్స్ మొత్తానికి చేయాలంటే వీ నీడ్ ఎ వెరీ ప్లాన్డ్ బ్లూ ప్రింట్. సో ఇట్ షుడ్ నాట్ బి, దెర్ షుడ్ నాట్ బి ఎనీ కన్ఫ్యూజన్.
Okay. So when you see here, they have divided the topics, and finally they come to the 100 marks percentage, and they put the knowledge base according to the level of knowledge. From the topic A how much, topic 2 how much, topic 3. Ultimately the how much percentage of the knowledge, like that the comprehension, application and synthesis. Finally you have to get from the topic so much percentage and so much from percentage from the each chapter you have to divide. Okay, so like this they have to put the blueprint. I am going to show you some examples which I made from my lesson topic. In clinical examinations, the competencies they divide according to the systems, the history and the physical examination, management, lab test, everything they divide, and they keep how many marks and everything. They have to go and prepare the blueprint. So for this, making them easy, I am going to see the university pattern of exam. First you have to know how many marks they are going to conduct. When you see the practical written theory for the clinical, it is 200. This 101 paper, 101 paper, and the practical is 100 marks. Now in these 200, the first paper you have to divide. So one of the example they have given here. When you see this paper 1 and paper 2, this is the pharmacology. The university made, they calculate the weightage of the each section. These are the systems they are going to conduct exam in paper A, and these are the weightages for the each sections and the competencies or objectives. They kept the marks here. So ultimately the 100 marks according to the weightage they have to give. And the same thing with the paper B also. Even AdCom they have to include 5 marks in that. Okay. So the simple thing here, one more thing, they have made our work very simple. How they calculate this weight, the university people. Anybody knows? Weightage, how they calculate. Simply we know this general pharmacology is a 25% weightage, right? Because the university has given the 25%, we are using that. ఒకదానికి 10 ఉండొచ్చు, కానీ అన్ని ఇంపార్టెంట్ కావక్కర్లేదుగా, మనం ఇంపార్టెంట్ టెస్ట్ చేయాలి కదా. So the two things they consider, that is one is a clinical impact and the frequency. They put the grade for the each question or each competency. They will calculate the number of competencies. According to that they put the weightage for each section or each topic of that. Actually they made a simple, actually that is a big task actually. Okay, so they given the weightage, each chapter or each competency, the weightage now you know. So now we are preparing the theory paper, the first paper we know the weightage 100 marks. Like that even practicals they have divided in the practicals. Like pharmacology they divide the 10 marks for the clinical pharmacologies, like the writing the prescriptions and the communications and experimental and practice record maintenance. So they divided all the things and they put for the 100 marks. So to make that easy and simple, I took pathology as an example of blueprint of mine. I'll show you one example. This is the first paper we conducted for pathology, and first we write the content, the topics, all the topics first. Then, so we divided how many essay questions, means modified essay questions, short answers and MCQs. Then it should be considered from the must know or desirable to know. From there how much you have to take and how many marks, the weightage of the marks. The final it has to come to 100. When you see the pathology question paper 100 marks, we have 2 essay questions and the 10 short answers and 20 MCQs. So these things you have to follow, and according to that you have to distribute. Okay? I think the same thing you can do for the blueprint for your exam also. Think how many questions for you and weightage of the marks and distribute according to that weightage. Okay? Like that we have to make the blueprint. This is for the second paper, I made it like this.
This is for pathology. We are not yet started. The clinical people, we are not yet so in detail. We are not started. That's why already she had an example. That's why madam has told.
Okay. So this is the one example of the blueprint. So coming to this is the one of the example for blueprint. Okay. So essay question which okay. So we are going with essay and MCQs now. How to improve our essay questions? How to improve our MCQs?
Yeah, you are all clinicians and you are all professors, assistant professors. So you need to set up a paper. So now the theoretical part has come. So what are all the what is to be assessed in the essay question? Essay questions in Adigamu. So I think we will go for with an example. I think we will finish it up. No need of that is better, no? Otherwise we will lot of time waste. So we will go with one example. Which we will select. So one thing is, this is which group? You see this group and find out the mistakes. Meeru chudandi. Andulo chusi mistakes cheppali. What are all the things? How it can be modified? Please, one of you. మీరు అక్కడికి వెళ్ళాలి, మీరు లెగ్స్ వెళ్ళాలి. మీ ఇద్దరు ఎక్స్చేంజ్ హౌ టు ఇంప్రూవ్. మీరు ఇటు రండి. కదిలితే you can write down 1 or 2 points there. You can write down 1 or 2 points. The opposite group has to come. మీరేనా కరెక్ట్ చేసేస్తున్నారు ఇప్పుడే? రాయలేదా? ఓకే. How it can be improved or how it can be given. Good. అక్కడ కింద రాయండి, 2 పాయింట్స్ రాయండి. అయిపోయింది. వీళ్ళిద్దరు చేంజ్ అయ్యారు, వీళ్ళిద్దరు చేంజ్ అంతే. 6 కదా, సరిపోయింది. So 5 minutes and after that you have to present. So what are the things which can be modified? If it is good, you can say yes, it is a good. వాళ్ళు రాసింది చెడబాకండి, మీరు వేరుగా రాయండి కింద ఏదైనా.
టోటల్ మార్క్స్ కూడా చూసుకోండి కరెక్ట్గా వచ్చిందండి చాలా వాళ్ళే చెప్పారు So, okay, you can stay in your opposite group only because you have to tell opposite group. You have to tell what are all the modifications which can be done. Yes. Cheppandi sir. ఇంకేమైనా ఇంప్రూవ్మెంట్ మైక్ తీసుకోండి
Enumerate cyanotic heart diseases, pathogenesis and management of cyanotic spells, component and management of tetralogy of Fallot, add a note on surgeries for TOF.
Everything is good for 2 marks for how what and 5 marks for what, 2 marks for what?
Enumerating the cyanotic heart diseases, it is for 2 marks, ma'am. Pathogenesis and management of cyanotic spells, 5 marks. 5 marks and 2 marks. I think it's for the components of tetralogy of Fallot, it is 2. For management of tetralogy of Fallot, it is 3. Add a note on surgeries for TOF, it is again 3. Doesn't the management cover the surgeries, ma'am? Medical management. Okay.
Final year.
I request all other group members to come here and listen to the first group.
అందరూ వచ్చేయండి ఇక్కడ
ఏంటో చీల్చి చెడ్డాడుతున్నట్టున్నారా
2, 5, 10, 15 marks. 2, 4, 5, 6, 7, 8, 12.
But you have to make a note on one question, how many?
How much time?
But we are giving only one question now here, not the entire paper, right?
Okay. But
20 minutes. Any time is okay, right? So pays, which student? Okay. Anybody? Okay. Okay. Anybody? Other?
So because finally student cannot tell of surgeries of TOF, maybe it's difficult for him. Kada?
They can name, sir.
Name. Add a note.
Can
Add a
we
note
revise
and
this?
what does it mean? Note and ఏంటి? అవును. Name the surgeries for TOF. Add a note అనే దానికంటే.
Okay.
Name this.
Any
Okay, like that.
Any more? Any more?
అలా ఒకటి చెప్పాలి సార్ ఏదో ఒకటి తప్పు అందులో అందులో పట్టాలి అంత బాగుందంటే ఎట్లాగా అది
Can we, are we doing the same thing or nowadays we look into the paper, any change in the questions? Some people are doing like this, but can you modify essay question in different way?
Madam,
Any suggestions?
in orthopedics, postgraduate exam paper, they will give just one name, Colles fracture, just only Colles fracture. That's all.
Okay.
There is no description of the question or anything, just a name.
That's why CBME
That
has
is-
come, sir.
Actually, while asking essay questions, they are describing it like this, ma'am.
Okay.
But for asking short questions, they are just mentioning a name. For example,
Okay, this is the main question. Can it be, this essay, can it be modified a way of essay question? How it can be given?
Like a case scenario we can give, sir. Like a case scenario we can give.
Yeah, you can give a case scenario and then write there some questions, 1, 2, 3 like that. That also you can give.
15 marks question, one should be case scenario, one should be structured question.
Okay, this is good, but the other methods are, one is case scenario and then any other method?
Anything else?
Anything else?
Problem based. Anybody wants to add something there? The framing of the question, anything else you want to add there?
you can add describe pathogenesis and management of cyanosis.
Just pathogenesis and management. What do you want to do with the pathogenesis?
Describe the pathogenesis.
Actually, we are facing a lot with the question papers. The last time pathology is also like that one paper. It's just like we don't know what they were expecting. If you write something just vaguely like a Colles fracture, what to write? You want to write what is the management or what? Because worst paper. Yeah, that day we have a great discussion on the APA, medical education.
Pathology paper was bad. Second time also pathology paper was bad. Even experts can't write.
Ma'am, we have to make some things, whoever has to train, whoever undergone training, they have to give the paper, ma'am. Otherwise the papers can't be improved. Otherwise this workshop is no use. Okay. దీన్ని modify చేయగలరా?
First question.
Can you modify now? Okay.
Anybody saw the last year's pharmacology paper this year in area? Structured case scenario based question.
కాదు, let them try.
Answer was given there. And the question was what is diagnosis? So that kind of mistakes you can avoid.
A 6-month-old child came with brought to the ER with complaints of bluish discoloration of hands and feet. On further examination, the child was diagnosed with congenital heart disease at birth. So, from then you can ask what is the expected diagnosis.
Very good. That's what we want actually.
And your case-based questions when you're putting, there will be certain keywords. Make sure those keywords are there in the question.
That are you direct?
Standard keywords which are asked universally. Those keywords
జస్ట్ కన్వెనల్ హార్ట్ డిసీజ్ అని మనం చెప్పాలి, యూజీకి అలాగే అడగమంటారు సార్. ఆ కన్వెనల్ హార్ట్ డిసీజ్ చెప్పేసి అప్పుడు మనం సైనోటిక్ అనేది
ఓకే. అందరినీ కూర్చోమన్నావా లేకపోతే ఈచ్ దానికి వెళ్దామా? నాకు తెలిసి We'll go for one more board.
Here, please.
కేసు ఎవరు రాయలేదు అనుకుంటున్నాడు. ఎవరన్నా కేసు రాశారా?
The causes, right and now.
What about the clinical features, list the causes, details. సార్ కేసు ఎవరన్నా రాశారా? కేసు ఇక్కడ రాశారు. ఇలా కనపడలేదు.
Yeah, here we'll go to this board. Whose board is this one? Your board. And who is the other? Observers evaru? Please come over here.
మీరు చెప్పొద్దు, ఎందుకు చెప్పేస్తున్నారు?
Observers, please comment on this.
Primary with 32 weeks gestation came with complaints of abdominal pain.
అక్కడ వాళ్ళు రండి, అక్కడ వాళ్ళు ఇటు రండి, ఇక్కడ రండి, ఇక్కడ చెప్పండి, ఇక్కడ మీరు రండి, ప్లీజ్ కమ్.
సో మీదే సార్ గైనిక్ చెప్పండి.
అదే అందుకు వీళ్ళు చెప్పాలి, మైక్ తీసుకోండి, మైక్ ఉంది కదా అక్కడ ఉంది, చదవండి.
Primary with 32 weeks gestation came with complaints of abdominal pain and bleeding pervading.
ఎట్లా ఉంది? Is it okay or anything? How
So there is already an answer in it, sir. Define APH means the question. itself there is an answer in it. I think enumerate the causes of bleeding per PV or pain in abdomen.
Okay. Right, okay, please tell, complete.
దీన్ని ఇంకొంచెం ఇంప్రూవైజ్ చేయొచ్చా? క్వశ్చన్ ని కూడా ఇంకొంచెం ఇంప్రూవైజ్ చేయొచ్చా?
ఏదో ఒకటి అంటే ఇట్లా కాకుండా ఇలా ఉంటే బాగుంటుంది.
కాజెస్ ఆఫ్
ఎగ్జామినేషన్ పాయింట్
ఇందులో పాజిటివ్ పాయింట్స్ ఏం నచ్చింది చెప్పండి ఫస్ట్. అసలు ఒక కేస్ సినారియో ఇచ్చారు, క్వశ్చన్స్ ఓకే రైట్, అందులో నచ్చింది మీకు. ఇందులో నెగిటివ్ పాయింట్స్ చెప్పండి. ఒకటి మీరు అనేది ఏంటి, డిఫైన్ ఏపీహెచ్ అని నచ్చలా మీకు. సో హౌ ఇట్ కెన్ బి మోడిఫైడ్?
causes of bleeding.
క్వశ్చన్ ఇట్ సెల్ఫ్ కెన్ యూ మోడిఫై? పైన క్వశ్చన్ సినారియోని మోడిఫై చేయొచ్చా? అది ఎక్స్టెండెడ్ క్వశ్చన్, అసలు స్ట్రక్చరే మార్చొచ్చా మనం ఇంకొంచెం బెటర్?
We can add examination part.
Okay.
And we can give investigations also to clue.
So problem solving గా మార్చొచ్చా? A primary of 32 weeks gestation come with complaining of abdominal pain, bleeding per vagina అన్నారు. దీన్ని ఇంకొంచెం 62 years, I mean 24 years female.
Here a primary of 32 weeks అనేది no problem. ఏజ్ అనేది పెద్ద డజన్ క్రైటీరియా ఏం లేదు, అక్కడ వరకు బాగానే ఉంది. అబ్డామినల్ పెయిన్ బ్లీడింగ్ అనేది ఇవ్వాలి అంటే జనరల్గా ఇచ్చారు అక్కడ. అక్కడ నుంచి డిఫరెన్షియల్ డయాగ్నోసిస్, వాట్ ఆర్ ది డిఫరెన్షియల్ డయాగ్నోసిస్ అంటే బాగుంటుంది. పెయిన్ అనేది రాస్తే బాగుంటుంది, అదొకటి. అండ్ దెన్ వాట్ ఆర్ ది ఇన్వెస్టిగేషన్స్ విచ్ కెన్ బి డన్, అలా అంటే స్టూడెంట్కి నెక్స్ట్ అట్లాగా అనమాట. అలాగా చేస్తే కొంచెం బాగుంటుంది. హౌ ఇట్ క్యాన్ బి, హౌ ఇప్పుడు అక్కడ అయిపోయిన తర్వాత ఇన్వెస్టిగేషన్స్ అయిన తర్వాత ఎయిదర్ దే కెన్ గో ఫర్ ఎయిదర్ అబ్రప్షియా ప్లసెంటా ఆర్ ప్లసెంటా ప్రీవియా. సో హౌ విల్ యూ మేనేజ్ దిస్ విత్ అబ్రప్షియా ప్లసెంటా అనేది అట్లా ఇస్తే కొంచెం లిమిట్ అవుతుంది. ఇక్కడ ఏంటంటే జనరల్గా ఇచ్చేసారు అంటే ది ప్యాటర్న్ ఈస్ గుడ్ బట్ డిఫైన్ హౌ విల్ యూ డయాగ్నోస్ ఇట్లా అనేదానికంటే వాట్ ఆర్ ది ఇన్వెస్టిగేషన్స్ విచ్ క్యాన్ బి డన్ అండ్ వాట్ ఆర్ ఆల్ ది హౌ డూ యూ మేనేజ్ 32 weeks విత్ ఇన్ అబ్రప్షియా ప్లసెంటా ఆర్ ప్లసెంటా ప్రీవియా అనేది ఇస్తే కొంచెం అక్కడ రిస్ట్రిక్ట్ అవుతుంది. ఇక్కడ కొంచెం జనరల్గా ఇచ్చారు వాట్ ఆర్ ది కాంప్లికేషన్స్, హౌ విల్ యూ మేనేజ్ కేస్ ఆఫ్ అబ్రప్షియా ప్లసెంటా అట్ టర్మ్ అట్లా ఇచ్చారు. దీని కంటిన్యూయేషన్ ఆ 32 weeks దగ్గరే హౌ విల్ యూ మేనేజ్ అబ్రప్షియా ప్లసెంటా అంటే కొంచెం అక్కడికి ఎండ్ అయిపోయింది. అదర్వైజ్ ఇట్స్ గుడ్.
Anything on the third question there?
What are its complications?
That's it. Enumerate the complications of that case or add a note on complications. Some verb should be there.
అంటే అక్కడ కాంప్లికేషన్స్ అని అన్నారు కానీ అక్కడ అబ్రప్షియాను ప్లసెంటా ప్రీవియాను లేకపోతే ఇంకా అదర్ కాజెస్ ఆఫ్ ఏపీహెచ్ అట్లాంటివి రాయలేదు. కాంప్లికేషన్స్ అని జనరల్గా ఇచ్చారు. సో ఇట్ బికమ్స్ అగైన్ ఏ వైడర్ వన్. కొంచెం
Here it is valid because first question they wrote APH. So regarding that complications is understood. Suppose first question is differential diagnosis, then complications should be very specific which disease you want.
ఓకే, థ్యాంక్ యూ.
Okay. MCQs అంటే ఈ రెండు డిఫరెన్స్ చూపించేసేసి. సో ఆల్వేస్ ఓకే అది క్వశ్చన్ 2 typesకి డిఫరెన్స్ చెప్పేస్తే
దీంట్లోనే ఉంది అది.
దాని నెక్స్ట్
వచ్చేస్తుంది. So here you find out some of the causes or different types of questionings. So what are the considerations you include or while preparing an essay question? What are all things you want to take care while preparing an essay question? What are the do's and don'ts? Just like it should not be very vague. వేగ్గా ఉండకూడదు అట్లా ఉంటాయి కదా అలాంటివి. సో how, what are the things you can take into consideration? What should be avoided? Example, అంటే what do you think
అట్లా వేగ్ క్వశ్చన్స్ కాకుండా స్పెసిఫిక్గా ఉండాలి. లైక్ ప్యాథోజెనిసిస్, లేకపోతే హౌ డు యూ మేనేజ్ ఇన్ ఏ థర్డ్ ట్రైమిస్టర్ అనో, లేకపోతే లైక్ దట్ వాట్ ఎవర్ ఇట్ ఈస్. అండ్ సో the question is should be a simple, clear and straightforward language. Language కూడా అక్కడ యూస్ చేసి చాలా సింపుల్గా ఉండాలి, నాట్ వెరీ కాంప్లికేటెడ్ అండ్ దెన్ ఇట్లా నెగిటివ్గా వచ్చేట్లు కాకుండా. అవాయిడ్ వర్డ్స్ లైక్ వాట్ డూ యూ థింక్, వాట్ ఈస్ యువర్ ఒపీనియన్ ఆర్ డిస్కస్ అనే జనరలైజ్డ్ కాకుండా ఇన్స్టెడ్ యూజ్ ఎన్లిస్ట్, నేమ్, ఎన్యూమరేట్, డిఫైన్, కంపేర్, కాంట్రాస్ట్ అండ్ ద ప్రోస్ అండ్ కాన్స్ లైక్ దట్. So here this is another case scenario లాగా డయాబెటీస్ గురించి ఒక చెక్ లిస్ట్ లాగా ఏమైనా తయారు చేయగలరా? 1 minute only, 1 minute. So prepare a checklist and allot marks for features and management of diabetes. Features and 12 marks ki essay question. Final year. మామ్మో చాలా స్పెసిఫిక్గా ఉన్నారు. యు ఆర్ స్టిల్ అంటే పర్వాలేదు. దట్ ఈస్ వెరీ గుడ్ క్వశ్చన్ అంటే. సో చెక్ లిస్ట్, ఫీచర్స్ అండ్ మేనేజ్మెంట్ ఇంక్లూడ్ సో మెనీ పార్ట్స్, అంతే కదా. మేనేజ్మెంట్ అని చెప్పి మొత్తం కలిపి 10 మార్కులు, అది 2 మార్కులు కాదు కదా. ద మేనేజ్మెంట్ ఇంక్లూడ్స్ వాట్ అని మనం డివైడ్ చేసుకోవచ్చు. ఇది ఊరికే హెడ్డింగ్ ఇస్తున్నాం ఇదంతే. సో మీరు ఎస్ఏ క్వశ్చన్ ఇచ్చినప్పుడు ఎలాగ ఇవ్వగలరు, దానికి మార్క్స్ ఎలా అలాట్ చేస్తారు అంటే మొత్తం రాయబాకండి, అవసరం లేదు. క్లియర్ ఫీచర్స్ అని, ఇన్వెస్టిగేషన్స్ అని ఇన్ని మార్క్స్ అట్లా రాయండి. రాసేసారా? ఎస్, 1 minute is over. ఎస్, చదవండి. ఎవరు? మైక్ పెద్దగా.
For clinical features 3 marks, sir. For investigations 3 marks, treatment 4 marks, and for regarding advice, diabetic diet and exercise,
very good, fantastic. టోటల్ ఎంత అయింది? 12 మార్క్స్ వచ్చింది. అప్లాస్, బిగ్ అప్లాస్. చాలా బాగా చేశారు, ఫెంటాస్టిక్. అక్కడికి వెళ్ళిపోదాం ఇప్పుడు. మీదే వద్దే, మీరు ఆల్రెడీ మీకు ప్రైజులు వచ్చేసినాయి చాలా. మీరు చెప్పండి. మీరంతా ఎక్స్పర్ట్స్ అయిపోయారు, మీకు ఆపుతాం. మీకు వేరే కాంప్లికేటెడ్ ఉన్నప్పుడు మీ దగ్గరికి వస్తాం. ప్లీజ్, వాట్ ఎవర్ యూ హావ్ రిటర్న్, పర్వాలేదు చదవండి. మైక్ తీసుకోండి. Features, signs and symptoms. Okay. Investigations, all including everything, 4 marks. Medical management, అన్నిటికీ ఇట్లా. ఓకే, గుడ్. అట్లాగా డివైడ్ చేసి ఇట్లా రాస్తున్నారు. ఎనీహౌ, ఓకే, మీరేం రాశారు చదవండి. ఓకే, దేనికి ఎన్ని మార్క్స్ అది కదా మనకు కాదు. 3 మార్క్స్ అని అన్నీ. ఓకే, గుడ్, వెరీ గుడ్. సో ఐ థింక్ అప్లాస్ టు ఎవ్రీబడి. అందరూ కొట్టుకుంటే సరిపోతుంది. వెరీ గుడ్, అందరూ బాగా రాశారు. సో దిస్ ఈజ్ వన్ ఎగ్జాంపుల్, దట్స్ ఆల్. ఫీచర్స్ 3 మార్క్స్, ఇన్వెస్టిగేషన్స్ 2 మార్క్స్, ట్రీట్మెంట్ 4 మార్క్స్, లైఫ్ స్టైల్ మోడిఫికేషన్, అడ్వైజ్ అన్నావు కదా, అది అడ్వైజ్, అది దానికి ఫర్ దట్ 1 mark ఇచ్చారు. సో వన్ ఈస్ ఆఫ్ కోర్స్ యు గివెన్ ఎ పేపర్, స్టూడెంట్ రాశాడు, ఎగ్జామ్ అయిపోయింది, యు ప్రిపేర్డ్ నైస్లీ క్వశ్చన్స్, వాళ్ళు స్టూడెంట్ టైం ఇచ్చారు, రాసేసారు, అంతా అయిపోయింది. హౌ టు ఎవాల్యుయేట్ ది ఆన్సర్ షీట్స్? So what are the ways to evaluate the answer sheets? అంటే ఒక్కొక్కరు ఒకటి ఉంటాయి. ఎన్ని పేపర్లు రాశాడని కొంతమందికి ఉంటుంది, లోపల అంటే I have seen papers, the student writing the question for 50 times. Diabetes is a disease. What are the features? మొత్తం మళ్ళీ డయాబెటీస్ is diagnosed, it's very difficult. And diabetes is easy to investigate, but it's difficult to treat. Patient అలా అని మళ్ళీ డయాబెటీస్ క్లినికల్ ఫీచర్స్ అని ఇట్లా మొత్తం 3 pages రాశాడు. దిద్ది అయిపోయింది. సో ఇట్ ఇస్ వెరీ డిఫికల్ట్, చాలా జాగ్రత్తగా చూడాలి ఇది. సో వాట్ ఆర్ ది వేస్ టు ఎవాల్యుయేట్ ది ఆన్సర్ షీట్? వాట్ ఆర్ ది వేస్ అంటే మనకి ఇప్పుడు వాట్ ఈస్ ద న్యూ వే ఆఫ్ కరెక్షన్? ఇప్పుడు ఇట్ ఈస్ ఆన్లైన్లో వచ్చేస్తున్నాయి. ఆన్లైన్లో వస్తున్నాయి. అంతకుముందేమో పేపర్ బై పేపర్స్ దిద్దేవాళ్ళు, వెళ్ళి రూమ్కి వెళ్ళి అక్కడ కూర్చొని అట్లా. నౌ ఆన్లైన్లో వస్తుంది. సో హౌ టు ఎవాల్యుయేట్? వన్, హౌ? సో వీ నీడ్ టు హ్యావ్ ఎ చెక్ లిస్ట్ ఒకటి. ఓకే, నెక్స్ట్. అంటే ఒకళ్ళు దిద్ది సరిపోతుందా? ఇప్పుడు ఈయన ఇది స్పోర్ట్స్ మ్యాన్ చక్కగా కొంతమందికి ఇచ్చేస్తాడు మార్క్స్. సో అలా కొంతమంది స్ట్రిక్ట్, వాళ్ళు తక్కువ మార్క్స్ వేస్తారు. ఎట్లా మరి? సో నెంబర్ 2 or 3 ఉన్నప్పుడు యారేంజ్ చేసుకున్నాడు. హౌ దే హ్యావ్ రిప్రజెంటెడ్, వెదర్ దే హ్యావ్ ఆన్సర్ టు ది పాయింట్, రెలెవెంట్ చేశాడా లేదా అని, అదే కరెక్ట్ గా ఆన్సర్ చేశాడు. అండ్ అదర్ వన్ ఈస్ వన్ వాట్ యూ సెడ్ ఈస్ యావరేజ్. యావరేజ్ ఇస్ ఇంపార్టెంట్. More exercise, take average, first one. Grading instead of marking. So grading system అనేది ABC అనేది బెటరా మరి? మీరు చెప్పాలి, బికాజ్ యూ హ్యావ్ మీ ఎక్స్పీరియన్స్ ప్రకారంగా చెప్పాలి. ఆర్ మార్క్సే బెటరా? సో అంటే నా ఉద్దేశం అయితే దానికి అడ్వాంటేజ్ డిసడ్వాంటేజ్ ఉన్నాయి. బోత్ ఈ మెథడ్ అనేది నేను కూడా చెప్పలేదు, బికాస్ గ్రేడింగ్ అనేది ఇవ్వచ్చు, మార్క్స్ కూడా ఇవ్వచ్చు. మార్క్స్ ఈజ్ ఈక్వల్లీ బెటర్ కదా, అంతే కదా. అండ్ దెన్ గ్రేడింగ్ అనేది కూడా కొన్ని ఓన్లీ సమ్ టైమ్స్, నాట్ ఆల్వేస్.
Evaluate in the form of marks and reveal in the form of grades. టీచర్లు మార్కులు వేసుకుంటారు, స్టూడెంట్స్ కి మాత్రం గ్రేడ్స్ ఏ చెప్తాం.
ఓకే. సో మార్క్స్ ది క్వశ్చన్ బై క్వశ్చన్, ఈచ్ క్వశ్చన్ కింద అనేది అట్లా మార్క్స్ లాగా డిస్ట్రిబ్యూషన్. టెస్ట్ హైయర్ లెవెల్ ఆఫ్ కాగ్నిటివ్ ఏరియాస్, అంటే కొంచెం హై లెవెల్లో చేస్తే యూ క్యాన్ ఎవాల్యుయేట్, అంటే వాళ్ళని కరెక్ట్గా ఎవాల్యుయేట్ చేయొచ్చు అనేది. సో హియర్ వీఆర్ గివింగ్ 2 ఫార్మాట్ ఆఫ్ క్వశ్చన్స్. క్వశ్చనర్ చూపిస్తాము. సో యూ ఫైండ్ ద డిఫరెన్సెస్. సో దిస్ ఈస్ ద ఫస్ట్ వన్. ఫస్ట్ వన్ is describe pharmacotherapy of type 2 diabetes covering available drugs, schedules, patient selection and flow diagram. This is one type of question. The other type of question is a 40-year-old woman visits the neurologist with a difficulty in walking. She complains of unclear speech, experiences tremors while performing some activities and incoordination movements. On examination, she has unstable gait, nystagmus and poor eye coordination. So what could be the possible reason for this condition? Explain the physiological basis of it. 3 marks. Explain the salient features of disease. 4 marks. Enumerate and explain the function test required to be performed in this. What are the differences between the two? So first one is only a structured, only pharmacotherapy type 2 diabetes male drugs schedules anede icharu. So second one is some అంటే క్లినికల్ ఓరియంటెడ్గా ఉంది విత్ సమ్ రీజన్ థింకింగ్ అండ్ వాట్ ఆర్ ద డిఫరెన్షియల్ కాజెస్ హౌ అనేది. సో ఇట్ ఈస్ ఇన్ దట్ వే, ఇట్ ఈస్ నాట్ జస్ట్ థియరిటికల్గా అట్లా లేదు. సో the different types of essay questions are structured essay questions. So restricted response questions, more areas, limit higher levels. So structured pathogenesis, enumerate the causes అనేది. So describe pharmacotherapy అనేది structured అది. Okay. So modified essay questions, that is higher areas, problem solving type of question, short history followed by questions. అక్కడ ఉంది కదా షార్ట్ హిస్టరీ ఫాలోడ్ బై క్వశ్చన్స్. దానిలో మోడిఫై ఈజ్ బెటర్, క్లినికల్లీ ఓరియంటెడ్గా ఉంటుంది. ఇది నేను చెప్దాం అనుకున్నా కానీ టైం ఉంటుందో లేదని చెప్పలేదు నేను. యా సో సమ్టైమ్స్ కేస్ సినారియో ఇచ్చి వాట్ ఈస్ ద ప్రాబబుల్ డయాగ్నోసిస్ అని అంటాం. వాట్ ఈస్ ద ప్రాబబుల్ డయాగ్నోసిస్ అంటే ఆ డయాగ్నోసిస్ బహుశా అది అబ్రెప్షియో ప్లసెంటా అవ్వచ్చు. బట్ దట్ స్టూడెంట్ హెస్ ఆన్సర్డ్ ఇట్స్ ప్లసెంటా ప్రీవియా. అదే కదా మీ పాయింట్, ప్లసెంటా ప్రీవియా. సో ద డయాగ్నోసిస్ ప్లసెంటా ప్రీవియా బికాస్ ఆఫ్ దీస్ ఫీచర్స్ అని రాశాడు. దానికి 2 మార్క్స్. ఆ 2 మార్క్స్ గాన్. నెంబర్ 2, how do you investigate? Investigations are the same. Patient examination, clinical examination, bleeding PV, speculum examination and then ultrasound examination చేశారు. బ్లీడింగ్ ఉంది, ఇవన్నీ ఉన్నాయి. రెండింటికి ఒకటే, ఆల్మోస్ట్ ద సేమ్. సో మేనేజ్మెంట్, so the patient is taken to the theater or blood transfusion is given, lot of blood is given and the patient will be in shock, resuscitation should be done and then immediately the patient can be delivered in the theater. all the అనేది మొత్తం రాశాడు. రెండింటికి ఒకటే, ఆల్మోస్ట్ ద సేమ్. ఇఫ్ కొంత వేరియేషన్ ఉండొచ్చు. ఇలాగ ఎన్నోసార్లు నాకు పేపర్స్ వచ్చినాయి. ఏం చేయాలి అప్పుడు, హౌ టు పుట్ ద ఇది. సో దే హ్యావ్ డివైడెడ్ ఫస్ట్ డయాగ్నోస్కి 2 మార్క్స్, క్లినికల్ అదే ఆర్ ఇన్వెస్టిగేషన్స్కి 3 మార్క్స్, మేనేజ్మెంట్కి 4 మార్క్స్. జీరో వేయాలా లేకపోతే అప్పుడు అంటే స్టూడెంట్ ఫ్రెండ్లీ అయిపోయాం అప్పుడు, అంతే, అంతకంటే ఏం లేదు. స్టూడెంట్ ఫ్రెండ్లీ అయిపోయాం. పాప ఏదో రాశాడు కదా, వీడు సేవ్ చేయడానికి ట్రై చేశాడు కదా అని వేశాం. కానీ ఐ హ్యాడ్ దట్ డౌట్ ఫ్రమ్ ది, అప్పటి నుంచి ఆ డౌట్ ఉంది. వాడు మన అన్యాయం చేసామేమో, మన అన్యాయంగా వేసామేమో అనే డౌట్ వచ్చింది. ఇంకొక అతను మామూలుగా అబ్రెప్షియో రాశాడు, ట్రీట్మెంట్ రాశాడు. వీడు ప్లసెంటా ప్రీవియా రాశాడు, ట్రీట్మెంట్ రాశాడు. ఏం చేయాలి ఇప్పుడు? అది అందుకే డిఫరెన్షియల్ డయాగ్నోసిస్ రాసి అన్ని రాసి లాస్ట్లో ట్రీట్మెంట్ ఆఫ్ ఇన్ అబ్రెప్షియో ప్లసెంటా అంటే కన్ఫ్యూషన్ ఉండదు. ఏం సార్? అందుకే నేను అప్పుడు అనుకున్నా ఫ్రేమింగ్లో ఇలా చేస్తే బాగుంటుందేమో. స్టూడెంట్ ఓకే ఓకే అంటే ఇది మేబీ దే హ్యావ్ ఫ్రేమ్డ్, వీ డోంట్ నో. మనం ఫ్రేమ్ చేసిందే చూసుకుందాం, మనదే కరెక్ట్.
That's why when we go for the examiner to set a paper, always the STEM, the lead question should be appropriate. That is the main thing we have to consider. That what we have learned from this workshop is that when we go for the, when they call for the exam to set the assignment paper or set one questions, we have to make sure don't give vague thing. Give a lead to come to the point. That is the motto of this workshop mainly.
And the students also should not be misled. మీరు చెప్పినట్లుగా డిఫరెన్షియల్ వాట్ ఈస్ ద ప్రాబబుల్ డయాగ్నోసిస్ అంటే అయిపోతుంది, అక్కడే అయిపోతుంది. బట్ తప్పు రాసేస్తాడు అనుకోండి, దెన్ ఎవ్రీథింగ్ గోస్. You are correct. You are 100% correct, sir. Correct. No, ఏమి రానోడు ఏదో రాసేసి వెళ్ళిపోతాడు. బాగా చదివి రియల్ గా ఇదా Most of the times, madam, nowadays I am seeing the postgraduate questions are very straightforward. What we are seeing, my experience. Undergraduate కొంచెం తిప్పి అలా కేస్ సినారియో లాగా ఇంత పెద్దది ఇచ్చి అట్లా ఇస్తున్నారు అట్లా. బట్ ఎనీహౌ దట్స్ ఆల్ ప్రాక్టికల్లీ వాట్ వీఆర్ ఫాలోయింగ్. సో హైయర్ modified essay questions are higher areas, short history followed by questions. And improving questions, essay questions extended, response or restricted, modified forms, structured essay questions, modified essay questions and short answer questions. Those are all the essay questions అయిపోయింది. ఇప్పుడు MCQs, let us go for the MCQs. ఇది ఫస్ట్ వచ్చేసింది. సో essay మల్టిపుల్ చాయిస్ క్వశ్చన్స్ రెండు రకాలు ఉంటాయి. ఒకటి వాట్ ఈస్ ది డయాగ్నోస్టిక్ ఫీచర్ ఆఫ్ అంటే 1 2 3 4 అందులో ఒకటే ఉంటుంది. సో దట్ ఈస్ మెమరీ ఐసోలేటెడ్ ఫ్యాక్ట్ అంటే డైరెక్ట్ క్వశ్చన్. అండ్ దెన్ నాలెడ్జ్ బేస్డ్ అయితేనేమో కొంచెం ఆ క్వశ్చన్ని కొంచెం తిరగేసి లేకపోతే డిఫరెన్షియల్ డయాగ్నోసిస్ బట్ ఈస్ మోస్ట్ ప్రాబబుల్ ఆర్ ద పేషెంట్ ఈజ్ ఆన్ such a drug and she has become pregnant, whether to continue that drug or not. అంటే డైరెక్ట్గా ఇవ్వకుండా వెదర్ ఇట్స్ కాంట్రాఇండికేటెడ్ టు ప్రెగ్నెన్సీ కాదా అని ఇవ్వకుండా షీ ఈజ్ ఆన్ సో అండ్ సో ట్రీట్మెంట్ అండ్ షీ బికేమ్ ప్రెగ్నెంట్, వెదర్ టు కంటిన్యూ దట్ డ్రగ్ ఆర్ నాట్, కొంచెం అట్లాగా. సో దోస్ ఆర్ ఆల్ సమ్ రీజనింగ్ క్వశ్చన్స్. సో 2 types ఉంటాయి ఇట్లా. ఇదేనా?
So this is the one of the scenarios they have given and they given the answers. The basic concept of this is the principle they are expect. The base scenario is that, but they modified, they made the scenario scenario and they, but it is not a high problem solving problem. The base recall factor higher order the same thing. What have seen in the essay the same way they have to play. See the next question.
So here you see the doctor has lipid profile and then here the principal abnormality of fat metabolism diabetes is a direct question, direct same, but so all these things the doctor has lipid profile, it is on unnecessarily kada unnecessary ga rasade.
So when you compare this is a higher order, so not the code, just not the recall fact, actually you are going to the scenario, so your brain is reactivating the motor code and all. So this kind of MCQs we have to use. That is the motor of itself.
So ఇది reasoning తో ఉన్న question. So in once drugs and hypertensive experiment now an effective not preferred hypertensive, which of the following best describe the reason for this? So కొంచెం reasoning ఉన్న question ఇది. Higher order thinking. So assessment drives learning. So what are all the basic steps?
So when you write the MCQs, you have to remember the stem, lead and the option. Can anybody tell what is a stem?
In MCQs లో డివైడ్ చేశారు.
Stem,
head, body,
lead.
tail లాగా.
So what is a stem? Basic question. Then what is a lead? Lead to the answer. So what are the options? So what are the consideration while you making the options? Okay, ఇంకా ఇప్పుడు MCQs వాట్ పర్పస్ యాక్చువల్లీ నాలెడ్జ్ బేస్ అవ్వచ్చు, హయ్యర్ ఆర్డర్ కూడా. మనం ఇప్పుడు నెక్స్ట్ ఎగ్జామ్కి కానీ ఆర్ నీట్ ఎగ్జామ్కి కానీ MCQs రైట్, దిస్ ఇస్ హయ్యర్ ఆర్డర్. సో వాట్ ఇస్ అదర్ దాన్, నో అంబిగ్విటీ ఉండకూడదు. and the other 3 should be the distractors. Okay, the answers అనేవి lead నుంచి రావాలి, కానీ the distracted also should be similar to that. Why we use the MCQs first, other than the fact it's a higher order, to differentiate the difficulty index, to see where the discrimination of the student also, where is a high standard or low standard. For that you have to frame the question properly. So the STEM is the one, the main scenario or the stimulus which gives to the question, and the lead is the specific questions, what you want to know from that. That is the lead, what you are expecting from that. And the options will be so many with a distractor, and the main key question, the main answer will be there. When you are framing that, so when you see this one, this is a STEM, all the scenario, this is the lead, and the option sets are the distractors, and one correct key question will be there. The same MCQs what we see actually, but they divided, that is a STEM, lead. The lead most probably which of the following is most likely the diagnosis. What is the main questions what they are putting? That is the lead for you. Okay, and these are the options you have to identify, the distractors. Okay, so the same thing, this is a one more higher order of MCQ, the STEM, lead and the distractions and options. One option will be correct, that is the key, other things will be the distractors. Okay, so basic rules what we discussed now. So don't avoid negative lead, not except, all of the above, none of the above. So please avoid that, and make sure the question will be very simple and clear. It should be clear for the student. And even some options you write some, they start with rifampicin or again like that, similar words they give the distractors, so that you can discriminate the students. When you are making MCQs is very tough rather than essay questions actually. So avoid this none of the above, all of the above, all these things. Okay, the distractor we should be very specified, same length undali, and it should be very similar to that answer, but not the both answers should be similar, like that it should be actually.
డిస్ట్రాక్టర్ ఎక్కువ ఉంటే మంచిదా, తక్కువ ఉంటే మంచిదా? తక్కువ ఉండాలి, నేరోగా ఉండాలి. దెన్ ఓన్లీ ఇదా అని అనుకుంటారు. లేకపోతే ఒకటేమో యాంటీ హైపర్ టెన్సివ్స్ 4 ఇచ్చి ఒకటి యాంటీ మ్యాలిగ్నెన్సీ ఇచ్చామనుకోండి, ఇట్స్ వెరీ ఈజీ. యాంటీ మ్యాలిగ్నెన్సీ ఒకటే ఉంటుంది కదా, తక్కినవన్నీ ఇట్లా. సో లైక్ దట్, ఆర్ సమ్ టైమ్స్ ఆ స్పెల్లింగ్స్లో కూడా దగ్గర వచ్చేలాగా ఇస్తాడు ఇట్లా అనేది. సో డిస్ట్రాక్టర్ షుడ్ బి less.
So the MCQs frame చేయటం ఒకటైతే, after that MCQs you have to validate the MCQs and you have to identify the difficulty index and discrimination index. That the post MCQ things is very important. When you go for the NEET exam or anything, what they do actually, they'll make some set of question papers to set, some examiners to set the MCQs first. Then after the NEET exam or any exam, after the exam they take the questions. They take each question MCQ, they evaluate. What they evaluate, that is the validity actually. The difficulty index, how you calculate the difficulty index? Take 100 students have given the exam. How many of them to given the correct answers? Suppose you think 70 members have given the correct answers out of 100. Do you think is it easy or difficult? Suppose 25 members are, only the 25 members given the answer correct. Is it difficult? Right. So then average 50 members if they give 50 to 60, that is a moderate, that is a good question. So you have to make some of the questions like that, and some of the questions really you have to make it difficult to differentiate the lower means higher students. You have to make like that. So that is a discrimination index. Again, with the difficulty you have to make the discrimination of the students also. And the distractor effectiveness, you have to see the distractors also very effective and very balanced, and each distractor has the possible very close to the answer. It should be like that, otherwise the question has no validity. What is validity? Something vague.
What is validity and what is evaluation?
exactly what you have to measure. You are measuring the same thing. That is validity. Okay. Now I want to measure the student knowledge or higher order thinking. The same thing I am measuring with this question. My objectives are fulfilled with this question. That is validity. If otherwise, there is no use of MCQs. This MCQ, I want to know from the student this objective. That has to be fulfilled. Then only that is a valid question. So after the examination MCQs, they do all the things. So they eliminate some of the questions. They keep in some of the questions in pool. That is a post dissection area MCQs. That is a big task actually. Okay.
Validation you do for a ongoing process. Ongoing process. So you are conducting examinations and you are validating. Evaluation ante at the end of the program, what you do evaluate? ఒక ప్రోగ్రాము ఏదో ఒక రీసెర్చ్ చేశారు, అట్లా అయిన తర్వాత ఎండ్లో ఏమైంది, దట్ ఎవాల్యుయేషన్. వ్యాలిడేషన్ ఈస్ మళ్ళీ అగైన్ యూ డూ ఇట్ ఇస్ అన్ ఆన్ గోయింగ్ ప్రాసెస్ అనమాట. ఈ ఎగ్జామ్లు జరుగుతూ ఉంటే మనం వ్యాలిడేట్ చేసుకుంటూ ఉంటాం, అప్డేట్ చేసుకుంటూ ఉంటాం, ఇలా చేసుకుంటూ ఉంటాం. దట్స్ ద డిఫరెన్స్ బిట్వీన్ ద టూ.
So all this program which went successfully, that is evaluation. So we give the feedback and we evaluate how the program is. That is evaluation. So with this, I am going to finish our topic and we are done.
Now you are experts in definitions, you are experts in classifying, you are experts in conducting the assigning the question papers, you are experts in corrections also. So tomorrow we will see what you will do.
చెప్పలేదు యాక్టివిటీ స్లైడ్ 12th డ్రాఫ్టింగ్ షెడ్యూల్. సో టాపిక్లోకి వెళ్ళే ముందు ఒక చిన్న ఎక్సర్సైజ్ చేద్దాం, ఓకేనా? సే ఫర్ ఎగ్జాంపుల్ అందరు రాసుకోండి, ఇది జనరల్ మెడిసిన్కి 5 hours, సర్జరీకి 5 hours, ఓబీజీకి 5 hours, 5 hours మేజర్ సర్, ఆర్థోపెడిక్స్ 2 hours, pediatrics 3 hours. Total time manakundi 20 hours for all the subjects. 5 days time. 5 days time. Okay na? దానికి ఒక షెడ్యూల్ వేయండి, జస్ట్ దాని మీద బోర్డు మీద మీరు డిసైడ్ చేయండి ఈవెన్గా. మనం స్టూడెంట్ అయితే 20 hours among 5 days for all the subjects. మేడం యువర్ విష్. మన సబ్జెక్ట్ అయితే అంతే, మనకి ఇప్పుడు ప్రస్తుతానికి ఇది అంతే, ఓకేనా? క్లినిక్స్ నేను మెన్షన్ చేయలేదు, జస్ట్ ఇదే ఉంది, ఇదే టైం ఉంది మనకి, ఓకే? 9 to 4లో లేదా 5 hours పెట్టుకోండి, 4 hours పెట్టుకోండి డైలీ, మధ్యలో ఒక లంచ్ అవర్ పెట్టుకోండి. మనం స్టూడెంట్ అయితే మనకి ఏది కంఫర్టో చెప్పండి, ఓకే? అదేనండి, అదే ఈవెన్గా డిస్ట్రిబ్యూట్ చేసేసేయండి. మన స్టూడెంట్ అయితే ఈవెన్గా అయితే బాగుంటుంది అనుకుంటాం కదా, అలాగే If we are a student, how we feel comfortable? Five days time. Distribute those 20 hours among those 5 days. బోర్డు మీద చెరిపేయచ్చా మేడం? మహతి మేడం వెళ్ళిపోయారా? బోర్డు మీద దాంతో ఇంకా పని ఉందా? చెరిపేయచ్చా? బోర్డుతో పని ఉందా? చెరిపేయచ్చా సార్? ఓకే. అయిపోయిన వాళ్ళు బోర్డ్స్ మీద వేసేసేయండి, మీ బోర్డ్స్ మీద. వెరీ గుడ్. మేడం వాళ్ళకి 5 minutesలో 5 minutes చాలు మేడం. ఎందుకు అది టైం టేబుల్ సెట్ చేస్తున్నారు? జస్ట్ సింపుల్ టైం టేబుల్ చేస్తున్నాను మేడం. అయిపోయింది కూడా వేసేస్తున్నారు. ఆర్దో 3 ఎక్కడ? ఆర్దో 2 చెప్పానా? ఓకే. పీడియాట్రిక్స్ 3. యా ఫైన్.
సార్ మీకు 5 days చెప్పింది, మండే టు ఫ్రైడే.
మార్కర్ అంటే అదే అక్కడ అదే క్లినిక్స్ కూడా పెడుతున్నారు. So tell me the steps now. How did you do that? What all you have seen now? Tell me the steps in framing a timetable. Yeah. Total time available first of all. Maybe weeks lo mottham ani teliyali manaki. Total number of hours available, and then total number of hours. No, not faculty. టోటల్ ఆ సబ్జెక్ట్స్కి ఎన్ని అవర్స్ కావాలి, ఎన్ని అవర్స్ కావాలో నేను చెప్పాను కాబట్టి అన్ని అవర్స్ వచ్చేలాగా మనం ఫ్రేమ్ చేసేసుకున్నాం. అలాగే మనకి ఎన్ఎంసీ హ్యాస్ గివెన్ ఈచ్ ఫేజ్కి ఈచ్ సబ్జెక్ట్కి ఎన్ని అవర్స్ కావాలి, ఆ అవర్స్ని మళ్ళీ ఎస్డిఎల్ సెల్ఫ్ డైరెక్టెడ్ లెర్నింగ్ ఎన్ని ఉండాలి, ఓకే, లెక్చర్స్ ఎన్ని ఉండాలి, స్మాల్ గ్రూప్ డిస్కషన్స్ ఎన్ని ఉండాలి, ఇలా డివైడ్ చేశాడు. అవన్నీ చూద్దాం, అదే చెప్తా, అదే క్లాస్. ఓకేనా? హాలిడేస్ని తీసేసేయాలి, ఇచ్చిన టైం అన్నీ చూసుకోవాలి, నెంబర్ ఆఫ్ అవర్స్ చూసుకోవాలి, రోజుకి ఎన్ని అవర్స్ పెట్టాలి, ఈచ్ వీక్ ఎన్ని పెట్టాలి, ఆ తర్వాత టోటల్లీ 1 ఇయర్కి ఏ రోజు ఏ పీరియడ్లో ఏ క్లాస్ చెప్తున్నాం అనే షెడ్యూల్ బిగినింగ్లోనే మనం అప్లోడ్ చేయాలి. దిస్ ఈజ్ ద ఎక్సర్సైజ్ యాక్చువల్లీ. ఓకే, ఇప్పుడు మనం చేసింది సింపుల్గా ఒక 5 డేస్కి చేసాం కదా, అది 1 ఇయర్కి చేసి ఇవ్వాలి వాళ్ళకి. ఓకే, అన్ని ఈవెన్గా ఉన్నాయి, దగ్గరగా ఉన్నాయి కాబట్టి నో ప్రాబ్లం. ఇది 3rd ఇయర్లో ఫైనల్ ఇయర్కి వచ్చేటప్పటికి పల్మనాలజీకి ఒక 20 అవర్స్, ఇంకో సైకియాట్రిక్ ఒక 18 అవర్స్, ఇలా డివైడ్ చేసి ఇస్తున్నాడు. అప్పుడు ఏం చేస్తామంటే వేరు ఫేజుల్లోకి మార్చుకుంటాం. మేజర్ సబ్జెక్ట్స్ అన్నీ మేజర్ ఉంచుకొని చిన్న సబ్జెక్ట్స్ ఉంటే అక్కడక్కడ ఇరిగించుకుంటూ తీసుకొని వెళ్తున్నాం. సో ఓవరాల్గా 1 ఇయర్ ప్లానర్. మేజర్గా ఇక్కడే స్టక్ అయ్యాం. సిబిఎంఈ వచ్చిన ఫస్ట్లో భయంకరంగా ఫీల్ అయిన ఎక్సర్సైజెస్ అందరూ ఇదే. ఓకేనా? ఏ రోజు ఇంటర్నల్ ఎగ్జామ్ ఎప్పుడు పెడతాము, ఎన్నింటి నుంచి ఎన్నింటికి పెడతాము, ప్లస్ అన్నీ కరెక్ట్గా ఫేజుల్లోకి రావాలి, మళ్ళీ దాంట్లో స్పోర్ట్స్ రావాలి, క్లినిక్స్ రావాలి, ఆల్ దిస్ షుడ్ కమ్ ఇన్ టు యాక్ట్. అన్నీ 1 ఇయర్కి ఏం చెప్తున్నామో మనం చెప్పాలి. సో మేజర్గా ఇక్కడ స్టక్ అయ్యాం. యాక్చువల్లీ మీకు అసలు అది ఇవ్వలేదు కదా, ఎందుకు రాస్తారు? రాయకూడదు, అది టైం టేబుల్లో లేదు, ఇచ్చిన వరకే రాయాలి. ఓకే, సో దిస్ ఈజ్ డ్రాఫ్టింగ్ ఏ షెడ్యూల్. బేసిక్స్ ఇవే, అవే ఇక్కడ చూద్దాం. మీరు ఏదైతే చేశారో అది ఎలా చేయాలో సో వై అసలు టైం టేబుల్ ఎందుకు, దానివల్ల అడ్వాంటేజ్ ఏంటి? సిస్టమాటిక్గా ఏ టీచర్ ఎప్పుడు ఏం చేయాలో తెలుస్తుంది, అండ్ స్టూడెంట్ ఆల్సో విల్ బి ప్రిపేర్డ్ ఫర్ దట్ పర్టికులర్ పీరియడ్. ఓకేనా? దానికి ఏమి సడన్గా వచ్చే కొన్ని మేజర్ థింగ్స్ తప్ప అదర్వైజ్ సాఫీగా సాగుతుంది. ఇట్ ఈస్ ఈజీ ఫర్ ఎ టీచర్, ఈజీ ఫర్ ఎ స్టూడెంట్. ఓకే, ఎవ్రీథింగ్. The concept of a teaching schedule, a list of times when particular events, activities or events will happen, a schedule of events that organizes teaching activities throughout the day, week or term or year, and teaching schedule which shows exactly what is to be done at a particular time, clinics, exam, everything like this. Okay, and a teaching schedule consists of a list of complete set of offered courses as well as time, place of each course offered. Everything in detail should be there. First initial గా మనం 1 week చేస్తాం, తర్వాత దాన్ని 1 month చేస్తాం, అదే 52 weeksకి ఎంత కావాలంటే అది వస్తుంది. లెట్ us see 1 academic yearకి మనం చూద్దాం. నీడ్, ఇవన్నీ మనకు తెలిసిన విషయాలే. సో ఫస్ట్ ప్రొఫెషనల్ ఇయర్లో మనం చేయాల్సినవి ఇవన్నీ ఉన్నాయి. ఫౌండేషన్ కోర్స్, అఫ్ కోర్స్ అది టైం మారుతూ ఉంది, ఇయర్కి మార్చుకుంటూ వచ్చారు. 2 నెలలు అన్నాడు, 1 నెల, 1 మంత్ అన్నాడు, 1 week right now, spreading over 6 months after that discrete of the college. Foundation course, bridging from their intermediate to our మెడికల్ కాలేజ్ ఏరియా. ఫౌండేషన్ కోర్స్ ఇన్ బిట్వీన్ దాన్ని తీసుకొని వస్తున్నాము. హ్యూమన్ ఎనాటమీ, ఫిజియాలజీ, బయోకెమిస్ట్రీ ఆఫ్ కోర్స్. వీటితో పాటు ఇంట్రడక్షన్ టు కమ్యూనిటీ మెడిసిన్, హ్యుమానిటీస్, ఎర్లీ క్లినికల్ ఎక్స్పోజర్, ఫ్యామిలీ అడాప్షన్ ప్రోగ్రామ్, ADCOM. ఆల్ దీస్ ఆర్ టు బి డెల్ట్ ఇన్ ద ఫస్ట్ ఇయర్. ఇవి డిఫరెంట్ ఏరియాస్ అండ్ టైమ్ గివెన్ ఈస్ 13 months ఫర్ ఫస్ట్ ప్రొఫెషనల్ ఇయర్. సో దట్ ఈస్ ద మ్యాక్సిమం టైం. ఇప్పుడు నా ఆ 13 monthsలో మళ్ళీ మనం ఏమేమి తీసేయాల్సి ఉంటుందో. ఇవి సబ్జెక్ట్ని ఎలా డివైడ్ చేశారో చూడండి. లెక్చర్స్ 280, SGDs అండ్ వేరియస్ అదర్ థింగ్స్ 410, SDL 20, టోటల్ 650, 461, 245. ఇవన్నీ మనసులో పెట్టుకోవాలి, ఇవన్నీ తీసుకొని అన్నీ తీసుకోవాలి. దిస్ ఆల్ టు బి క్యాలిక్యులేటెడ్ విత్ ఇన్ ద టైమ్ గివెన్ ఇన్ ద 13 months ఫ్రేమ్లోకి. ఈ నెంబర్ ఆఫ్ అవర్స్ని కూడా ఇలానే డిస్ట్రిబ్యూట్ చేయాలి. ఈచ్ డిపార్ట్మెంట్ మళ్ళీ ఇట్లా డిస్ట్రిబ్యూట్ చేయాల్సి ఉంటుంది. కమ్యూనిటీ మెడిసిన్లో ఫ్యామిలీ అడాప్షన్ ప్రోగ్రామ్ టోటల్ 67 hours, 40 hours ఫర్ ద క్లాసెస్ అండ్ 27 hours ఫర్ ఫ్యామిలీ అడాప్షన్ ప్రోగ్రామ్. సో నౌ ఫస్ట్ థింగ్, కన్సిడర్ ద అలాటెడ్ డ్యూరేషన్ ఫర్ ద ఫేజ్ ఇన్ ద అకాడమిక్ క్యాలెండర్. ఫస్ట్ MBBS 23 బ్యాచ్కి దిస్ ఈస్ ద ఏరియా ఆఫ్ టైమ్ గివెన్. 13 months ఇచ్చాడు, అప్రాక్సిమేట్లీ 57 months. Approximately time left is 42 hours excluding 15 weeks for exams, occasion, public holidays. ఇవన్నీ తీసేస్తే 42 hours టైం మనకి ఇచ్చారు. దాన్ని 42 into 39 hours, 1638 hours అవైలబుల్ అవర్స్ టీచింగ్కి వచ్చింది మనకి. టీచింగ్ పర్ డే 7 hours, either 8 to 4 or 9 to 5 తీసుకుంటాం. మధ్యలో ఒక లంచ్ అవర్. 7 hours per day, 6 days a week. So total teaching hours per week is 42. Accordingly, calculate the teaching hours available for in each phase as per duration allotted. All holidays, vacation period, examination period must be deducted from the total period. First thing to be done. And then preparation of a master timetable. As per allotted hours, each subject in each phase allotted teaching slots in weekly time schedule ని ముందు మనం తీసుకోవాలి. అది మళ్ళీ మనం HODs తో మాట్లాడి. ఇందాక మీరు ఇక్కడ చూస్తే అక్కడ ఒక చోట జనరల్ మెడిసిన్ వరుసగా జనరల్ సర్జరీ ఇవన్నీ తీసుకొని వచ్చారు. ప్లస్ ఇలాగా ర్యాండమ్గా వేసుకుంటూ వచ్చాం. ఇవి రెండు మనం నేను డిపార్ట్మెంట్స్కి పంపించినప్పుడు ఫైనల్ ఇయర్లో మేజర్ HODs ఇలా సేమ్ వద్దు, రెగ్యులర్గా బెటర్ ర్యాండమ్గా తీసుకోమని అడిగారు. ఇది ఎయిదర్ వన్ ఏదైనా పర్లేదండి. స్టూడెంట్ రోజు పొద్దున్నే జనరల్ మెడిసిన్, జనరల్ సర్జరీ తర్వాత ఇలా అయినా వస్తాడు. ఎందుకంటే ఫైనల్ ఇయర్ సబ్జెక్ట్స్ 6 daysకి సరిపడా ఉన్నాయి యాక్చువల్లీ. సో ఇప్పుడు లేటెస్ట్ షెడ్యూల్ అలా పంపిస్తే వాళ్ళు అడిగింది ఏంటంటే ర్యాండమ్గానే వేసుకుందామని. 3 HODs అడగటం వల్ల అది ర్యాండమ్గానే వెళ్తుంది ఇప్పుడు మన కాలేజ్లో ఫైనల్ ఇయర్కి. ఓకేనా? సో డిఫరెంట్ కాంపోనెంట్స్ మనం పంపిస్తే వీ హ్యావ్ టు డిస్కస్ విత్ ద యాక్చువల్లీ డిపార్ట్మెంట్స్ వాట్ దే హ్యావ్. వాళ్ళు కదా చేయాల్సింది. గెట్ ఇట్ వెరిఫైడ్ ఫ్రమ్ కన్సర్న్ HODs అండ్ దెన్ ప్రిపేర్ మంత్లీ టీచింగ్ షెడ్యూల్. అండ్ దెన్ మంత్లీ షెడ్యూల్ని మనం 12 monthsకి తీసుకొని వెళ్ళిపోతాం. ఓకే, మధ్యలో లీవ్స్ని తీసేసుకొని ఓవరాల్గా తీసుకొని వెళ్తాం. అది ఇయర్లీ షెడ్యూల్ అవుతుంది. సో వాటిల్లో మళ్ళీ ఆ క్లాసెస్ ఏంటి అనేది లెక్చర్స్ని లెక్చర్ 1, లెక్చర్ 2 ఇట్లా డివైడ్ చేసుకుంటాం. ప్రాక్టికల్స్, ఎర్లీ క్లినికల్ ఎక్స్పోజర్, ఇంటిగ్రేషన్. వాట్ ఈజ్ ఇంటిగ్రేషన్? డిఫరెంట్ డిపార్ట్మెంట్స్కి సంబంధించి ఒకే టాపిక్ గురించి మాట్లాడుతున్నాం అనుకోండి. సే ఫర్ ఎగ్జాంపుల్ ఎనాటమీలో కార్డియోవాస్కులర్ సిస్టంలో హార్ట్ గురించి మాట్లాడుతున్నప్పుడు ద సేమ్ థింగ్ జనరల్ మెడిసిన్ వాళ్ళతో చేసుకోవచ్చు. ఇంటిగ్రేట్ చేసి వాళ్ళు కూడా వచ్చి కొంచెం పార్ట్ చెప్తారనమాట. సో దట్ ఓకే ఇది అర్థమవుతుంది. సేమ్ ఫేజ్లో వాళ్ళైతే హారిజాంటల్ ఇంటిగ్రేషన్ అంటాం, లేదా పై సబ్జెక్ట్స్ నుంచి కింద సబ్జెక్ట్ అన్ని చేస్తుంటే అది వర్టికల్ ఇంటిగ్రేషన్ అంటాం. ఓకే, ఇంటిగ్రేటెడ్ సెల్ఫ్ డైరెక్టెడ్ లెర్నింగ్స్, ADCOM, ఫ్యామిలీ అడాప్షన్ ప్రోగ్రామ్, సిమ్యులేషన్ ల్యాబ్స్, క్లినిక్, స్పోర్ట్స్, examinations like part completion test. Everything should be indulged in the schedule. Everything must be there. Formative assessment అంటే ఏమన్నారు నిన్న? ఎండ్ జరిగేది సమ్మేటివ్, డ్యూరింగ్ ద కోర్స్ జరిగేది ఫార్మేటివ్ అసెస్మెంట్ అన్నమాట. ఓకేనా? అవి కూడా ఎవ్రీ వీక్ ఒక్కొక్క డిపార్ట్మెంట్కి ఫార్మేటివ్ అసెస్మెంట్కి కూడా ప్లేస్ ఇవ్వాల్సిందే మనం. క్లియర్? సో దిస్ ఈజ్ వన్ ఆఫ్ ద ప్రిపేర్డ్ 1 week ప్లాన్ అనమాట. అన్ని కూడా సబ్జెక్ట్స్ అన్నీ వచ్చేలాగా లంచ్, ప్రాక్టికల్, ఫ్యామిలీ అడాప్షన్ ప్రోగ్రామ్, సాటర్డేస్ తీసుకున్నాము, కమ్యూనిటీ మెడిసిన్ సబ్జెక్ట్ లైక్ దిస్. దిస్ ఈజ్ ఒక శాంపుల్ ఆఫ్ ఎ షెడ్యూల్ ప్రిపేర్డ్. ఒక్కొక్క సబ్జెక్ట్కి ఒక్కొక్క కలర్ తీసుకొని ఉంటాం. సో దట్ చూడగానే మనకు 1 2 3 4 5 6 7 లేదు ఓవరాల్గా వర్కింగ్ అవర్స్ ఆర్ 7. ఓకేనా, దాంట్లో 6 అవర్స్ ఉంటాయి మనకి వర్కింగ్కి వచ్చేటప్పటికి. లంచ్ 1 అవర్ ఉంటుంది మొత్తం ఓవరాల్గా ఇంక్లూడ్. ఇక్కడ ఉంది సార్ అది కూడా 3 to 5 2 అవర్స్ ఇది, అది కూడా ఇంక్లూడెడ్. ఓకేనా, 7 అవర్స్ మనకి అదే 7 ఉండాలి. 7 అవర్స్ ఉంటేనే మనకు వాళ్ళు ఇచ్చిన అవర్స్ కవర్ చేయగలుగుతున్నాం. అది ముందు 8 to 4 లేదా 9 to 5, మనది 9 to 5 రన్ అవుతుంది మన షెడ్యూల్స్. అవును. సో అలైన్మెంట్ ఎలా అంటే ఇంకొకటి, షెడ్యూల్ వేసేటప్పుడు మళ్ళీ షెడ్యూల్ అంతా వేసేస్తాం, టైం టేబుల్ అంతా సబ్జెక్ట్ వైజ్ వేసేస్తాం. నెక్స్ట్ సబ్జెక్ట్స్లో ఏ లెసన్ ఎప్పుడు చెప్తున్నాం అనేది కూడా వీ హ్యావ్ టు డిస్కస్. అప్పుడు ఆ ప్యారలల్గా జనరల్ మెడిసిన్, జనరల్ సర్జరీ వీళ్ళందరూ ఉన్నారనుకోండి, ఒక సిమిలర్ టాపిక్స్ ఒక టైంలో ఒక సిమిలర్ టాపిక్స్ అన్నీ పెట్టుకున్నాం అనుకో, స్టూడెంట్కి ఎక్కడేదో చదివి అక్కడేదో చదివి అక్కడే చదివి ఒక టైంలో ఒక కాన్సెప్ట్ అంతా చదువుతాం. అలా ఉండేలాగా ప్లాన్ చేయాల్సి ఉంటుంది. అండ్ దేర్ విల్ బి సమ్ ఏరియాస్ వేర్ దే విల్ నాట్ వీ కెనాట్ అలైన్ లైక్ దట్, సపరేట్ ఏరియాస్ అనమాట. అవి సపరేట్ కలర్స్ తోటి సపరేట్గా మెన్షన్ చేస్తాం చివరికి వచ్చేటప్పటికి. ఇవన్నీ కూడా సిమిలర్ థింగ్సే మనం కవర్ చేసుకుంటూ వచ్చాం. క్లియర్? అలా అలైన్ చేయడానికి ట్రై చేయాలి. సో దేర్ ఈస్ ద టోటల్ ఇంటిగ్రేషన్ మేడం. ఇది కూడా ఉందా లేదా అనేది కూడా మనకి డాక్యుమెంట్ కాంపిటెన్సీ బుక్లో దిస్ కెన్ బి అలైన్డ్ విత్ దిస్ కెన్ బి ఇంటిగ్రేటెడ్ విత్ దిస్ అని సపరేట్గా పక్కన మళ్ళీ ఇస్తారనమాట. ప్రతి సబ్జెక్ట్కి కాంపిటెన్సీ సపరేట్గా ఇచ్చి ఉంటారు. ఎవ్రీథింగ్ ఈజ్ వెరీ మచ్ క్లియర్లీ గివెన్. అండ్ దెన్ మాస్టర్ టైం టేబుల్. ఓకే, get it verified from all the concerned HVs, and then finally for implementation we work it. This is the scheduling. And that's it. Okay, done. Thank you. రేపటికి రిపోర్ట్ తయారు చేయడానికి ఎవరిద్దరు? మార్నింగ్ సెషన్ ఒకళ్ళు, ఈవినింగ్ సెషన్ ఒకళ్ళు. లేదు ఇది చాలా ఈజీ. There are a lot of things to be integrated. Yes ma'am. And 10 years back, ఆల్మోస్ట్ 2012లో నేను జాయిన్ అయినప్పుడు మన చైర్మన్ సార్ అడిగారు యాక్చువల్లీ ఇయర్లీ షెడ్యూల్. స్టాటిస్టిషియన్ కూర్చొని పెద్ద చాట్ వేసుకొని కూర్చుంటే ఏం చేస్తున్నారు సార్ అంటే 1 year షెడ్యూల్ ఏమన్నారు సార్ అందుకని వేస్తున్నా అన్నారు. అసలు అది పాసిబుల్లా అని ఫీల్ అయ్యాను ఆ రోజు. అఫ్ కోర్స్ 10 years తర్వాత అది నేనే చేయాల్సి వచ్చింది, అది వేరే విషయం. ఎన్ఎంసీ ఇప్పుడు 10 years తర్వాత అడిగారు యాక్చువల్లీ షెడ్యూలింగ్. ఓకేనా, దట్ ఈస్ ద పవర్ ఆఫ్ విజన్ యాక్చువల్లీ. రేపు మార్నింగ్ పవన్ గ్రూప్ అయిపోయిందా? ఓకే.